We have all been spending more time inside these days. We therefore need to think about the air we're breathing indoors, as there can be pollution in the air inside as well as outside. What is indoor air pollution, and where does it come from? Indoor air pollution is in our homes, schools, and workplaces. It comes in the form of pollution particles, gases, chemicals, and mold generated when we cook or use a fire, and from personal care, cleaning, and building products that we use inside. So, what can we do to have clean air indoors? First, get some fresh air in. Opening windows when you are cooking or cleaning can help stop air pollution building up inside. Secondly, look at your heating. If you have an open fire or wood burner, only use it when you really need it. And when you do use it, choose well-seasoned or ready-to-burn labeled wood. Also, make sure you are regularly servicing your boiler. This should be done once a year by a gas-safe engineer. Finally, think about the products you are using inside. Choose fragrance-free cleaning products and look for the low VOC label on paints and other DIY materials. For more information on air pollution and how you can protect your health, both indoors and when out and about, head to the Clean Air Hub at www.cleanairhub.org.uk. What is indoor air pollution, and where does it come from? Indoor air pollution is in our homes, schools, and workplaces. It comes in the form of pollution particles, gases, chemicals, and mold generated when we cook or use a fire, and from personal care, cleaning, and building products that we use inside. So, what can we do to have clean air indoors? First, get some fresh air in. Opening windows when you are cooking or cleaning can help stop air pollution building up inside. Secondly, look at your heating. If you have an open fire or wood burner, only use it when you really need it. And when you do use it, choose well-seasoned or ready-to-burn labeled wood. Also, make sure you are regularly servicing your boiler. This should be done once a year by a gas-safe engineer. Finally, think about the products you are using inside. Choose fragrance-free cleaning products and look for the low VOC label on paints and other DIY materials. For more information on air pollution and how you can protect your health, both indoors and when out and about, head to the Clean Air Hub at www.cleanairhub.org.uk.
Hello, I'm Geraint Davis. I'm the MP for Swansea West. I chair the all-party group on air pollution. Just wanted to wish you a very happy Clean Air Day. I hope people are settling back in school, taking precautions, social distancing, washing your hands, etc., wearing masks in common places, and if wherever possible, cycling and walking to school. It's important we use our cars much less. People working from home is a very good idea if they can. And using public transport we should have more investment in public transport, keeping social distancing and masks on as well. But I'm very much in favour of indoor air pollution being improved as well by using the right cleaning products, having the right ventilation, having hedges around schools, not having people loitering outside or idling in cars with their engines on. And if they are bringing their children to school, making sure that as I say, they're not idling outside. So there's a lot that can be done by government. You should be pressing your local MP to support a clean air bill and more support for clean air, partly because, of course, the coronavirus, it has higher levels of infection and mortality from pollution. So adding it all up, stay safe, look after each other, help the NHS and create less pollution, which already causes tens of thousands of deaths, let alone COVID. We need a cleaner, greener future, and wish you well for the day. Thanks very much.
Over the lockdown period, we saw a significant drop in air pollution across the UK. This is mainly due to the reduction in car use, with 4 out of 5 UK adults noticing less road traffic in their local area during lockdown. But it is important that we try to keep air pollution down for good. The Secretary of State for Transport, Grant Shapps, said, "We recognise this moment for what it is, a once-in-a-generation opportunity to deliver a lasting transformative change in how we make short journeys in our towns and cities." So, how can the public help to keep air pollution down? 1. Give your car a holiday. Walk, scoot, cycle, or take public transport when you can. 2. Don't idle the engine. Turn off the engine when the car isn't moving. 3. Go electric. Try hiring an electric car, taxi, or test drive an electric vehicle. 4. Get involved with Clean Air Day. To find out more about air pollution and how you can protect yourself, head to the Clean Air Hub.
I regularly see patients who are impacted by air pollution. I work within the hospital and also within GP practices looking after people with respiratory disease. Many of the patients, we can actually probably say that air pollution has contributed to their actual diagnosis of respiratory disease, such as asthma or COPD, as well as many of the patients I see, their control is exacerbated by air pollution. Many of the COPD patients may have symptoms of sputum, increased shortness of breath, wheezing caused by air pollution, and also very similar for our asthma patients as well.
I really commonly and regularly see patients who are impacted by air pollution. I regularly, on a weekly basis, diagnose patients with lung cancer who have never smoked. Much of their risk comes from air pollution.
It's very important for people with respiratory issues to receive information on air pollution so they can, for instance, understand that, for instance, when there's a spike in air pollution, what impact that may have on maybe their asthma or things like that.
So I'm really concerned that healthcare professionals, doctors, nurses, whatever, have never raised the issue of air pollution with me and with my small children. And in particular, we were living on a busy road in Brixton, and my son at 10 weeks was hospitalised for 2 nights with bronchiolitis. And only much later did it occur to me that there could be a link to air pollution.
Unfortunately, I do not think that healthcare professionals have enough resources, and certainly almost next to no training in discussing air pollution, both with their patients as well as their friends and colleagues and decision makers within their organisations. I got interested in this and really had to do my research. In 6 years at medical school and now 17 years as a consultant physician, I've never once, unless I instigated the training or invited an expert speaker to come to us, have ever had any training on air pollution, despite it being something that kills 40,000 people a year across the UK.
Healthcare professionals do not have enough training and resources to support our patients with the impact of air pollution. During my training through my career as a consultant pharmacist, I have never received any training on air pollution, only what I've received through the media and from reading. I would like to see the health sector support the training and education of all healthcare professionals, but particularly with pharmacists. We should start to train our pharmacists right from undergraduate level all the way through their continuing professional development to be aware of the effects of air pollution, so that all of us can support our patients in making sure they have the right facts and can avoid the effects of air pollution going forward with their disease.
Doctors are the right people now to be fronting this message. So that's what the health sector can actually do. And it will also be nice to go into a hospital where there are leaflets there about different things. And it would be nice to actually find one on air pollution and the damages it does to the public's health, because it's from the cradle to the grave.
We all believe and trust so strongly in our doctors, our nurses, our midwives, and we really need you to be telling us that we need to take care on big roads, walk on back roads, think about when to open our windows, to drive less.
When I used to take my late daughter to hospital, and I must admit, getting her to Great Ormond Street, there was lots and lots of pollution on the way there. And I think directly outside the hospital as well is very important, because one of the things she used to complain about was people who were smoking outside the hospital. So maybe if we look at air pollution in a similar light, if air pollution is impacting on your breathing, then you shouldn't have idling cars or ambulances right outside entrances of hospital. So maybe hospitals can show their patients they are taking air pollution seriously, and this will help in discussion with their patients.
I would very much like to see a health campaign for air pollution, very similar to what we see with stop smoking, with flu vaccination, with weight loss. All of these are very important public health messages where we need to increase the awareness to our population.
I would say, in addition, that as scientifically literate and caring healthcare professionals, we have a responsibility as educators and activists to get the message out there. And that has to form the basis of a public health campaign based on science and evidence.
Hi, I'm Jane. I'm one of the main campaigners with Mums for Lungs. We're a campaign group set up in 2017 in London to campaign for clean air for our children and vulnerable people and everyone, really. One of our main campaign focuses is school streets, which is a scheme where roads are closed at drop-off and pick-up times around schools. And they are a great way to make streets safer, calmer and less polluted and help our children. I am going to share my screen. And then tell you a little bit about why we love school streets so much. There we go. So here you can see a couple of pictures of school streets where they have been closed and the kids are out on the street, they're scooting, they're walking, they don't have to worry about the cars. It's all good. So why do we love school streets so much? They reduce traffic and therefore pollution. 25% of rush hour traffic in London is cars doing the school run. So we really need to reduce that. They create a safer environment for everyone near and outside of school. They encourage active travel, and that improves health and learning outcomes for children. There's evidence that if children have travelled to school actively, walked or scooted or cycled, they've got that crazy energy out, and they're more able to sit down, concentrate, and learn better. They also raise awareness of air pollution, the need to reduce traffic, and they show people how great it can be when you close your road to traffic. They're an inroad into how things can be. Out of the 33 London boroughs, 27 are implementing school streets currently. The first one was in Camden in 2017. Pre-COVID, there were about 85 schemes in place across London, and progress was happening, but quite slowly. And by the end of this year, around 450 schemes should be implemented because of the response to COVID. So how do school streets work? They are temporary road closures around schools at drop-off and pick-up times in term time only. Only pedestrians and cyclists are allowed to use the roads at those times. There are exemptions though. Every council seems to do it slightly differently, but mostly residents, local businesses and blue badge holders are able to apply for exemptions. Signs are put up like these ones to inform drivers of the road closures, and barriers or cameras can be used to enforce. So either you put manual bollards or barriers across the road and people stand there, teachers or caretakers or whoever, stopping cars driving through and letting residents out. Outside London, or automatic number plate recognition cameras, which will detect when people go through and send fines, or allow fines to be sent to those people. Outside London, that's currently more difficult, but it is going to be the case that will be possible soon. So why emergency school streets? Well, these are this is what we're calling the schemes that are as a response to COVID. The government stated back in May that they've created new statutory guidance that allow for more school streets because COVID-19 provides us with big challenges in how to get around. There's reduced public transport, pavements are narrow, there's a lack of safe cycle routes, and more trips are being driven in response to this. Back in the height of lockdown, we were worried that would happen, and now it's the case that it is happening. So school streets are just a way of reducing that 25% of rush hour traffic and making it safer and better for our children. If implemented with bollards, school streets can prevent crowding at the gates. People can walk in the road instead to enable safe social distancing. Now, we've said that, but of course, with cameras, you could still walk in the road and everything, but there is always the chance that a car will come through by accident, or without those manual bollards in place, you do have to be more aware. Also, of course, research is suggesting links between air pollution and COVID. The air pollution can make the instance of COVID more severe and more damaging. So we need to be very mindful that we don't want everyone to just jump in their cars, emissions to rise, congestion. We just can't let that happen. So how to campaign for an emergency school street? We always say, join forces with other parents, create a working group, get all the concerned people you can together. And don't forget your residents, they're your allies. Be pragmatic about it. They may worry. Often residents do worry immediately. Oh, my road's being closed. I'm going to be stuck in my house. I can't get out. What's going on? Which is not true. And if you approach them at the beginning, then you can get them on side. They can understand the scheme. So it's about knowing your community and their concerns. Why do people need to drive down that particular road at that time? Come up with solutions. There are always mitigation measures like park and stride. People can park in a nearby car park and walk instead. Some schools have set up deals with with supermarkets where their parents are allowed to park in that supermarket car park at those times and walk the rest of the way if they have to drive on to work or whatever. We've got a template letter on our website where you can write a letter to your school, to your head, your councillors, your council. There's lots of statistics and data on there to help make the case for school streets. This is if obviously there's so many schemes coming in, but if your school is not one of those being announced by your council, you can use that to escalate your case. And really important to get your head teacher on board, because they're the ones that need to approach the council. They need to be up for it. If they're not up for it, the school won't be up for it. It's about pushing up from below from the parents and getting the council to come down and meet in the middle, and then hopefully the scheme works and is successful. Yes, and again, addressing concerns about teachers who might need to drive. You could use the park and stride for those, or mostly teachers often arrive before the children, of course. So actually they arrive and leave outside the hours of the scheme. Councils look more favourably on schools, or have tended to look more favourably on schools with a good track record of action on active travel. So if you've got gold TfL stars, or those with safety issues, so that is worth bearing in mind. So next steps, you've got your school street, you're loving it. What do you do? Well, there's usually a consultation process. Once it's up and running, celebrate it. We have posters like this available on our website that you can put up on your street, and do just keep talking about it and telling the people, the policymakers, that you love it. Email your councillors, your cabinet member for transport environment, pass on those positive thoughts. And also, if there are issues with the scheme that you don't like, that other people don't like, always worth feeding those back and trying to get the scheme changed for the better. If your council has set up a commonplace website for immediate feedback, because a lot of these schemes are going in with experimental traffic orders, which I think means you can consult at the same time as the scheme is happening. And various councils are using commonplace, so you have a map of the area and you can put your concerns or just say, I love this. So add your comments there, encourage others to, and then there might be another more formal consultation after about 6 months. And if there is, again, respond and encourage others to, because often the people that don't like things will shout the loudest, and then the people that do like things just go, oh yeah, that's quite nice, and then don't tell anyone, and then yeah. So there's a load of resources on school streets if you'd like to know more. Hackney Council did a brilliant toolkit a couple of years ago, which describes how they set up the scheme and the best sort of their notion of best practice for it. On our website, we've got the emergency template letter, our flyers, our campaigning guide, and those posters. We've got a Facebook group called Mums for Lung School Streets, which you can join. There's over 1,000 people there chatting about it, offering advice and information. There's a great evidence review recently published by Sustrans and Edinburgh Napier University, which talked to various councils who've introduced the scheme and discovered information about displacement. Where there's often worries that traffic will be displaced to the next road along, and actually that didn't necessarily turn out to be the case. So it's really useful to point to people who are worried, particularly residents maybe who are worried about the scheme. Sustrans has stuff on its website. There's a School Streets Initiative website that's very good. Living Streets have stuff about it, and Car Free Day London have an Ask for It tool on their website, which enables you to put your postcode in, and then it will just generate automatically a way to ask your councillors and cabinet members for the scheme. And finally, please get in touch. We want to help you. Email us. We're always happy to chat on the phone about things, offer advice. And just to end on some positivity, one school street can reach approximately 300 pupils, 50 staff, 550 parents, carers, 100 residents. That's 1,000 people, we're saying. And with 450 schemes going in, or more even, that's 45,000 extra people who, I'm just checking my maths on that, 450. Oh, anyway, that's a lot of people who were not necessarily aware of air pollution before, didn't realise short drives are bad and can easily be substituted with other methods if necessary, and that a lot more people aware that we need to change and make the world a better place. So that is the end of my presentation. Thank you.
I'm here with the Minister for Walking and Cycling, Chris Harris. We're here at Nightingale School in Hackney to celebrate Living Streets Walk to School Week. This is an amazing school which has just put in a school street, and as a result, all the children are walking, cycling and scooting to school. Chris, what do you think?
Well, it's actually quite extraordinary because I've just experienced a school run where the noisiest thing was a scooter, and everything was calm. The teacher was able to greet the kids and ask them about their books and not to worry about moving parents on from parking inappropriately. And I will say it was a joy.
It's a nice, relaxing start to the day.
Yeah, you can't really say that about many school runs, so I think it's a massive effort that can be done.
So let's hope we get many more of these. It's a beautiful way to start the day. It cuts air pollution around the school. It's good for the children and it's good for the planet.
Two out of 5 adults in the UK do not think that air pollution does their body any long-term harm. So are they right? The particles and gases that make up air pollution enter our body through our lungs as we breathe. They slip past the defenses of our body by breaking through the protective barriers that exist in our lungs. The long-term risks of being exposed to pollution includes diseases that affect the lungs, such as asthma, bacterial pneumonia, and even the occurrence of lung cancer. But the risk to pollution does not stop in the lungs. Air pollution goes beyond the depth of the lungs, where it interferes with the transport of oxygen from the air into the bloodstream. Here, pollution causes inflammation and constriction of your blood vessels to cause a rise in blood pressure and potentially leading to blockage of blood vessels. This then increases the danger of getting strokes or heart disease. Beyond this, there's even recent evidence to indicate that air pollution can reach the brain, thus contributing to brain conditions such as dementia. To find out more about air pollution and how you can protect yourself, please head to the Clean Air Hub.
This year, we were all forced to stop and take a breath. And as we all get back to normal, let's take this chance to change normal. Air pollution harms your health and the environment. But there's lots of simple things we can all do to make our air cleaner. Support Clean Air Day on October the 8th and help us make every day a Clean Air Day. For more information and free resources for schools, workplaces and more, visit cleanairday.org.uk/Scotland.
Outdoor air pollution often comes in the form of pollution particles and gases from transport, industry, construction, and wood-burning stoves or fires. The pollution can enter our bodies and harm our health. What can we do to cut air pollution outdoors? Firstly, leave the car at home as much as you can and walk, scoot, cycle, or take public transport, observing the current COVID-19 guidance. And when you are out and about, use quieter streets to avoid polluted main roads. Secondly, if you can't avoid driving, then look at switching to an electric vehicle. And when you are driving, don't idle. Turn the engine off when the car isn't moving and it is safe to do so. Finally, look at your deliveries. To reduce the number of delivery vans and lorries on our streets, choose to have things delivered together. Pick the click and collect option and look out for green delivery slots, which are highlighted delivery times that already have a delivery booked in the same area. For more information on air pollution and how you can protect your health when out and about and indoors, head to the Clean Air Hub at www.cleanairhub.org.uk.
I'm sharing this video to show my support to the Clean Air Day on October the 8th, which is the UK's largest air pollution campaign. Environment and health are interconnected, and particularly when it comes to non-communicable diseases, or how we call those NCDs, mainly cardiovascular diseases, chronic respiratory diseases, diabetes, and cancers. Air pollution causes around 6 million NCD deaths each year, making it one of the main risk factors for health, along with tobacco use, harmful use of alcohol, physical inactivity, and unhealthy diets. In the UN Task Force on the Prevention and Control of NCDs, we developed UN system-wide approaches to support countries to tackle air pollution. And we see that solutions require coordinated action across the broad range of sectors: environment, energy, health, transportation, housing, agriculture, many others, and also need governments, civil society, and the private sector to all be engaged. We also work on economic analysis and quantification of the air pollution effects on health, workforce, and economy as a whole. It is important to be able to show to the decision makers that clean air friendly regulation, fiscal policies, clean technologies are a win-win tools that both benefit the health of the population but are also cost effective. And together with the policy options, our personal choices really matter. For example, selecting cycling or walking or taking a public transport instead of the personal car might significantly reduce carbon emissions and also make you move, which is beneficial for health. So please consider being personally engaged and join Clean Air Day campaign. I thank you.
Two-thirds of UK adults agree that tackling air pollution should be part of the UK's coronavirus recovery strategy. We all know that air pollution is bad for our health, but why is tackling it now more important than ever? The recent global coronavirus pandemic has increased concern on how air quality impacts the spread and contraction of viruses. And recent studies suggest that high levels of air pollution have significantly worsened symptoms and increased the number of deaths from coronavirus. There is more research to be done. We need to understand what factors air pollution actually changes in order to make people more susceptible. One example of this has been the demonstration that air pollution increases the receptors for coronavirus present in the nose. For more information on air pollution and how we can help, head to the Clean Air Hub.
I'm Jane Goodall. When I was just 2, I was given a toy chimpanzee, Jubilee. I was born loving animals. I even took earthworms into my bed just so I could study them. It was Dr. Dolittle and Tarzan who inspired me. Heroes don't have to be real so long as they inspire you. I was told I was just a girl. So what could I do? I'll tell you. I went where wild animals were. I worked hard and got my PhD. I never treated chimpanzees as just things. I questioned the experts. I discovered new behaviors. I observed the chimps. I empathized with the chimpanzees. I learned that they had dark moments. But mostly I blazed a trail. I validated all that I believed through logic and intuition. Before COVID, I traveled 300 days a year. My heart is still 100% in love with what I have always loved, animals and the environment. If I'm your hero, it's because you too want to act on behalf of all living things and the planet that we share.
Happy Clean Air Day. We are very happy to celebrate it. Just a little reminder that every year, unfortunately, we have 7 million premature deaths caused by the bad quality of the air we breathe. And you know how many times we breathe a day? More than 20,000. Can you imagine? Imagine that any time you breathe, you are breathing to your lungs, into your respiratory system, something that is not of good quality. That's why we need to be very active. We need to make sure we promote a clean air day on the 8th of October, but a clean air day every day in our life. Go for it.
We have all been spending more time inside these days. We therefore need to think about the air we're breathing indoors, as there can be pollution in the air inside as well as outside. What is indoor air pollution, and where does it come from? Indoor air pollution is in our homes, schools, and workplaces. It comes in the form of pollution particles, gases, chemicals, and mold generated when we cook or use a fire, and from personal care, cleaning, and building products that we use inside. So, what can we do to have clean air indoors? First, get some fresh air in. Opening windows when you are cooking or cleaning can help stop air pollution building up inside. Secondly, look at your heating. If you have an open fire or wood burner, only use it when you really need it. And when you do use it, choose well-seasoned or ready-to-burn labelled wood. Also make sure you are regularly servicing your boiler. This should be done once a year by a gas-safe engineer. Finally, think about the products you are using inside. Choose fragrance-free cleaning products and look for the low VOC label on paints and other DIY materials. For more information on air pollution and how you can protect your health, both indoors and when out and about, head to the Clean Air Hub at www.cleanairhub.org.uk.
Hello, I'm Geraint Davis. I'm the MP for Swansea West. I chair the all-party group on air pollution. Just wanted to wish you a very happy Clean Air Day. I hope people are settling back in school, taking precautions, social distancing, washing your hands, etc., wearing masks in common places, and if wherever possible, cycling and walking to school. It's important we use our cars much less. People working from home is a very good idea if they can. And using public transport we should have more investment in public transport, keeping social distancing and masks on as well. But I'm very much in favour of indoor air pollution being improved as well by using the right cleaning products, having the right ventilation, having hedges around schools, not having people loitering outside or idling in cars with their engines on. And if they are bringing their children to school, making sure that as I say, they're not idling outside. So there's a lot that can be done by government. You should be pressing your local MP to support a clean air bill and more support for clean air, partly because, of course, the coronavirus, it has higher levels of infection and mortality from pollution. So adding it all up, stay safe, look after each other, help the NHS and create less pollution, which already causes tens of thousands of deaths, let alone COVID. We need a cleaner, greener future, and wish you well for the day. Thanks very much.
Over the lockdown period, we saw a significant drop in air pollution across the UK. This is mainly due to the reduction in car use, with 4 out of 5 UK adults noticing less road traffic in their local area during lockdown. But it is important that we try to keep air pollution down for good. The Secretary of State for Transport, Grant Shapps, said, "We recognise this moment for what it is, a once-in-a-generation opportunity to deliver a lasting transformative change in how we make short journeys in our towns and cities." So, how can the public help to keep air pollution down? 1. Give your car a holiday. Walk, scoot, cycle, or take public transport when you can. 2. Don't idle the engine. Turn off the engine when the car isn't moving. 3. Go electric. Try hiring an electric car, taxi, or test drive an electric vehicle. 4. Get involved with Clean Air Day. To find out more about air pollution and how you can protect yourself, head to the Clean Air Hub.
I regularly see patients who are impacted by air pollution. I work within the hospital and also within GP practices looking after people with respiratory disease. Many of the patients, we can actually probably say that air pollution has contributed to their actual diagnosis of respiratory disease, such as asthma or COPD, as well as many of the patients I see, their control is exacerbated by air pollution. Many of the COPD patients may have symptoms of sputum, increased shortness of breath, wheezing caused by air pollution, and also very similar for our asthma patients as well.
I really commonly and regularly see patients who are impacted by air pollution. I regularly, on a weekly basis, diagnose patients with lung cancer who have never smoked. Much of their risk comes from air pollution.
It's very important for people with respiratory issues to receive information on air pollution so they can, for instance, understand that, for instance, when there's a spike in air pollution, what impact that may have on maybe their asthma or things like that.
So I'm really concerned that healthcare professionals, doctors, nurses, whatever, have never raised the issue of air pollution with me and with my small children. And in particular, we were living on a busy road in Brixton. My son at 10 weeks was hospitalised for 2 nights with bronchiolitis. And only much later did it occur to me that there could be a link to air pollution.
Unfortunately, I do not think that healthcare professionals have enough resources and certainly almost next to no training in discussing air pollution, both with their patients as well as their friends and colleagues and decision makers within their organisations. I got interested in this and really had to do my research. In 6 years at medical school and now 17 years as a consultant physician, I've never once, unless I instigated the training or invited an expert speaker to come to us, have ever had any training on air pollution, despite it being something that kills 40,000 people a year across the UK.
Healthcare professionals do not have enough training and resources to support our patients with the impact of air pollution. During my training through my career as a consultant pharmacist, I have never received any training on air pollution, only what I've received through the media and from reading. I would like to see the health sector support the training and education of all healthcare professionals, but particularly with pharmacists. We should start to train our pharmacists right from undergraduate level all the way through their continuing professional development to be aware of the effects of air pollution so that all of us can support our patients in making sure they have the right facts and can avoid the effects of air pollution going forward with their disease.
Doctors are the right people now to be fronting this message. So that's what the health sector can actually do. And it will also be nice to go into a hospital where there are leaflets there about different things. And it would be nice to actually find one on air pollution and the damages it does to the public's health, because it's from the cradle to the grave.
We all believe and trust so strongly in our doctors, our nurses, our midwives, and we really need you to be telling us that we need to take care on big roads, walk on back roads, think about when to open our windows, to drive less.
When I used to take my late daughter to hospital, and I must admit, getting her to Great Ormond Street, there was lots and lots of pollution on the way there. And I think directly outside the hospital was very important, because one of the things she used to complain about was people who were smoking outside the hospital. So maybe if we look at air pollution in a similar light, if air pollution is impacting on your breathing, then you shouldn't have idling cars or ambulances right outside entrances of hospital. So maybe hospitals can show their patients they are taking air pollution seriously, and this will help in discussion with their patients.
I would very much like to see a health campaign for air pollution, very similar to what we see with stop smoking, with flu vaccination, with weight loss, All of these are very important public health messages where we need to increase the awareness to our population.
I would say in addition that as scientifically literate and caring healthcare professionals, we have a responsibility as educators and activists to get the message out there. And that has to form the basis of a public health campaign based on science and evidence.
Hi, I'm Jane. I'm one of the main campaigners with Mums for Lungs. We're a campaign group set up in 2017 in London to campaign for clean air for our children and vulnerable people and everyone, really. One of our main campaign focuses is school streets, which is a scheme where roads are closed at drop-off and pick-up times around schools. And they are a great way to make streets safer, calmer and less polluted and help our children. I am going to share my screen. And then tell you a little bit about why we love school streets so much. There we go. So here you can see a couple of pictures of school streets where they have been closed and the kids are out on the street, they're scooting, they're walking, they don't have to worry about the cars. It's all good. So why do we love school streets so much? They reduce traffic and therefore pollution. 25% of rush hour traffic in London is cars doing the school run. So we really need to reduce that. They create a safer environment for everyone near and outside of school. They encourage active travel, and that improves health and learning outcomes for children. There's evidence that if children have travelled to school actively, walked or scooted or cycled, they've got that crazy energy out, and they're more able to sit down, concentrate, and learn better. They also raise awareness of air pollution, the need to reduce traffic, and they show people how great it can be when you close your road to traffic. They're an inroad into how things can be. Out of the 33 London boroughs, 27 are implementing school streets currently. The first one was in Camden in 2017. Pre-COVID, there were about 85 schemes in place across London, and progress was happening, but quite slowly. And by the end of this year, around 450 schemes should be implemented because of the response to COVID. So how do school streets work? They are temporary road closures around schools at drop-off and pick-up times in term time only. Only pedestrians and cyclists are allowed to use the roads at those times. There are exemptions though. Every council seems to do it slightly differently, but mostly residents, local businesses and blue badge holders are able to apply for exemptions. Signs are put up like these ones to inform drivers of the road closures, and barriers or cameras can be used to enforce. So either you put manual bollards or barriers across the road and people stand there, teachers or caretakers or whoever, stopping cars driving through and letting residents out. Outside London, or automatic number plate recognition cameras, which will detect when people go through and send fines, or allow fines to be sent to those people. Outside London, that's currently more difficult, but it is going to be the case that will be possible soon. So why emergency school streets? Well, these are this is what we're calling the schemes that are as a response to COVID. The government stated back in May that they've created new statutory guidance that allow for more school streets because COVID-19 provides us with big challenges in how to get around. There's reduced public transport, pavements are narrow, there's a lack of safe cycle routes, and more trips are being driven in response to this. Back in the height of lockdown, we were worried that would happen, and now it's the case that it is happening. So school streets are just a way of reducing that 25% of rush hour traffic and making it safer and better for our children. If implemented with bollards, school streets can prevent crowding at the gates. People can walk in the road instead to enable safe social distancing. Now, it's we've said that, but of course, with cameras, you could still walk in the road and everything, but there is always the chance that a car will come through by accident, or without those manual bollards in place, it's you do have to be more aware. Also, of course, research is suggesting links between air pollution and COVID. The air pollution can make the instance of COVID more severe and more damaging. So we need to be very mindful that we don't want to everyone to just jump in their cars, emissions to rise, congestion. We just can't let that happen. So how to campaign for an emergency school street? We always say, join forces with other parents, create a working group, get all the concerned people you can together. And don't forget your residents, they're your allies. Be pragmatic about it. They may worry. Often residents do worry immediately. Oh, my road's been closed. I'm going to be stuck in my house. I can't get out. What's going on? Which is not true. And if you approach them at the beginning, then you can get them on side. They can understand the scheme. So it's about knowing your community and their concerns. Why do people need to drive down that particular road at that time? Come up with solutions. There are always mitigation measures like park and stride. People can park in a nearby car park and walk instead. Some schools have set up deals with with supermarkets where their parents are allowed to park in that supermarket car park at those times and walk the rest of the way if they have to drive on to work or whatever. We've got a template letter on our website where you can write a letter to your school, to your head, your councillors, your council. There's lots of statistics and data on there to help make the case for school streets. This is if obviously there's so many schemes coming in, but if your school is not one of those being announced by your council, you can use that to escalate your case. And really important to get your head teacher on board, because they're the ones that need to approach the council. They need to be up for it. If they're not up for it, the school won't be up for it. It's about pushing up from below from the parents and getting the council to come down and meet in the middle, and then hopefully the scheme works and is successful. Yes, and again, addressing concerns about teachers who might need to drive. You could use the park and stride for those, or mostly teachers often arrive before the children, of course. So actually they arrive and leave outside the hours of the scheme. Councils look more favourably on schools, or have tended to look more favourably on schools, with a good track record of action on active travel. So if you've got gold TfL stars, or those with safety issues, so that is worth bearing in mind. So next steps, you've got your school street, you're loving it. What do you do? Well, there's usually a consultation process. Once it's up and running, celebrate it. We have posters like this available on our website that you can put up on your street, and do just keep talking about it and telling the people, the policymakers, that you love it. Email your councillors, your cabinet member for transport environment, pass on those positive thoughts. And also, if there are issues with the scheme that you don't like, that other people don't like, always worth feeding those back and trying to get the scheme changed for the better. If your council has set up a commonplace website for immediate feedback, because a lot of these schemes are going in with experimental traffic orders, which I think means you can consult at the same time as the scheme is happening. And various councils are using commonplace, so you have a map of the area and you can put your concerns, or just say, I love this. So add your comments there, encourage others to, and then there might be another more formal consultation after about 6 months. And if there is, again, respond and encourage others to, because often the people that don't like things will shout the loudest, and then the people that do like things just go, oh yeah, that's quite nice, and then don't tell anyone, and then yeah. So there's a load of resources on school streets if you'd like to know more. Hackney Council did a brilliant toolkit a couple of years ago, which describes how they set up the scheme and the best sort of their notion of best practice for it. On our website, we've got the emergency template letter, our flyers, our campaigning guide, and those posters. We've got a Facebook group called Mums for Lung School Streets, which you can join. There's over 1,000 people there chatting about it, offering advice and information. There's a great evidence review recently published by Sustrans and Edinburgh Napier University, which talked to various councils who've introduced the scheme and discovered information about displacement. Where there's often worries that traffic will be displaced to the next road along, and actually that didn't necessarily turn out to be the case. So it's really useful to point to people who are worried, particularly residents maybe who are worried about the scheme. Sustrans has stuff on its website. There's a School Streets Initiative website that's very good. Living Streets have stuff about it, and Car Free Day London have an Ask for It tool on their website, which enables you to put your postcode in, and then it will just generate automatically a way to ask your counsellors and cabinet members for the scheme. And finally, yeah, please get in touch. We want to help you. Email us. We're always happy to chat on the phone about things, offer advice. And just to end on some positivity, one school street can reach approximately 300 pupils, 50 staff, 550 parents, carers, 100 residents. That's 1,000 people, we're saying. And with 450 schemes going in, or more even, that's 45,000 extra people who, I'm just checking my maths on that, 450. Oh, anyway, that's a lot of people who who were not necessarily aware of air pollution before, didn't realise short drives are bad and can easily be substituted with other methods if necessary, and that a lot more people aware that we need to change and make the world a better place. So that is the end of my presentation. Thank you.
I'm here with the Minister for Walking and Cycling, Chris Harris. We're here at Nightingale School in Hackney to celebrate Living Streets Walk to School Week. This is an amazing school which has just put in a school street, and as a result, all the children are walking, cycling and scooting to school. Chris, what do you think?
Well, it's actually quite extraordinary because I've just experienced a school run where the noisiest thing was a scooter, and everything was calm. The teacher was able to greet the kids and ask them about their books and not to worry about moving parents on from parking inappropriately. And I'd also say it was a joy.
It's a nice, relaxing start to the day.
Yeah, you can't really say that about many school runs, so I think it's a massive advert for what can be done.
So let's hope we get many more of these. It's a useful way to start the day. It cuts air pollution around the school. It's good for the children and it's good for the planet.
Two out of 5 adults in the UK do not think that air pollution does their body any long-term harm. So are they right? The particles and gases that make up air pollution enter our body through our lungs as we breathe. They slip past the defenses of our body by breaking through the protective barriers that exist in our lungs. The long-term risks of being exposed to pollution includes diseases that affect the lungs, such as asthma, bacterial pneumonia, and even the occurrence of lung cancer. But the risk to pollution does not stop in the lungs. Air pollution goes beyond the depth of the lungs, where it interferes with the transport of oxygen from the air into the bloodstream. Here, pollution causes inflammation and constriction of your blood vessels to cause a rise in blood pressure and potentially leading to blockage of blood vessels. This then increases the danger of getting strokes or heart disease. Beyond this, there's even recent evidence to indicate that air pollution can reach the brain, thus contributing to brain conditions such as dementia. To find out more about air pollution and how you can protect yourself, please head to the Clean Air Hub.
This year, we were all forced to stop and take a breath. And as we all get back to normal, let's take this chance to change normal. Air pollution harms your health and the environment. But there's lots of simple things we can all do to make our air cleaner. Support Clean Air Day on October the 8th and help us make every day a Clean Air Day. For more information and free resources for schools, workplaces and more, visit cleanairday.org.uk/Scotland.
Outdoor air pollution often comes in the form of pollution particles and gases from transport, industry, construction, and wood-burning stoves or fires. The pollution can enter our bodies and harm our health. What can we do to cut air pollution outdoors? Firstly, leave the car at home as much as you can and walk, scoot, cycle, or take public transport, observing the current COVID-19 guidance. And when you are out and about, use quieter streets to avoid polluted main roads. Secondly, if you can't avoid driving, then look at switching to an electric vehicle. And when you are driving, don't idle. Turn the engine off when the car isn't moving and it is safe to do so. Finally, look at your deliveries. To reduce the number of delivery vans and lorries on our streets, choose to have things delivered together. Pick the click and collect option and look out for green delivery slots, which are highlighted delivery times that already have a delivery booked in the same area. For more information on air pollution and how you can protect your health when out and about and indoors, head to the Clean Air Hub at www.cleanairhub.org.uk.
I'm sharing this video to show my support to the Clean Air Day on October the 8th, which is the UK's largest air pollution campaign. Environment and health are interconnected, and particularly when it comes to non-communicable diseases, or how we call those NCDs, mainly cardiovascular diseases, chronic respiratory diseases, diabetes, and cancers. Air pollution causes around 6 million NCD deaths each year, making it one of the main risk factors for health, along with tobacco use, harmful use of alcohol, physical inactivity, and unhealthy diets. In the UN Task Force on the Prevention and Control of NCDs, we developed UN system-wide approaches to support countries to tackle air pollution. And we see that solutions require coordinated action across the broad range of sectors: environment, energy, health, transportation, housing, agriculture, many others, and also need governments, civil society, and the private sector to all be engaged. We also work on economic analysis and quantification of the air pollution effects on health, workforce, and economy as a whole. It is important to be able to show to the decision makers that clean air friendly regulation, fiscal policies, clean technologies are a win-win tools that both benefit the health of the population but are also cost effective. And together with the policy options, our personal choices really matter. For example, selecting cycling or walking or taking a public transport instead of the personal car might significantly reduce carbon emissions and also make you move, which is beneficial for health. So please consider being personally engaged and join Clean Air Day campaign. I thank you.
Two-thirds of UK adults agree that tackling air pollution should be part of the UK's coronavirus recovery strategy. We all know that air pollution is bad for our health, but why is tackling it now more important than ever? The recent global coronavirus pandemic has increased concern on how air quality impacts the spread and contraction of viruses. And recent studies suggest that high levels of air pollution have significantly worsened symptoms and increased the number of deaths from coronavirus. There is more research to be done. We need to understand what factors air pollution actually changes in order to make people more susceptible. One example of this has been the demonstration that air pollution increases the receptors for coronavirus present in the nose. For more information on air pollution and how we can help, head to the Clean Air Hub.
I'm Jane Goodall. When I was just 2, I was given a toy chimpanzee, Jubilee. I was born loving animals. I even took earthworms into my bed just so I could study them. It was Dr. Dolittle and Tarzan who inspired me. Heroes don't have to be real so long as they inspire you. I was told I was just a girl. So what could I do? I'll tell you. I went where wild animals were. I worked hard and got my PhD. I never treated chimpanzees as just things. I questioned the experts. I discovered new behaviors. I observed the chimps. I empathized with the chimpanzees. I learned that they had dark moments. But mostly I blazed a trail. I validated all that I believed through logic and intuition. Before COVID, I traveled 300 days a year. My heart is still 100% in love with what I have always loved, animals and the environment. If I'm your hero, it's because you too want to act on behalf of all living things and the planet that we share.
Happy Clean Air Day. We are very happy to celebrate it. Just a little reminder that every year, unfortunately, we have 7 million premature deaths caused by the bad quality of the air we breathe. And you know how many times we breathe a day? More than 20,000. Can you imagine? Imagine that any time you breathe, you are breathing into your lungs, into your respiratory system, something that is not of good quality. That's why we need to be very active. We need to make sure we promote a clean air day on the 8th of October, but a clean air day every day in our life. Go for it.
We have all been spending more time inside these days. We therefore need to think about the air we're breathing indoors, as there can be pollution in the air inside as well as outside. What is indoor air pollution, and where does it come from? Indoor air pollution is in our homes, schools, and workplaces. It comes in the form of pollution particles, gases, chemicals, and mold generated when we cook or use a fire, and from personal care, cleaning, and building products that we use inside. So, what can we do to have clean air indoors? First, get some fresh air in. Opening windows when you are cooking or cleaning can help stop air pollution building up inside. Secondly, look at your heating. If you have an open fire or wood burner, only use it when you really need it. And when you do use it, choose well-seasoned or ready to burn labeled wood. Also, make sure you are regularly servicing your boiler. This should be done once a year by a gas-safe engineer. Finally, think about the products you are using inside. Choose fragrance-free cleaning products and look for the low VOC label on paints and other DIY materials. For more information on air pollution and how you can protect your health, both indoors and when out and about, head to the Clean Air Hub at www.cleanairhub.org.uk.
Hello, I'm Geraint Davis. I'm the MP for Swansea West. I chair the all-party group on air pollution. Just wanted to wish you a very happy Clean Air Day. I hope people are settling back in school, taking precautions, social distancing, washing your hands, etc., wearing masks in common places, and if wherever possible, cycling and walking to school. It's important we use our cars much less. People working from home is a very good idea if they can. And using public transport we should have more investment in public transport, keeping social distancing and masks on as well. But I'm very much in favour of indoor air pollution being improved as well by using the right cleaning products, having the right ventilation, having hedges around schools, not having people loitering outside or idling in cars with their engines on. And if they are bringing their children to school, making sure that as I say, they're not idling outside. So there's a lot that can be done by government. You should be pressing your local MP to support a clean air bill and more support for clean air, partly because, of course, the coronavirus, it has higher levels of infection and mortality from pollution. So adding it all up, stay safe, look after each other, help the NHS and create less pollution, which already causes tens of thousands of deaths, let alone COVID. We need a cleaner, greener future, and wish you well for the day. Thanks very much.
Over the lockdown period, we saw a significant drop in air pollution across the UK. This is mainly due to the reduction in car use, with 4 out of 5 UK adults noticing less road traffic in their local area during lockdown. But it is important that we try to keep air pollution down for good. The Secretary of State for Transport, Grant Shapps, said, "We recognise this moment for what it is, a once-in-a-generation opportunity to deliver a lasting transformative change in how we make short journeys in our towns and cities." So, how can the public help to keep air pollution down? 1. Give your car a holiday. Walk, scoot, Cycle or take public transport when you can. 2. Don't idle the engine. Turn off the engine when the car isn't moving. 3. Go electric. Try hiring an electric car, taxi, or test drive an electric vehicle. 4. Get involved with Clean Air Day. To find out more about air pollution and how you can protect yourself, head to the Clean Air Hub.
I regularly see patients who are impacted by air pollution. I work within the hospital and also within GP practices looking after people with respiratory disease. Many of the patients, we can actually probably say that air pollution has contributed to their actual diagnosis of respiratory disease, such as asthma or COPD, as well as many of the patients I see, their control is exacerbated by air pollution. Many of the COPD patients may have symptoms of sputum, increased shortness of breath, wheezing caused by air pollution, and also very similar for asthma patients as well.
I really commonly and regularly see patients who are impacted by air pollution. I regularly, on a weekly basis, diagnose patients with lung cancer who have never smoked. Much of their risk comes from air pollution.
It's very important for people with respiratory issues to receive information on air pollution so they can, for instance, understand that, for instance, when there's a spike in air pollution, what impact that may have on maybe their asthma or things like that.
So I'm really concerned that healthcare professionals, doctors, nurses, whatever, have never raised the issue of air pollution with me and with my small children. And in particular, we were living on a busy road in Brixton. My son at 10 weeks was hospitalised for 2 nights with bronchiolitis. And only much later did it occur to me that there could be a link to air pollution.
Unfortunately, I do not think that healthcare professionals have enough resources and certainly almost next to no training in discussing air pollution, both with their patients as well as their friends and colleagues and decision makers within their organisations. I got interested in this and really had to do my research. In 6 years at medical school and now 17 years as a consultant physician, I've never once, unless I instigated the training or invited an expert speaker to come to us, have ever had any training on air pollution, despite it being something that kills 40,000 people a year across the UK.
Healthcare professionals do not have enough training and resources to support our patients with the impact of air pollution. During my training through my career as a consultant pharmacist, I have never received any training on air pollution, only what I've received through the media and from reading. I would like to see the health sector support the training and education of all healthcare professionals, but particularly with pharmacists. We should start to train our pharmacists right from undergraduate level all the way through their continuing professional development to be aware of the effects of air pollution so that all of us can support our patients in making sure they have the right facts and can avoid the effects of air pollution going forward with their disease.
Doctors are the right people now to be fronting this message. So that's what the health sector can actually do. And it will also be nice to go into a hospital where there are leaflets there about different things. And it would be nice to actually find one on air pollution and the damages it does to the public's health, because it's from the cradle to the grave.
We all believe and trust so strongly in our doctors, our nurses, our midwives, and we really need you to be telling us that we need to take care on big roads, walk on back roads, think about when to open our windows, to drive less.
When I used to take my late daughter to hospital. And I must admit, getting her to Great Ormond Street, there was lots and lots of pollution on the way there. And I think directly outside the hospital was very important. Because one of the things she used to complain about was people who were smoking outside the hospital. So maybe if we look at air pollution in a similar light, if air pollution is impacting on your breathing, then you shouldn't have idling cars or ambulances right outside entrances of hospital. So maybe hospitals can show their patients they are taking air pollution seriously, and this will help in discussion with their patients.
I would very much like to see a health campaign for air pollution, very similar to what we see with stop smoking, with flu vaccination, with weight loss. All of these are very important public health messages where we need to increase the awareness to our population.
I would say in addition that as scientifically literate and caring healthcare professionals, we have a responsibility as educators and activists to get the message out there. And that has to form the basis of a public health campaign based on science and evidence.
Hi, I'm Jane. I'm one of the main campaigners with Mums for Lungs. We're a campaign group set up in 2017 in London to campaign for clean air for our children and vulnerable people and everyone really. One of our main campaign focuses is school streets, which is a scheme where roads are closed at drop-off and pick-up times around schools. And they are a great way to make streets safer, calmer and less polluted and help our children. I am going to share my screen. And then tell you a little bit about why we love school streets so much. There we go. So here you can see a couple of pictures of school streets where they have been closed and the kids are out on the street, they're scooting, they're walking, they don't have to worry about the cars. It's all good. So why do we love school streets so much? They reduce traffic and therefore pollution. 25% of rush hour traffic in London is cars doing the school run. So we really need to reduce that. They create a safer environment for everyone near and outside of school. They encourage active travel, and that improves health and learning outcomes for children. There's evidence that if children have travelled to school actively, walked or scooted or cycled, they've got that crazy energy out, and they're more able to sit down, concentrate, and learn better. They also raise awareness of air pollution, the need to reduce traffic, and they show people how great it can be when you close your road to traffic. They're an inroad into how things can be. Out of the 33 London boroughs, 27 are implementing school streets currently. The first one was in Camden in 2017. Pre-COVID, there were about 85 schemes in place across London, and progress was happening, but quite slowly. And by the end of this year, around 450 schemes should be implemented because of the response to COVID. So how do school streets work? They are temporary road closures around schools at drop-off and pick-up times in term time only. Only pedestrians and cyclists are allowed to use the roads at those times. There are exemptions though. Every council seems to do it slightly differently, but mostly residents, local businesses and blue badge holders are able to apply for exemptions. Signs are put up like these ones to inform drivers of the road closures, and barriers or cameras can be used to enforce. So either you put manual bollards or barriers across the road and people stand there, teachers or caretakers or whoever, stopping cars driving through and letting residents out. Outside London, or automatic number plate recognition cameras, which will detect when people go through and send fines. or allow fines to be sent to those people. Outside London, that's currently more difficult, but it is going to be the case that will be possible soon. So why emergency school streets? Well, these are this is what we're calling the schemes that are as a response to COVID. The government stated back in May that they've created new statutory guidance that allow for more school streets because COVID-19 provides us with big challenges in how to get around. There's reduced public transport, pavements are narrow, there's a lack of safe cycle routes, and more trips are being driven in response to this. Back in the height of lockdown, we were worried that would happen, and now it's the case that it is happening. So school streets are just a way of reducing that 25% of rush hour traffic and making it safer and better for our children. If implemented with bollards, school streets can prevent crowding at the gates. People can walk in the road instead to enable safe social distancing. Now, we've said that, but of course, with cameras, you could still walk in the road and everything, but there is always the chance that a car will come through by accident, or without those manual bollards in place, you do have to be more aware. Also, of course, research is suggesting links between air pollution and COVID. The air pollution can make the instance of COVID more severe and more damaging. So we need to be very mindful that we don't want everyone to just jump in their cars, emissions to rise, congestion. We just can't let that happen. So how to campaign for an emergency school street? We always say, join forces with other parents, create a working group, get all the concerned people you can together. And don't forget your residents, they're your allies. Be pragmatic about it. They may worry. Often residents do worry immediately. Oh, my road's been closed. I'm going to be stuck in my house. I can't get out. What's going on? Which is not true. And if you approach them at the beginning, then you can get them on side. They can understand the scheme. So it's about knowing your community and their concerns. Why do people need to drive down that particular road at that time? Come up with solutions. There are always mitigation measures like park and stride. People can park in a nearby car park and walk instead. Some schools have set up deals with with supermarkets where their parents are allowed to park in that supermarket car park at those times and walk the rest of the way if they have to drive on to work or whatever. We've got a template letter on our website where you can write a letter to your school, to your head, your councillors, your council. There's lots of statistics and data on there to help make the case for school streets. This is if obviously there's so many schemes coming in, but if your school is not one of those being announced by your council, you can use that to escalate your case. And really important to get your head teacher on board, because they're the ones that need to approach the council. They need to be up for it. If they're not up for it, the school won't be up for it. It's about pushing up from below from the parents and getting the council to come down and meet in the middle, and then hopefully the scheme works and is successful. Yes, and again, addressing concerns about teachers who might need to drive. You could use the park and stride for those, or mostly teachers often arrive before the children, of course. So actually they arrive and leave outside the hours of the scheme. Councils look more favourably on schools, or have tended to look more favourably on schools, with a good track record of action on active travel. So if you've got gold TfL stars, or those with safety issues, so that is worth bearing in mind. So next steps, you've got your school street, you're loving it. What do you do? Well, there's usually a consultation process. Once it's up and running, celebrate it. We have posters like this available on our website that you can put up on your street, and do just keep talking about it and telling the people, the policymakers, that you love it. Email your councillors, your cabinet member for transport and environment, pass on those positive thoughts. And also, if there are issues with the scheme that you don't like, that other people don't like, always worth feeding those back and trying to get the scheme changed for the better. If your council has set up a commonplace website for immediate feedback, because a lot of these schemes are going in with experimental traffic orders, which I think means you can consult at the same time as the scheme is happening. And various councils are using commonplace, so you have a map of the area and you can put your concerns, or just say, I love this. So add your comments there, encourage others to, and then there might be another more formal consultation after about 6 months. And if there is, again, respond and encourage others to, because often the people that don't like things will shout the loudest, and then the people that do like things just go, oh yeah, that's quite nice, and then don't tell anyone, and then yeah. So there's a load of resources on school streets if you'd like to know more. Hackney Council did a brilliant toolkit a couple of years ago, which describes how they set up the scheme and the best sort of their notion of best practice for it. On our website, we've got the emergency template letter, our flyers, our campaigning guide, and there's posters. We've got a Facebook group called Mums for Lung School Streets, which you can join. There's over 1,000 people there chatting about it, offering advice and information. There's a great evidence review recently published by Sustrans and Edinburgh Napier University, which talked to various councils who've introduced the scheme and discovered information about displacement. There's often worries that traffic will be displaced to the next road along, and actually that didn't necessarily turn out to be the case. So it's really useful to point to people who are worried, particularly residents maybe who are worried about the scheme. Sustrans has stuff on its website. There's a School Streets Initiative website that's very good. Living Streets have stuff about it, and Car Free Day London have an Ask for It tool on their website, which enables you to put your postcode in, and then it will just generate automatically a way to ask your councillors and cabinet members for the scheme. And finally, please get in touch. We want to help you. Email us. We're always happy to chat on the phone about things, offer advice. And to end on some positivity, one school street can reach approximately 300 pupils, 50 staff, 550 parents, carers, 100 residents. That's 1,000 people, we're saying. And with 450 schemes going in, or more even, that's 45,000 extra people who, I'm just checking my maths on that, 450. Oh, anyway, that's a lot of people who were not necessarily aware of air pollution before, didn't realise short drives are bad and can easily be substituted with other methods if necessary, and that a lot more people aware that we need to change and make the world a better place. So that is the end of my presentation. Thank you.
I'm here with the Minister for Walking and Cycling, Chris Harris. We're here at Nightingale School in Hackney to celebrate Living Streets Walk to School Week. This is an amazing school which has just put in a school street, and as a result, all the children are walking, cycling and scooting to school. Chris, what do you think?
Well, it's actually quite extraordinary because I've just experienced a school run where the noisiest thing was a scooter, and everything was calm. The teacher was able to greet the kids and ask them about their books and not to worry about moving parents on from parking inappropriately. And I will say it was enjoyable.
It's a nice, relaxing start to the day.
Yeah, you can't really say that about many school runs, so I think it's a massive effort that can be done.
So let's hope we get many more of these. It's a useful way to start the day. It cuts air pollution around the school. It's good for the children and it's good for the planet.
Two out of 5 adults in the UK do not think that air pollution does their body any long-term harm. So are they right? The particles and gases that make up air pollution enter our body through our lungs as we breathe. They slip past the defenses of our body by breaking through the protective barriers that exist in our lungs. The long-term risks of being exposed to pollution includes diseases that affect the lungs, such as asthma, bacterial pneumonia, and even the occurrence of lung cancer. But the risk to pollution does not stop in the lungs. Air pollution goes beyond the depth of the lungs, where it interferes with the transport of oxygen from the air into the bloodstream. Here, pollution causes inflammation and constriction of your blood vessels to cause a rise in blood pressure and potentially leading to blockage of blood vessels. This then increases the danger of getting strokes or heart disease. Beyond this, there's even recent evidence to indicate that air pollution can reach the brain, thus contributing to brain conditions such as dementia. To find out more about air pollution and how you can protect yourself, please head to the Clean Air Hub.
This year, we were all forced to stop and take a breath. And as we all get back to normal, let's take this chance to change normal. Air pollution harms your health and the environment. But there's lots of simple things we can all do to make our air cleaner. Support Clean Air Day on October the 8th and help us make every day a Clean Air Day. For more information and free resources for schools, workplaces and more, visit cleanairday.org.uk/Scotland.
Outdoor air pollution often comes in the form of pollution particles and gases from transport, industry, construction, and wood-burning stoves or fires. The pollution can enter our bodies and harm our health. What can we do to cut air pollution outdoors? Firstly, leave the car at home as much as you can and walk, scoot, cycle, or take public transport, observing the current COVID-19 guidance. And when you are out and about, use quieter streets to avoid polluted main roads. Secondly, if you can't avoid driving, then look at switching to an electric vehicle. And when you are driving, don't idle. Turn the engine off when the car isn't moving and it is safe to do so. Finally, look at your deliveries. To reduce the number of delivery vans and lorries on our streets, choose to have things delivered together. Pick the click and collect option and look out for green delivery slots, which are highlighted delivery times that already have a delivery booked in the same area. For more information on air pollution and how you can protect your health when out and about and indoors, head to the Clean Air Hub at www.cleanairhub.org.uk.
I'm sharing this video to show my support to the Clean Air Day on October the 8th, which is the UK's largest air pollution campaign. Environment and health are interconnected, and particularly when it comes to non-communicable diseases, or how we call those NCDs, mainly cardiovascular diseases, chronic respiratory diseases, diabetes, and cancers. Air pollution causes around 6 million NCD deaths each year, making it one of the main risk factors for health, along with tobacco use, harmful use of alcohol, physical inactivity, and unhealthy diets. In the UN Task Force on the Prevention and Control of NCDs, we developed UN system-wide approaches to support countries to tackle air pollution. And we see that solutions require coordinated action across the broad range of sectors: environment, energy, health, transportation, housing, agriculture, many others, and also need governments, civil society, and the private sector to all be engaged. We also work on economic analysis and quantification of the air pollution effects on health, workforce, and economy as a whole. It is important to be able to show to the decision makers that clean air friendly regulation, fiscal policies, clean technologies are a win-win tools that both benefit the health of the population but are also cost effective. And together with the policy options, our personal choices really matter. For example, selecting cycling or walking or taking a public transport instead of the personal car might significantly reduce carbon emissions and also make you move, which is beneficial for health. So please consider being personally engaged and join Clean Air Day campaign. I thank you.
Two-thirds of UK adults agree that tackling air pollution should be part of the UK's coronavirus recovery strategy. We all know that air pollution is bad for our health, but why is tackling it now more important than ever? The recent global coronavirus pandemic has increased concern on how air quality impacts the spread and contraction of viruses. And recent studies suggest that high levels of air pollution have significantly worsened symptoms and increased the number of deaths from coronavirus. There is more research to be done. We need to understand what factors air pollution actually changes in order to make people more susceptible. One example of this has been the demonstration that air pollution increases the receptors for coronavirus present in the nose. For more information on air pollution and how we can help, head to the Clean Air Hub.
I'm Jane Goodall. When I was just 2, I was given a toy chimpanzee, Jubilee. I was born loving animals. I even took earthworms into my bed just so I could study them. It was Dr. Dolittle and Tarzan who inspired me. Heroes don't have to be real so long as they inspire you. I was told I was just a girl. So what could I do? I'll tell you. I went where wild animals were. I worked hard and got my PhD. I never treated chimpanzees as just things. I questioned the experts. I discovered new behaviors. I observed the chimps. I empathized with the chimpanzees. I learned that they had dark moments. But mostly I blazed a trail. I validated all that I believed through logic and intuition. Before COVID, I traveled 300 days a year. My heart is still 100% in love with what I have always loved, animals and the environment. If I'm your hero, it's because you too want to act on behalf of all living things and the planet that we share.
Happy Clean Air Day. We are very happy to celebrate it. Just a little reminder that every year, unfortunately, we have 7 million premature deaths caused by the bad quality of the air we breathe. And you know how many times we breathe a day? More than 20,000. Can you imagine? Imagine that any time you breathe, you are breathing to your lungs, into your respiratory system, something that is not of good quality. That's why we need to be very active. We need to make sure we promote a clean air day on the 8th of October, but a clean air day every day in our life. go for it.
We have all been spending more time inside these days. We therefore need to think about the air we're breathing indoors, as there can be pollution in the air inside as well as outside. What is indoor air pollution, and where does it come from? Indoor air pollution is in our homes, schools, and workplaces. It comes in the form of pollution particles, gases, chemicals, and mold generated when we cook or use a fire, and from personal care, cleaning, and building products that we use inside. So, what can we do to have clean air indoors? First, get some fresh air in. Opening windows when you are cooking or cleaning can help stop air pollution building up inside. Secondly, look at your heating. If you have an open fire or wood burner, only use it when you really need it. And when you do use it, choose well-seasoned or ready-to-burn labelled wood. Also, make sure you are regularly servicing your boiler. This should be done once a year by a gas-safe engineer. Finally, think about the products you are using inside. Choose fragrance-free cleaning products and look for the low VOC label on paints and other DIY materials. For more information on air pollution and how you can protect your health, both indoors and when out and about, head to the Clean Air Hub at www.cleanairhub.org.uk.
Hello, I'm Geraint Davis. I'm the MP for Swansea West. I chair the all-party group on air pollution. Just wanted to wish you a very happy Clean Air Day. I hope people are settling back in school, taking precautions, social distancing, washing your hands, etc., wearing masks in common places, and if wherever possible, cycling and walking to school. It's important we use our cars much less. People working from home is a very good idea if they can. And using public transport we should have more investment in public transport, keeping social distancing and masks on as well. But I'm very much in favour of indoor air pollution being improved as well by using the right cleaning products, having the right ventilation, having hedges around schools, not having people loitering outside or idling in cars with their engines on. And if they are bringing their children to school, making sure that as I say, they're not idling outside. So there's a lot that can be done by government. You should be pressing your local MP to support a clean air bill and more support for clean air, partly because, of course, the coronavirus, it has higher levels of infection and mortality from pollution. So adding it all up, stay safe, look after each other, help the NHS and create less pollution, which already causes tens of thousands of deaths, let alone COVID. We need a cleaner, greener future, and wish you well for the day. Thanks very much.
Over the lockdown period, we saw a significant drop in air pollution across the UK. This is mainly due to the reduction in car use, with 4 out of 5 UK adults noticing less road traffic in their local area during lockdown. But it is important that we try to keep air pollution down for good. The Secretary of State for Transport, Grant Shapps, said, "We recognise this moment for what it is, a once-in-a-generation opportunity to deliver a lasting transformative change in how we make short journeys in our towns and cities." So, how can the public help to keep air pollution down? 1. Give your car a holiday. Walk, scoot, cycle, or take public transport when you can. 2. Don't idle the engine. Turn off the engine when the car isn't moving. 3. Go electric. Try hiring an electric car, taxi, or test drive an electric vehicle. 4. Get involved with Clean Air Day. To find out more about air pollution and how you can protect yourself, head to the Clean Air Hub.
I regularly see patients who are impacted by air pollution. I work within the hospital and also within GP practices looking after people with respiratory disease. Many of the patients, we can actually probably say that air pollution has contributed to their actual diagnosis of respiratory disease, such as asthma or COPD, as well as many of the patients I see, their control is exacerbated by air pollution. Many of the COPD patients may have symptoms of sputum, increased shortness of breath, wheezing caused by air pollution, and also very similar for our asthma patients as well.
I really commonly and regularly see patients who are impacted by air pollution. I regularly, on a weekly basis, diagnose patients with lung cancer who have never smoked. Much of their risk comes from air pollution.
It's very important for people with respiratory issues to receive information on air pollution so they can, for instance, understand that, for instance, when there's a spike in air pollution, what impact that may have on maybe their asthma or things like that.
So I'm really concerned that healthcare professionals, doctors, nurses, whatever, have never raised the issue of air pollution with me and with my small children. And in particular, we were living on a busy road in Brixton. My son at 10 weeks was hospitalised for 2 nights with bronchiolitis. And only much later did it occur to me that there could be a link to air pollution.
Unfortunately, I do not think that healthcare professionals have enough resources and certainly almost next to no training in discussing air pollution, both with their patients as well as their friends and colleagues and decision makers within the organisations. I got interested in this and really had to do my research. In 6 years at medical school and now 17 years as a consultant physician, I've never once, unless I instigated the training or invited an expert speaker to come to us, have ever had any training on air pollution, despite it being something that kills 40,000 people a year across the UK.
Healthcare professionals do not have enough training and resources to support our patients with the impact of air pollution. During my training through my career as a consultant pharmacist, I have never received any training on air pollution, only what I've received through the media and from reading. I would like to see the health sector support the training and education of all healthcare professionals, but particularly with pharmacists. We should start to train our pharmacists right from undergraduate level all the way through their continuing professional development to be aware of the effects of air pollution so that all of us can support our patients in making sure they have the right facts and can avoid the effects of air pollution going forward with their disease.
Doctors are the right people now to be fronting this message, So that's what the health sector can actually do. And it will also be nice to go into a hospital where there are leaflets there about different things. And it would be nice to actually find one on air pollution and the damages it does to the public's health, because it's from the cradle to the grave.
We all believe and trust so strongly in our doctors, our nurses, our midwives, and we really need you to be telling us that we need to take care on big roads, walk on back roads, think about when to open our windows, to drive less.
When I used to take my late daughter to hospital, and I must admit, getting her to Great Ormond Street, there was lots and lots of pollution on the way there. And I think directly outside the hospital was very important, because one of the things she used to complain about was people who were smoking outside the hospital. So maybe if we look at air pollution in a similar light, if air pollution is impacting on your breathing, then you shouldn't have idling cars or ambulances right outside entrances of hospital. So maybe hospitals can show their patients they are taking air pollution seriously, and this will help in discussion with their patients.
I would very much like to see a health campaign for air pollution, very similar to what we see with stop smoking, with flu vaccination, with weight loss. All of these are very important public health messages where we need to increase the awareness to our population.
I would say, in addition, that as scientifically literate and caring healthcare professionals, we have a responsibility as educators and activists to get the message out there. And that has to form the basis of a public health campaign based on science and evidence.
Hi, I'm Jane. I'm one of the main campaigners with Mums for Lungs. We're a campaign group set up in 2017 in London to campaign for clean air for our children and vulnerable people and everyone, really. One of our main campaign focuses is school streets, which is a scheme where roads are closed at drop-off and pick-up times around schools. And they are a great way to make streets safer, calmer and less polluted, and help our children. I am going to share my screen. And then tell you a little bit about why we love school streets so much. There we go. So here you can see a couple of pictures of school streets where they have been closed and the kids are out on the street, they're scooting, they're walking, they don't have to worry about the cars. It's all good. So why do we love school streets so much? They reduce traffic and therefore pollution. 25% of rush hour traffic in London is cars doing the school run. So we really need to reduce that. They create a safer environment for everyone near and outside of school. They encourage active travel, and that improves health and learning outcomes for children. There's evidence that if children have travelled to school actively, walked or scooted or cycled, they've got that crazy energy out, and they're more able to sit down, concentrate, and learn better. They also raise awareness of air pollution, the need to reduce traffic, and they show people how great it can be when you close your road to traffic. They're an inroad into how things can be. Out of the 33 London boroughs, 27 are implementing school streets currently. The first one was in Camden in 2017. Pre-COVID, there were about 85 schemes in place across London, and progress was happening, but quite slowly. And by the end of this year, around 450 schemes should be implemented because of the response to COVID. So how do school streets work? They are temporary road closures around schools at drop-off and pick-up times in term time only. Only pedestrians and cyclists are allowed to use the roads at those times. There are exemptions though. Every council seems to do it slightly differently, but mostly residents, local businesses and blue badge holders are able to apply for exemptions. Signs are put up like these ones to inform drivers of the road closures, and barriers or cameras can be used to enforce. So either you put manual bollards or barriers across the road and people stand there, teachers or caretakers or whoever, stopping cars driving through and letting residents out. Outside London, or automatic number plate recognition cameras, which will detect when people go through and send fines, or allow fines to be sent to those people. Outside London, that's currently more difficult, but it is going to be the case that will be possible soon. So why emergency school streets? Well, these are this is what we're calling the schemes that are as a response to COVID. The government stated back in May that they've created new statutory guidance that allow for more school streets because COVID-19 provides us with big challenges in how to get around. There's reduced public transport, pavements are narrow, there's a lack of safe cycle routes, and more trips are being driven in response to this. Back in the height of lockdown, we were worried that would happen, and now it's the case that it is happening. So school streets are just a way of reducing that 25% of rush hour traffic and making it safer and better for our children. If implemented with bollards, school streets can prevent crowding at the gates. People can walk in the road instead to enable safe social distancing. Now, we've said that, but of course, with cameras, you could still walk in the road and everything, but there is always the chance that a car will come through by accident, or without those manual bollards in place, you do have to be more aware. Also, of course, research is suggesting links between air pollution and COVID. The air pollution can make the instance of COVID more severe and more damaging. So we need to be very mindful that we don't want everyone to just jump in their cars, emissions to rise, congestion. We just can't let that happen. So how to campaign for an emergency school street? We always say, join forces with other parents, create a working group, get all the concerned people you can together. And don't forget your residents, they're your allies. Be pragmatic about it. They may worry, often residents do worry immediately. Oh, my road's been closed, I'm going to be stuck in my house, I can't get out, what's going on? Which is not true. And if you approach them at the beginning, then you can get them on side, they can understand the scheme. So it's about knowing your community and their concerns. Why do people need to drive down that particular road at that time? Come up with solutions. There are always mitigation measures like park and stride. People can park in a nearby car park and walk instead. Some schools have set up deals with with supermarkets where their parents are allowed to park in that supermarket car park at those times and walk the rest of the way if they have to drive on to work or whatever. We've got a template letter on our website where you can write a letter to your school, to your head, your council as your council. There's lots of statistics and data on there to help make the case for school streets. This is if obviously there's so many schemes coming in, but if your school is not one of those being announced by your council, you can use that to escalate your case. And really important to get your head teacher on board, because they're the ones that need to approach the council. They need to be up for it. If they're not up for it, the school won't be up for it. It's about pushing up from below from the parents and getting the council to come down and meet in the middle, and then hopefully the scheme works and is successful. Yes, and again, addressing concerns about teachers who might need to drive. You could use the park and stride for those, or mostly teachers often arrive before the children, of course. So actually they arrive and leave outside the hours of the scheme. Councils look more favourably on schools, or have tended to look more favourably on schools with a good track record of action on active travel. So if you've got gold TfL stars, or those with safety issues. So that is worth bearing in mind. So next steps, you've got your school street, you're loving it. What do you do? Well, there's usually a consultation process. Once it's up and running, celebrate it. We have posters like this available on our website that you can put up on your street, and do just keep talking about it and telling the people, the policymakers, that you love it. Email your councillors, your cabinet member for transport environment, pass on those positive thoughts, and also if there are issues with the scheme that you don't like, that other people don't like, always worth feeding those back and trying to get the scheme changed for the better. If your council has set up a commonplace website for immediate feedback, because a lot of these schemes are going in with experimental traffic orders, which I think means you can consult at the same time as the scheme is happening. And various councils are using commonplace, so you have a map of the area and you can put your concerns or just say, I love this. So add your comments there, encourage others to, and then there might be another more formal consultation after about 6 months. And if there is, again, respond and encourage others to, because often the people that don't like things will shout the loudest, and then the people that do like things just go, oh yeah, that's quite nice, and then don't tell anyone, and then yeah. So there's a load of resources on school streets if you'd like to know more. Hackney Council did a brilliant toolkit a couple of years ago, which describes how they set up the scheme and the best sort of their notion of best practice for it. On our website, we've got the emergency template letter, our flyers, our campaigning guide, and there's posters. We've got a Facebook group called Mums for Lung School Streets, which you can join. There's over 1,000 people there chatting about it, offering advice and information. There's a great evidence review recently published by Sustrans and Edinburgh Napier University, which talked to various councils who've introduced the scheme and discovered information about displacement. You know, where there's often worries that traffic will be displaced to the next road along, and actually that didn't necessarily turn out to be the case. So it's really useful to point to people who are worried, particularly residents maybe who are worried about the scheme. Sustrans has stuff on its website. There's a School Streets Initiative website that's very good. Living Streets have stuff about it, and Car Free Day London have an Ask for It tool on their website, which enables you to put your postcode in, and then it will just generate automatically a way to ask your councillors and cabinet members for the scheme. And finally, yeah, please get in touch. We want to help you. Email us. We're always happy to chat on the phone about things, offer advice. And just to end on some positivity, one school street can reach approximately 300 pupils, 50 staff, 550 parents, carers, 100 residents. That's 1,000 people, we're saying. And with 450 schemes going in, or more even, that's 45,000 extra people who, I'm just checking my maths on that, 450. Oh, anyway, that's a lot of people who who were not necessarily aware of air pollution before, didn't realise short drives are bad and can easily be substituted with other methods if necessary, and that a lot more people aware that we need to change and make the world a better place. So that is the end of my presentation. Thank you.
I'm here with the Minister for Walking and Cycling, Chris Harris. We're here at Nightingale School in Hackney to celebrate Living Streets Walk to School Week. This is an amazing school which has just put in a school street, and as a result, all the children are walking, cycling and scooting to school. Chris, what do you think?
Well, it's actually quite extraordinary because I've just experienced a school run where the noisiest thing was a scooter, and everything was calm. The teacher was able to greet the kids and ask them about their books and not to worry about moving parents on from parking inappropriately. And also it was enjoyable.
It's a nice, relaxing start to the day.
Yeah, you can't really say that about many school runs, so I think it's a massive effort that can be done.
So let's hope we get many more of these. It's a beautiful way to start the day. It cuts air pollution around the school. It's good for the children and it's good for the planet.
Two out of 5 adults in the UK do not think that air pollution does their body any long-term harm. So are they right? The particles and gases that make up air pollution enter our body through our lungs as we breathe. They slip past the defenses of our body by breaking through the protective barriers that exist in our lungs. The long-term risks of being exposed to pollution includes diseases that affect the lungs, such as asthma, bacterial pneumonia, and even the occurrence of lung cancer. But the risk to pollution does not stop in the lungs. Air pollution goes beyond the depth of the lungs, where it interferes with the transport of oxygen from the air into the bloodstream. Here, pollution causes inflammation and constriction of your blood vessels to cause a rise in blood pressure and potentially leading to blockage of blood vessels. This then increases the danger of getting strokes or heart disease. Beyond this, there's even recent evidence to indicate that air pollution can reach the brain, thus contributing to brain conditions such as dementia. To find out more about air pollution and how you can protect yourself, please head to the Clean Air Hub.
This year, we were all forced to stop and take a breath. And as we all get back to normal, let's take this chance to change normal. Air pollution harms your health and the environment. But there's lots of simple things we can all do to make our air cleaner. Support Clean Air Day on October the 8th and help us make every day a Clean Air Day. For more information and free resources for schools, workplaces and more, visit cleanairday.org.uk/Scotland.
Outdoor air pollution often comes in the form of pollution particles and gases from transport, industry, construction, and wood-burning stoves or fires. The pollution can enter our bodies and harm our health. What can we do to cut air pollution outdoors? Firstly, leave the car at home as much as you can and walk, scoot, cycle, or take public transport, observing the current COVID-19 guidance. And when you are out and about, use quieter streets to avoid polluted main roads. Secondly, if you can't avoid driving, then look at switching to an electric vehicle. And when you are driving, don't idle. Turn the engine off when the car isn't moving and it is safe to do so. Finally, look at your deliveries. To reduce the number of delivery vans and lorries on our streets, choose to have things delivered together. Pick the click and collect option and look out for green delivery slots, which are highlighted delivery times that already have a delivery booked in the same area. For more information on air pollution and how you can protect your health when out and about and indoors, head to the Clean Air Hub at www.cleanairhub.org.uk.
I'm sharing this video to show my support to the Clean Air Day on October the 8th, which is the UK's largest air pollution campaign. Environment and health are interconnected, and particularly when it comes to non-communicable diseases, or how we call those NCDs, mainly cardiovascular diseases, chronic respiratory diseases, diabetes, and cancers. Air pollution causes around 6 million NCD deaths each year, making it one of the main risk factors for health, along with tobacco use, harmful use of alcohol, physical inactivity, and unhealthy diets. In the UN Task Force on the Prevention and Control of NCDs, we developed UN system-wide approaches to support countries to tackle air pollution. And we see that solutions require coordinated action across the broad range of sectors: environment, energy, health, transportation, housing, agriculture, many others, and also need governments, civil society, and the private sector to all be engaged. We also work on economic analysis and quantification of the air pollution effects on health, workforce, and economy as a whole. It is important to be able to show to the decision makers that clean air friendly regulation, fiscal policies, clean technologies are a win-win tools that both benefit the health of the population but are also cost effective. And together with the policy options, our personal choices really matter. For example, selecting cycling or walking or taking a public transport instead of the personal car might significantly reduce carbon emissions and also make you move, which is beneficial for health. So please consider being personally engaged and join Clean Air Day campaign. I thank you.
Two-thirds of UK adults agree that tackling air pollution should be part of the UK's coronavirus recovery strategy. We all know that air pollution is bad for our health, but why is tackling it now more important than ever? The recent global coronavirus pandemic has increased concern on how air quality impacts the spread and contraction of viruses. And recent studies suggest that high levels of air pollution have significantly worsened symptoms and increased the number of deaths from coronavirus. There is more research to be done. We need to understand what factors air pollution actually changes in order to make people more susceptible. One example of this has been the demonstration that air pollution increases the receptors for coronavirus present in the nose. For more information on air pollution and how we can help, head to the Clean Air Hub.
I'm Jane Goodall. When I was just 2, I was given a toy chimpanzee, Jubilee. I was born loving animals. I even took earthworms into my bed just so I could study them. It was Dr. Dolittle and Tarzan who inspired me. Heroes don't have to be real so long as they inspire you. I was told I was just a girl. So what could I do? I'll tell you. I went where wild animals were. I worked hard and got my PhD. I never treated chimpanzees as just things. I questioned the experts. I discovered new behaviors. I observed the chimps. I empathized with the chimpanzees. I learned that they had dark moments. But mostly I blazed a trail. I validated all that I believed through logic and intuition. Before COVID, I traveled 300 days a year. My heart is still 100% in love with what I have always loved, animals and the environment. If I'm your hero, it's because you too want to act on behalf of all living things and the planet that we share.
Happy Clean Air Day. We are very happy to celebrate it. Just a little reminder that every year, unfortunately, we have 7 million premature deaths caused by the bad quality of the air we breathe. And you know how many times we breathe a day? More than 20,000. Can you imagine? Imagine that any time you breathe, you are breathing to your lungs, into your respiratory system, something that is not of good quality. That's why we need to be very active. We need to make sure we promote a clean air day on the 8th of October, but a clean air day every day in our life. Go for it.
We have all been spending more time inside these days. We therefore need to think about the air we're breathing indoors, as there can be pollution in the air inside as well as outside. What is indoor air pollution, and where does it come from? Indoor air pollution is in our homes, schools, and workplaces. It comes in the form of pollution particles, gases, chemicals, and mold generated when we cook or use a fire, and from personal care, cleaning, and building products that we use inside. So, what can we do to have clean air indoors? First, get some fresh air in. Opening windows when you are cooking or cleaning can help stop air pollution building up inside. Secondly, look at your heating. If you have an open fire or wood burner, only use it when you really need it. And when you do use it, choose well-seasoned or ready-to-burn labelled wood. Also, make sure you are regularly servicing your boiler. This should be done once a year by a gas-safe engineer. Finally, think about the products you are using inside. Choose fragrance-free cleaning products and look for the low VOC label on paints and other DIY materials. For more information on air pollution and how you can protect your health, both indoors and when out and about, head to the Clean Air Hub at www.cleanairhub.org.uk.
Hello, I'm Geraint Davis. I'm the MP for Swansea West. I chair the all-party group on air pollution. Just wanted to wish you a very happy Clean Air Day. I hope people are settling back in school, taking precautions, social distancing, washing your hands, etc., wearing masks in common places, and if wherever possible, cycling and walking to school. It's important we use our cars much less. People working from home is a very good idea if they can. And using public transport we should have more investment in public transport, keeping social distancing and masks on as well. But I'm very much in favour of indoor air pollution being improved as well by using the right cleaning products, having the right ventilation, having hedges around schools, not having people loitering outside or idling in cars with their engines on, and if they are bringing their children to school, making sure that as I say, they're not idling outside. So there's a lot that can be done by government. You should be pressing your local MP to support a clean air bill and more support for clean air, partly because, of course, the coronavirus, it has higher levels of infection and mortality from pollution. So adding it all up, stay safe, look after each other, help the NHS and create less pollution, which already causes tens of thousands of deaths, let alone COVID. We need a cleaner, greener future, and wish you well for the day. Thanks very much.
Over the lockdown period, we saw a significant drop in air pollution across the UK. This is mainly due to the reduction in car use, with 4 out of 5 UK adults noticing less road traffic in their local area during lockdown. But it is important that we try to keep air pollution down for good. The Secretary of State for Transport, Grant Shapps, said, "We recognise this moment for what it is, a once-in-a-generation opportunity to deliver a lasting transformative change in how we make short journeys in our towns and cities." So, how can the public help to keep air pollution down? 1. Give your car a holiday. Walk, scoot, cycle, or take public transport when you can. 2. Don't idle the engine. Turn off the engine when the car isn't moving. 3. Go electric. Try hiring an electric car, taxi, or test drive an electric vehicle. 4. Get involved with Clean Air Day. To find out more about air pollution and how you can protect yourself, head to the Clean Air Hub.
I regularly see patients who are impacted by air pollution. I work within the hospital and also within GP practices looking after people with respiratory disease. Many of the patients, we can actually probably say that air pollution has contributed to their actual diagnosis of respiratory disease, such as asthma or COPD, as well as many of the patients I see, their control is exacerbated by air pollution. Many of the COPD patients may have symptoms of sputum, increased shortness of breath, wheezing caused by air pollution, and also very similar for our asthma patients as well.
I really commonly and regularly see patients who are impacted by air pollution. I regularly, on a weekly basis, diagnose patients with lung cancer who have never smoked. Much of their risk comes from air pollution.
It's very important for people with respiratory issues to receive information on air pollution so they can, for instance, understand that, for instance, when there's a spike in air pollution, what impact that may have on maybe their asthma or things like that.
So I'm really concerned that healthcare professionals, doctors, nurses, whatever, have never raised the issue of air pollution with me and with my small children. And in particular, we were living on a busy road in Brixton. My son at 10 weeks was hospitalised for 2 nights with bronchiolitis. And only much later did it occur to me that there could be a link to air pollution.
Unfortunately, I do not think that healthcare professionals have enough resources and certainly almost next to no training in discussing air pollution, both with their patients as well as their friends and colleagues and decision makers within their organisations. I got interested in this and really had to do my own research. In 6 years at medical school and now 17 years as a consultant physician, I've never once, unless I instigated the training or invited an expert speaker to come to us, have ever had any training on air pollution, despite it being something that kills 40,000 people a year across the UK.
Healthcare professionals do not have enough training and resources to support our patients with the impact of air pollution. During my training through my career as a consultant pharmacist, I have never received any training on air pollution, only what I've received through the media and from reading. I would like to see the health sector support the training and education of all healthcare professionals, but particularly with pharmacists. We should start to train our pharmacists right from undergraduate level all the way through their continuing professional development to be aware of the effects of air pollution so that all of us can support our patients in making sure they have the right facts and can avoid the effects of air pollution going forward with their disease.
Doctors are the right people now to be fronting this message. So that's what the health sector can actually do. And it will also be nice to go into a hospital where there are leaflets there about different things. And it would be nice to actually find one on air pollution and the damages it does to the public's health, because it's from the cradle to the grave.
We all believe and trust so strongly in our doctors, our nurses, our midwives, and we really need you to be telling us that we need to take care on big roads, walk on back roads, think about when to open our windows, to drive less.
When I used to take my late daughter to hospital, and I must admit, getting her to Great Ormond Street, there was lots and lots of pollution on the way there. And I think directly outside the hospital was very important, because one of the things she used to complain about was people who were smoking outside the hospital. So maybe if we look at air pollution in a similar light, if air pollution is impacting on your breathing, then you shouldn't have idling cars or ambulances right outside entrances of hospital. So maybe hospitals can show their patients they are taking air pollution seriously, and this will help in discussion with their patients.
I would very much like to see a health campaign for air pollution, very similar to what we see with stop smoking, with flu vaccination, with weight loss. All of these are very important public health messages where we need to increase the awareness to our population.
I would say, in addition, that as scientifically literate and caring healthcare professionals, we have a responsibility as educators and activists to get the message out there. And that has to form the basis of a public health campaign based on science and evidence.
Hi, I'm Jane. I'm one of the main campaigners with Mums for Lungs. We're a campaign group set up in 2017 in London to campaign for clean air for our children and vulnerable people and everyone, really. One of our main campaign focuses is school streets, which is a scheme where roads are closed at drop-off and pick-up times. around schools, and they are a great way to make streets safer, calmer, and less polluted, and help our children. I am going to share my screen. And then tell you a little bit about why we love school streets so much. There we go. So here you can see a couple of pictures of school streets where they have been closed and the kids are out on the street, they're scooting, they're walking, they don't have to worry about the cars. It's all good. So why do we love school streets so much? They reduce traffic and therefore pollution. 25% of rush hour traffic in London is cars doing the school run. So we really need to reduce that. They create a safer environment for everyone near and outside of school. They encourage active travel, and that improves health and learning outcomes for children. There's evidence that if children have travelled to school actively, walked or scooted or cycled, they've got that crazy energy out, and they're more able to sit down, concentrate, and learn better. They also raise awareness of air pollution, the need to reduce traffic, and they show people how great it can be when you close your road to traffic. They're an inroad into how things can be. Out of the 33 London boroughs, 27 are implementing school streets currently. The first one was in Camden in 2017. Pre-COVID, there were about 85 schemes in place across London, and progress was happening, but quite slowly. And by the end of this year, around 450 schemes should be implemented because of the response to COVID. So how do school streets work? They are temporary road closures around schools at drop-off and pick-up times in term time only. Only pedestrians and cyclists are allowed to use the roads at those times. There are exemptions though. Every council seems to do it slightly differently, but mostly residents, local businesses and blue badge holders are able to apply for exemptions. Signs are put up like these ones to inform drivers of the road closures, and barriers or cameras can be used to enforce. So either you put manual bollards or barriers across the road and people stand there, teachers or caretakers or whoever, stopping cars driving through and letting residents out. Outside London, or automatic number plate recognition cameras, which will detect when people go
We have all been spending more time inside these days. We therefore need to think about the air we're breathing indoors, as there can be pollution in the air inside as well as outside. What is indoor air pollution, and where does it come from? Indoor air pollution is in our homes, schools, and workplaces. It comes in the form of pollution particles, gases, chemicals, and mold generated when we cook or use a fire, and from personal care, cleaning, and building products that we use inside. So, what can we do to have clean air indoors? First, get some fresh air in. Opening windows when you are cooking or cleaning can help stop air pollution building up inside. Secondly, look at your heating. If you have an open fire or wood burner, only use it when you really need it. And when you do use it, choose well-seasoned or ready-to-burn labelled wood. Also, make sure you are regularly servicing your boiler. This should be done once a year by a gas-safe engineer. Finally, think about the products you are using inside. Choose fragrance-free cleaning products and look for the low VOC label on paints and other DIY materials. For more information on air pollution and how you can protect your health, both indoors and when out and about, head to the Clean Air Hub at www.cleanairhub.org.uk.
Hello, I'm Geraint Davis. I'm the MP for Swansea West. I chair the all-party group on air pollution. Just wanted to wish you a very happy Clean Air Day. I hope people are settling back in school, taking precautions, social distancing, washing your hands, etc., wearing masks in common places, and if wherever possible, cycling and walking to school. It's important we use our cars much less. People working from home is a very good idea if they can. And using public transport we should have more investment in public transport, keeping social distancing and masks on as well. But I'm very much in favour of indoor air pollution being improved as well by using the right cleaning products, having the right ventilation, having hedges around schools, not having people loitering outside or idling in cars with their engines on, and if they are bringing their children to school, making sure that as I say, they're not idling outside. So there's a lot that can be done by government. You should be pressing your local MP to support a clean air bill and more support for clean air, partly because, of course, the coronavirus, it has higher levels of infection and mortality from pollution. So adding it all up, stay safe, look after each other, help the NHS and create less pollution, which already causes tens of thousands of deaths, let alone COVID. We need a cleaner, greener future, and wish you well for the day. Thanks very much.
Over the lockdown period, we saw a significant drop in air pollution across the UK. This is mainly due to the reduction in car use, with 4 out of 5 UK adults noticing less road traffic in their local area during lockdown. But it is important that we try to keep air pollution down for good. The Secretary of State for Transport, Grant Shapps, said, "We recognise this moment for what it is, a once-in-a-generation opportunity to deliver a lasting transformative change in how we make short journeys in our towns and cities. So, how can the public help to keep air pollution down? 1. Give your car a holiday. Walk, scoot, cycle, or take public transport when you can. 2. Don't idle the engine. Turn off the engine when the car isn't moving. 3. Go electric. Try hiring an electric car, taxi, or test drive an electric vehicle. 4. Get involved with Clean Air Day. To find out more about air pollution and how you can protect yourself, head to the Clean Air Hub.
I regularly see patients who are impacted by air pollution. I work within the hospital and also within GP practices looking after people with respiratory disease. Many of the patients, we can actually probably say that air pollution has contributed to their actual diagnosis of respiratory disease, such as asthma or COPD, as well as many of the patients I see, their control is exacerbated by air pollution. Many of the COPD patients may have symptoms of sputum, increased shortness of breath, wheezing caused by air pollution, and also very similar for our asthma patients as well.
I really commonly and regularly see patients who are impacted by air pollution. I regularly, on a weekly basis, diagnose patients with lung cancer who have never smoked. Much of their risk comes from air pollution.
It's very important for people with respiratory issues to receive information on air pollution so they can, for instance, understand that, for instance, when there's a spike in air pollution, what impact that may have on maybe their asthma or things like that.
So I'm really concerned that healthcare professionals, doctors, nurses, whatever, have never raised the issue of air pollution with me and with my small children. And in particular, we were living on a busy road in Brixton. My son at 10 weeks was hospitalised for 2 nights with bronchiolitis. And only much later did it occur to me that there could be a link to air pollution.
Unfortunately, I do not think that healthcare professionals have enough resources and certainly almost next to no training in discussing air pollution, both with their patients as well as their friends and colleagues and decision makers within the organisations. I got interested in this and really had to do my research. In 6 years at medical school and now 17 years as a consultant physician, I've never once, unless I instigated the training or invited an expert speaker to come to us, have ever had any training on air pollution, despite it being something that kills 40,000 people a year across the UK.
Healthcare professionals do not have enough training and resources to support our patients with the impact of air pollution. During my training through my career as a consultant pharmacist, I have never received any training on air pollution, only what I've received through the media and from reading. I would like to see the health sector support the training and education of all healthcare professionals, but particularly with pharmacists. We should start to train our pharmacists right from undergraduate level all the way through their continuing professional development to be aware of the effects of air pollution so that all of us can support our patients in making sure they have the right facts and can avoid the effects of air pollution going forward with their disease.
Doctors are the right people now to be fronting this message. So that's what the health sector can actually do. And it will also be nice to go into a hospital where there are leaflets there about different things. And it would be nice to actually find one on air pollution and the damages it does to the public's health, because it's from the cradle to the grave.
We all believe and trust so strongly in our doctors, our nurses, our midwives, and we really need you to be telling us that we need to take care on big roads, walk on back roads, think about when to open our windows, to drive less.
When I used to take my late daughter to hospital, and I must admit, getting her to Great Ormond Street, there was lots and lots of pollution on the way there. And I think directly outside the hospital was very important, because one of the things she used to complain about was people who were smoking outside the hospital. So maybe if we look at air pollution in a similar light, if air pollution is impacting on your breathing, then you shouldn't have idling cars or ambulances right outside entrances of hospital. So maybe hospitals can show their patients they are taking air pollution seriously, and this will help in discussion with their patients.
I would very much like to see a health campaign for air pollution, very similar to what we see with stop smoking, with flu vaccination, with weight loss. All of these are very important public health messages where we need to increase the awareness to our population.
I would say, in addition, that as scientifically literate and caring healthcare professionals, we have a responsibility as educators and activists to get the message out there. And that has to form the basis of a public health campaign based on science and evidence.
Hi, I'm Jane. I'm one of the main campaigners with Mums for Lungs. We're a campaign group set up in 2017 in London to campaign for clean air for our children and vulnerable people and everyone, really. One of our main campaign focuses is school streets, which is a scheme where roads are closed at drop-off and pick-up times around schools. And they are a great way to make streets safer, calmer and less polluted, and help our children. I am going to share my screen.
I'm here with the Minister for Walking and Cycling, Chris Harris. We're here at Nightingale School in Hackney to celebrate Living Streets Walk to School Week. This is an amazing school which has just put in a school street, and as a result, all the children are walking, cycling and scooting to school. Chris, what do you think?
Well, it's actually quite extraordinary, because I've just experienced a school run where the noisiest thing was a scooter, and everything was calm. The teacher was able to greet the kids and ask them about their books and not to worry about moving parents on from parking inappropriately. And also it was enjoyable.
It's a nice, relaxing start to the day.
Yeah, you can't really say that about many school runs, so I think it's a massive effort that can be done.
So let's hope we get many more of these. It's a useful way to start the day. It cuts air pollution around the school. It's good for the children and it's good for the planet.
Two out of 5 adults in the UK do not think that air pollution does their body any long-term harm. So are they right? The particles and gases that make up air pollution enter our body through our lungs as we breathe. They slip past the defenses of our body by breaking through the protective barriers that exist in our lungs. The long-term risks of being exposed to pollution includes diseases that affect the lungs, such as asthma, bacterial pneumonia, and even the occurrence of lung cancer. But the risk to pollution does not stop in the lungs. Air pollution goes beyond the depth of the lungs, where it interferes with the transport of oxygen from the air into the bloodstream. Here, pollution causes inflammation and constriction of your blood vessels to cause a rise in blood pressure and potentially leading to blockage of blood vessels. This then increases the danger of getting strokes or heart disease. Beyond this, there's even recent evidence to indicate that air pollution can reach the brain, thus contributing to brain conditions such as dementia. To find out more about air pollution and how you can protect yourself, please head to the Clean Air Hub.
This year, we were all forced to stop and take a breath. And as we all get back to normal, let's take this chance to change normal. Air pollution harms your health and the environment. But there's lots of simple things we can all do to make our air cleaner. Support Clean Air Day on October the 8th and help us make every day a Clean Air Day. For more information and free resources for schools, workplaces and more, visit cleanairday.org.uk/Scotland.
Outdoor air pollution often comes in the form of pollution particles and gases from transport, industry, construction, and wood-burning stoves or fires. The pollution can enter our bodies and harm our health. What can we do to cut air pollution outdoors? Firstly, leave the car at home as much as you can and walk, scoot, cycle, or take public transport, observing the current COVID-19 guidance. And when you are out and about, use quieter streets to avoid polluted main roads. Secondly, if you can't avoid driving, then look at switching to an electric vehicle. And when you are driving, don't idle. Turn the engine off when the car isn't moving and it is safe to do so. Finally, look at your deliveries. To reduce the number of delivery vans and lorries on our streets, choose to have things delivered together. Pick the click and collect option and look out for green delivery slots, which are highlighted delivery times that already have a delivery booked in the same area. For more information on air pollution and how you can protect your health when out and about and indoors, head to the Clean Air Hub at www.cleanairhub.org.uk.
I'm sharing this video to show my support to the Clean Air Day on October the 8th, which is the UK's largest air pollution campaign. Environment and health are interconnected, and particularly when it comes to non-communicable diseases, or how we call those NCDs, mainly cardiovascular diseases, chronic respiratory diseases, diabetes, and cancers. Air pollution causes around 6 million NCD deaths each year, making it one of the main risk factors for health, along with tobacco use, harmful use of alcohol, physical inactivity, and unhealthy diets. In the UN Task Force on the Prevention and Control of NCDs, we developed UN system-wide approaches to support countries to tackle air pollution. And we see that solutions require coordinated action across the broad range of sectors: environment, energy, health, transportation, housing, agriculture, many others, and also need governments, civil society, and the private sector to all be engaged. We also work on economic analysis and quantification of the air pollution effects on health, workforce, and economy as a whole. It is important to be able to show to the decision makers that clean air friendly regulation, fiscal policies, clean technologies are a win-win tools that both benefit the health of the population but are also cost effective. And together with the policy options, our personal choices really matter. For example, selecting cycling or walking or taking a public transport instead of the personal car might significantly reduce carbon emissions and also make you move, which is beneficial for health. So please consider being personally engaged and join Clean Air Day campaign. I thank you.
All right, well, good morning and welcome to Clean Air Day 2020 and to this Clean Air Day live broadcast. My name's Larissa Lockwood and I'm the Director of Clean Air at Global Action Plan, and this is one of my favourite days of the year because Clean Air Day is the Clean Air Movement's Day. So it's a day when all of us working on clean air come together, so local authorities, schools, universities, charities, healthcare organisations, businesses, community groups, as well as thousands and thousands of individuals. So we all come together to tackle air pollution by sharing information, calling for change and encouraging people to make changes to our everyday behaviour that can reduce air pollution and protect our health. So thank you for tuning in to the first ever Clean Air Day live event and for playing your part in helping to improve the air we breathe, because by working together we can have cleaner air. We know that behaviour change can make a profound difference to air quality, because while COVID-19 has obviously turned our lives upside down and is actually the reason we took the decision to move Clean Air Day to October this year, but during this sort of grim period of lockdown, we did see something very interesting and perhaps one of the few silver linings, because air pollution improved across the country by, on average, 20 to 30% or 40% at its best, and even halved in parts of some cities. And for many, this was the first taste of clean air and quieter streets. And it was because of our collective actions. You know, it was because we were working from home, it was because we were walking and cycling instead of driving, that we saw and experienced these extraordinary improvements in outdoor air quality. And while lockdown is clearly not a good thing and not something that we want to return to, we do have the opportunity to maintain some of these behaviours of working from home more often and walking and cycling those shorter trips, really building them into our lifestyles and turning them into habits as part of our new normal. Because not only do they improve air quality, but walking and cycling also offer huge health benefits in and of themselves. And we know from our market research that people like working from home, maybe once or twice a week or more, as it offers more flexibility so we can work around childcare or hobbies and get more jobs done around the house. So that's what we need to do today on Clean Air Day and every day. We need to maintain this momentum and keep our air clean. And we should feel hopeful. And more than that, I think we should feel confident and we should feel empowered, because a cleaner air future is possible and we know that people want it. Since the first Clean Air Day back in 2017, we've seen progress in tackling air pollution across all parts of society, from policymakers, businesses, schools and individuals. I saw the car sales figures earlier this week, and over the last year, petrol and diesel car sales are down 21% and 38% respectively, while plug-in hybrid and electric vehicle sales are up well over 100%, as businesses are now starting to respond to consumer demand and bring new, cleaner models to market. Then back in 2017, I think there was only one school street in Camden. Now there are literally hundreds in Leeds, Sheffield, Cardiff, Birmingham, Edinburgh, London, all over the place, helping to protect the next generation's health from air pollution. On the policy side, we've seen the ultra-low emission zone in central London bring nitrogen dioxide levels down by 44%. And the Nottingham parking levy has also cut pollution in that city by encouraging more people to leave the car at home and take public transport instead. And then on public action, as I said, we saw some incredible shifts in behaviour earlier this year, and it looks like these behaviours are set to stick. We did some research in lockdown that showed that 40% of us were attempting to work from home. And of those people, the vast majority wanted to keep doing so to some extent, which does seem to be playing out in practice. We also saw cycling rates increase massively, and while levels aren't quite as high now as they were in early summer, they are still significantly up by about 30 to 40%. So let's make these behaviours stick. That is what Clean Air Day is all about. It's about playing our part to improve air pollution and encouraging others to do so to help protect our health and also the education of our children. So what can we do today and going into winter, because we're having a winter Clean Air Day this year, or autumnal one? Firstly, be active. I think we need to adopt some of our Nordic neighbours' resilience and keep using our bodies rather than our cars to get around. As the expression goes, there's no such thing as bad weather, just bad clothing. So keep the car parked up and keep walking and cycling as much as you can. And really, if you do keep doing it, if you don't stop, you do kind of acclimatise. I can attest from personal experience. And it's a really great way to get out and remain active in these somewhat restricted times. Secondly, be vocal. Get involved in local decision making on air pollution. I think we're all going to be watching quite a lot of TV as the nights draw in, so maybe one of those nights, turn off the TV and write a letter to your MP or councillors asking what the plan is on air pollution in your area and how you can support it and get involved. And then thirdly, wear long johns. I think we'll all be spending a lot more time at home, working from home, just being at home. So we need to think about our heating. And we know that log burners and open fires are the largest source of particulate pollution in the UK. So if you have one and it's not your primary heat source, I'd really recommend only using it when you absolutely have to, and instead invest in a pair of long johns. Thermal underwear is hugely underrated. And as we've seen, if we do all these things, they do add up, and we really can make a difference to the air we breathe. So we set a challenge at the beginning of the Clean Air Day campaign to see if we could have the cleanest Clean Air Day ever. So let's find out if it is. Well, comparing DEFRA's air quality data from this and the last 3 Clean Air Days, I'm neither pleased nor sorry to say that this year's Clean Air Day is about as clean as previous Clean Air Days, which really means that there's still work for us as a movement to do to really try and get our air pollution levels back down so as to protect people's health. For we all have a part to play to keep our air clean, and I hope that today's events, Clean Air Day Live, as well as all the events going on across the country, will, I hope, help to inspire you to do even more great work, to help others understand the sources and health impacts of air pollution, and crucially to encourage our family, friends, neighbours, students, patients, customers, everyone, to do something on a regular basis to keep our air clean. And please do visit the Clean Air Hub as well. That's the UK's go-to public information source on air pollution to learn more about the subject. So I'm really excited about our Clean Air Day Live event today. It's the first time that we're doing this, and it's a whole day of clean air inspiration from a range of people and places, which for me represents what Clean Air Day is all about. So following this, we're going to go to Bristol, where Mr. Patterson will be giving us a clean air assembly, followed by an air pollution game for teachers for you to use in class with primary school children. Following that, for teachers and parents, we have a session on clean air schools, looking at the strengthened case for action on air pollution in and around schools. While we know that air pollution is bad for children's health, it can cause irreversible damage, it is also bad for children's ability to learn, as you may have seen in the media today. So this session will be looking at some of the solutions and how we can help schools to tackle air pollution, including a look at our new Clean Air Schools framework. Then we move on to a section on campaigning through a workshop on how to run powerful campaigns on social media, with a look at some of our favourite air pollution imagery and assets. And as part of this section, we'll have an on-site broadcast from the Nocado Campaign to illustrate their work campaigning on air pollution. Then in the afternoon, we have a double session on Unequal Air. For we know that while air pollution is the largest environmental threat to health in the UK, responsible for up to 36,000 deaths per year, the burden of pollution exposure and impact is not equally distributed. So this session is split into 2 sections with community activists and academics, the first looking at the problem and the second more focused on the solutions. After this, we'll take a look at how the health sector can tackle air pollution with contributions from NHS trusts and what they're doing to tackle air pollution, and also discussion on the crucial role of health professionals as trusted messengers. And then this is followed by a fascinating panel discussion on the future of mobility and asks the question, how many cars do we need? Then before rounding off, we'll have a panel discussion on clean air workplaces, looking at the office, industrial and home workplaces. Then the final session is the Clean Air Day celebration event. Normally this would be our face-to-face gathering, but this year, for obvious reasons, we'll be coming together virtually to look at what's been going on around the country today, to celebrate achievements and to say thank you to all the Clean Air Day partners, supporters and participants. Now, we don't expect anyone really to sit through the whole day, but please do tune into the bits that excite you, and please do share this link and invite other people to attend the relevant parts of the day too, as there really should be something for everyone here. Clean Air Day Live is all about finding solutions to air pollution, and I hope that it inspires you. Please do also share what you learn along the way on social media with the hashtag Clean Air Day. So Clean Air Day is about collaborative action to change behaviour, and we'll see plenty of that demonstrated in Clean Air Day Live's programme today. So thank you to all our Clean Air, thank you to all our Clean Air partners, really, who make this whole campaign possible. So the Clean Breathing Institute, DEFRA, the Scottish Government, the Welsh Government, Opinion, FIA Foundation, Environment Agency, the Philips Foundation and Zenda, and to our affiliate partners, NG, Zipcar, Mitsubishi Electric and Air Quality News. And a massive thank you to you for listening and acting on this critical day of clean air action. We all have a part to play, and by working together, we can breathe cleaner air. So we're going through a profound moment of societal change right now. So let's come together and let's build back cleaner air. Thank you, and have a great Clean Air Day.
Well, good morning, everyone, and welcome to Clean Air Day, the fourth Clean Air Day, but the first ever Clean Air Day live. My name is Luke Wynn, and I'm Head of Youth and Schools at Global Action Plan. Now, whether you are joining as part of a school today or from home, or whether you're tuning in via the Clean Air Day website, on YouTube, or through Air Quality News, I welcome you, and I hope you're ready for an action-packed morning, in fact, an action-packed day of clean air inspiration. In a moment, we'll be going live to Westbury-on-Trim Academy in Bristol, where the wonderful Mr. Patterson is holding a Clean Air Day assembly with his pupils. Then we're going to hear and see some fantastic examples of the ways that schools across the country are doing their bit to tackle the air pollution problem in the UK. And then at 11:15, I'll be handing over to my colleague, Catherine, who will take us through the campaigning section of today's event. But before I hand you over to Mr. Patterson, I'd like to let you know about a few ways that you can interact and connect with us here at Clean Air Day Live today. Firstly, if you are watching via the Clean Air Day Live webpage, there is a rectangular box you'll see to my right. Please use this box to post your comments, your questions, videos, photos, and tell us your stories about how you are celebrating Clean Air Day Live today. If you are watching somewhere other than the Clean Air Day websites, then please go to sli.do, that's SLI.do, and enter the number 72733, that's 72733, and post a quick hello so that we know you're there. And then there you can post your stories, photos and videos about what you're doing on Clean Air Day this year. If you are a school and you're accessing the comments via Slido, please let us know the name of your school so that we know you are there as well. And finally, as with other years, we really want to get the hashtag Clean Air Day trending on Twitter today. So please reach for your phones and get tweeting, sharing your comments, thoughts, questions, and stories about how you're celebrating Clean Air Day in 2020 on Twitter using the hashtag Clean Air Day. So without further ado, I'd like to hand over to Mr. Patterson at Westbury-on-Trim Academy in Bristol.
Okay, good morning and welcome to Westbury-on-Trim School. I'm Mr. Patterson, and more importantly, welcome to Clean Air Day. Now, I'm going to do probably just a 10-minute presentation with the help of the wonderful 2WP, and maybe you can follow along with me. So if your teachers or children at home, if you want to pause the video at any time to talk about anything or play the game with us, feel free to pause it. Okay. As I said, this is Clean Air Day, and this is our chance to try and make this the cleanest air day that we've had in years. Okay. My first question is, what is air pollution? Now, I'm going to ask this to my wonderful 2WP. Who can be brave and tell me what air pollution is? Belarus.
Air pollution means there's air in the air and then it comes down to you and you have air pollution in your house.
Oh, really interesting. You've touched on something really nicely there about being inside the house, and definitely something about air. Jamal, what do you think? Interesting idea. Smoking, possibly. These are just ideas. Daisy?
Because the air just floats around and you can't really see it because it's invisible.
That is fantastic. We're going to come back to that later. We can't really see what's around us. Daniel?
It's like, because the sky is blue, you can't really see it, but you can see a little tiny
Interesting.
bit.
Now, I'm going to highlight one word, pollution. I'm sure the children at home have heard the word pollution. Like 2WP, have we heard the word pollution before? Yes. But we don't usually think of pollution in the air. Let's carry on. Okay. Now, air pollution is in the air, hands down, that we breathe. These are particles and gases that go into our body and they can damage our health. So it's a little bit scary, but it's okay. It's okay. Okay. Any amount of pollution can be damaging to our health, but the more air pollution that goes into our body, the more dangerous it can become. It can't kill you straight away, but it's definitely not good for you. Now, we're going to come into what it can do to you, but don't worry too much because, Ollie, we can make a change. The good thing is we are learning now today how to make a change. Air pollution is lots of tiny, tiny particles that are in the air. It's so tiny, if I look here at Jobin's hair, just one little wisp of hair, it's smaller than the width of that hair. So we can't see it. We can't see air pollution. While if there's litter in the ocean, we can usually see that and we can take it out. Okay. Where does it come from? Ooh. Where do we think air pollution might come from? Jamal said possibly smoking. Yeah, Zoe. Could come from the sky, yeah.
And when you're having a fight,
Could, definitely could come from fires. No.
When you're breathing in or out, air can come in.
Yeah, you're right. Air comes in and out of our mouth. That's not really where the air pollution comes from, but you're right. Poppy. You're right. You are onto the right idea. Hands down. Let's give you some ideas. Now, air pollution comes from lots of different things. It can come from industries, it can come from farming, it can come from burning coals and woods in our house and outside. But the most damaging air pollution is actually cars and vehicles. The gases and the oils that are burnt, it's okay because we're going to learn about this now. The gases and the oils that are burnt in cars creates the air pollution that comes up into the air. And that is what is making it a little bit dangerous for us. I reckon we can come up with some good ideas to possibly not use cars as much. Hands down, hands down, hands down. We'll come to them in a second. I just wanted to tell you, these are some of the dangerous things that can happen from air pollution. Now, although this isn't really dangerous to us right now, over a long time, it can become a little bit dangerous. It can damage our lungs. Can you put your hands on your lungs? If you're at home, can you put your hands on your lungs? Now, can you take one big breath in and one big breath out? Now, that was easy, and I'm sure at home you found that easy. But if there's lots of air pollution around, it can actually damage some people's lungs. So when they breathe in, it can be a little bit more tricky. Possibly a little bit like Darth Vader. If we think about Darth Vader, he breathes a little and he finds it a little bit harder to breathe. He's been exposed to a lot of air pollution. Just waiting. It also can cause asthma. Now, maybe when you've seen some children or adults with inhalers, they need a little bit of help to breathe. Oh, thank you. Thank you. Or breathing air pollution can impact your heart, and it can cause health problems on your heart. But this is the main thing. We can fix this. Okay, we're going to play a little game. We're going to play a little game. It's going to be a sitting down game, and you can play this at home. Just pause the video if you need to. Give yourself a second. We're going to play head, shoulders, knees. What's next, usually? What's next, usually? Head, shoulders, knees, and toes, but we're not going to do the toes. If you think this is a reason for air pollution, like the cars or the farming, you put your hands on your head. So if I say cars, put your hands on your head, because we know that causes air pollution. That's a source. If it's an effect, so if this is what happens to your body, can we put our hands on our shoulders? So bad lungs, hands on our shoulders. If it's a solution, we can fix it. If you think that's going to help fix air pollution, hands on your knees. Get ready. Here we go. Ollie. Cars. Making asthma symptoms worse. Yeah, you're right. That's a health effect.
What's a health effect?
That means something that's bad for us is affected. Now, this is a tricky one because I'm going to read it. It says avoid heavy traffic. So don't go in heavy traffic. Does anyone want to change their ideas? Hands on knees, because that fixes it. When we're in heavy traffic all the time, there's lots of gases that come into the air, so we want to try and not go near heavy traffic. You are on the ball. I wonder if you're getting these right at home as well. Burning wood and coal at home. Yeah, 2WP, superstars, vans. Hands on heads, well done. Cycling or walking?
Yeah, that's
I wonder how many children at home try and cycle or walk to school. Hands up if you cycle or walk to school.
I walk to school. I walk home.
Oh, just waiting. Ollie, I'm just waiting. Thank you. Okay. Well done. Now it impacts your heart. What do we think? Do we think head? Do we think shoulders? Or do we think knees? So this is an effect. It makes our heart. Yes, you're exactly right, Amy. Well done. Oh, strong smelling sprays and toiletries. Strong smelling sprays. There we go. In 1 minute. Okay. There we go. Ooh. Open windows when cooking and cleaning. Open windows. Actually, we do want to open our windows. We do. So that's a hands on knees. You are right. We do want to open our windows to let all the gases out. Yeah? We don't want to keep it in the house because then it'll be all around us. Walk instead of driving.
That's a solution.
Solution, you are right. I wonder if at home you've got that. We have a few more. Have an electric car.
Oh, good. That's good. That's good. It's good.
Electric car.
No, it's not good.
No, electric car, you are right. It's definitely a good thing because we're not burning any of our oils or gases. Just like Tesla, Jamal. 3, 2, 1. This one says leaving the engine running. Do we want to leave the engine running? Can you all show me you turning the engine off? At home, can you show me turning the engine off? There we go. Good, because we want to turn them off. Strong smelling cleaning products. No, it's not a good thing. It's terrible. This one, if you're coughing a lot.
It's the shoulders.
It's an effect, you're right. It's a health effect. Because it can make you cough a lot. Damage lungs, damage our lungs. Well done, 2WP.
That's never happened to us.
This one's a little bit different. I struggled a little bit with this one. Take quiet routes and don't go on only main roads.
That's a solution.
Yes, you're right, solution.
I knew that straight away.
Okay, now this is what you can do. And at home, this is what you can do to help fix, to help clean up our air. This is what you and your family can do. You could walk, cycle or scoot if you can. Maybe if you can't, you could take public transport so we're not all driving cars. You could discover the side streets. You could possibly think about getting an electric car. or a hybrid? A hybrid is electric and oil. So then at least you've got a little bit of interesting. Just wait. This one, don't idle. You've shown me this one. Turn off your engine. Now this is for indoor air pollution because there's outdoor and there's indoor. Now the indoor, we can open the windows. Can you show me opening the windows? There we go. And ready? We've got use fragrance free. That means when we use cleaning products, we don't use lots of smelly ones. We use ones that don't have any smell. And ask your parents to only burn dry, well-seasoned wood to make smokeless fuel. Now, I wanted to say a huge thank you to all of 2WP and everyone at home for joining us today. A big thank you to Global Action Plan, who is working really hard to help clean up our air, and the environmental agency who are partnership to create this presentation. Good luck for the rest of the day. We are going to do some of the activities. Please use the links to try and find some of the activities that you can do with your class at home, and let's make our air clean. Can you say, let's make our air clean? Let's make our air clean! Yeah, amazing.
Well, fantastic stuff. Thank you very much, Mr. Patterson, and a huge thank you to the inspiring pupils there at Westbury-on-Trim Academy in Class 2WP in Bristol. Now, the assembly we just saw there with Mr. Patterson and his pupils was created by Global Action Plan and the Environment Agency. And for any other teachers or schools wanting to run a similar session in your school, you can access that assembly on the Clean Air Day website, which is cleanairday.org.uk. So head over there for that assembly, as well as a whole load of other fantastic resources to get you engaging your students in the wider school community in addressing the clean air challenges around your school. If you're just tuning in and you missed that assembly, it's definitely worth a watch. And it'll be made available on the Clean Air Day website later today, as will all of the video content that we'll be sharing as part of Clean Air Day today. We've had a comment come through, or a question I should say, on Slido, and that is, what is the most impactful thing that we can do to clean up the air around our school? Well, there are so many wonderful things that can be done to improve the air quality in and around the school, many of which you'll be hearing from today. You can set up a school street and stop traffic from coming down your school street at the times of drop off and pick up each day. You can encourage families to do walking school buses, among a whole other suite of activities. But I think the first thing to do is to go to the Clean Air Day website and find the activities there that'll get you started on your clean air journey for your school. But now I'm going to hand over to my colleague Martin, who is going to talk us through the newly launched and very exciting Clean Air for Schools framework. Over to you, Martin.
Perfect. Thank you, Luke, and thank you, Mr. Patterson and Class 2WP. What an act to follow. Perfect. Right. Just waiting for our slides to pop up, and then we can begin our presentation. Wonderful. Right. Now I'm going to introduce our speakers in just a moment. I will give them a warning that we'll be sticking to times and they might get some gentle nudges along the way. But to kick us off, I'd like to talk about, first of all, that I'm very excited to kick off our Clean Air and School session today. We are going to talk about our Clean Air for Schools programme with Philips and the Philips Foundation in Greater Manchester. We're going to talk about the framework itself, and I'm going to run through a demo of how to use it. And then we're also joined by the FIA Foundation, and we're going to talk about the school run scandal and the impact that students can have, and in particular their student voice. Now, this session is perfect for anybody that wants to learn more about what their school or any school can do to tackle air pollution. And the aim of this session today is to do two things. First, to inspire everyone to take action, to see case studies and to hear testimonials from teachers and students as to what can be done. But then also we want to give them and to give you the confidence and the tools so that you can feel inspired and tackle air quality. Great, so if we move now on to the next slide. Perfect. Now, in just a moment, I am going to invite our speakers to tell us a little bit about how their school compared to this Clean Air for School vision. So at Global Action Plan, we've been working with schools for over 25 years. In this year alone, we've worked with directly over 200 schools and many hundreds more through our work and Clean Air Day. Schools have a very important role to play in tackling air quality. And what I wanted to share with you now is our Clean Air Schools vision. Now, this is a visual depiction of what the perfect clean air school would look like. You can see we've got school streets, green spaces, space for active travel, no idling zones, you name it, it's here. And so to introduce both Sheila Watson from the FIA Foundation and also Mark Letwin from Philips, I'd like to ask you both, how does your school, firstly, the one you grew up in, compare to our Clean Air Schools vision here? Now, Sheila, I'm going to go over to you first of all.
Well, it was nowhere near as attractive as that image, that's for sure. I think lots more people did walk to school when I was little, and I'm very old, so maybe there weren't quite as many cars as there are now, but we didn't learn about these issues in school. We definitely, although we had lovely teachers, didn't have anyone as engaging as Mr. Patterson, who's just absolutely thrilled me and set us up, I think, for a great day's discussion. So I think it was a long time ago, and we were a long way from this ideal, but some things were better. I think there was probably more walking.
Wonderful to hear. And Mark, over to you.
Yeah, thanks, Martin. And I'd fully agree with Sheila. I think in my day, in my school, we didn't even talk about air pollution, air quality, clean air in any way, I think, in our education. But I was also very fortunate to be able to walk to school every day. And there was a lot more walking to school in those days. But again, as I got older in my secondary school, I was one of those who got a coach each way to school, an hour every day. So again, can fully understand the challenges that some people face also in getting to school. So it's very different now, and I'm very pleased that we're here to be able to talk about it.
Perfect, thank you both. And I know we're also joined by Elizabeth Littlewood, who will be hiding away in the chat function later on to answer any questions. And so at this point, Mark, I'd like to hand over control to yourself, really, and to talk about the Clean Air for Schools programme.
Brilliant. Thanks, Martin. So, as I said, I'm delighted to be here today. I'm here representing the Philips Foundation, which is an organisation set up by Philips to really look at the underserved and underprivileged communities all around the world. And actually, young people in the UK, specifically around air quality, is an area that we've really identified and taken very seriously about, something that we need to do and take action on. So I'm delighted to be part of this. And why it's important is that, again, in all the work we've done over the last few years, there are 8,500 schools, colleges, nurseries all around the UK where the air pollution levels don't actually meet World Health Organization acceptable limits. So that means as of today, on this brilliant broadcast, 1.7 million children as a minimum are actually learning in an environment where they're actually surrounded by what we call toxic air, which isn't acceptable. So last year we put together this fabulous Clean Air for Schools initiative, a combination of Philips Foundation, Global Action Plan and the University of Manchester to really see if we could do something about it and take some action. I'll see if I can click on, or are you going to click for me, Martin? Maybe you can click.
Yeah, we should be able to give you control also, but I'll get you in.
So that's right. So we set up this partnership last year, and what our ambition was to really equip all of the schools and all learning facilities with tools and knowledge about how they can actually address air quality in their area. And it isn't about telling people they need to do better. It was about giving them really simple, meaningful tools about what they could do to actually improve the quality of air in the school itself, how we could really think about what was happening at the school gate and the school run and the emissions, how we could educate the next generation of children. And you've just seen Mr. Patton do a great job of that, about the challenges and what they can do, and also give simple tools to the school and the community to actually take action. So that's what the ambition was, and we teamed up last year across 19 schools across Greater Manchester to really understand what the impact, the actions they could take would have on the local air quality and then the children's ability to learn fundamentally. And since October last year, so we've worked with 6,500 students and teachers, and again, another 6,000 of their family members on really understanding what it means to tackle air pollution. So that's what we set out to do. We did a number of things. So if I go through, I'll try and click on. It's not letting me, so you're going to have to run it for me, Martin, I'm afraid. So again, we did a couple of things. So if we go back, there we go, one more, there we go. So we did a whole piece around education. And what we did with the 19 schools is we actually provided for all the Key Stage 2 classes, we actually provided a STEM focused workshop to really talk and educate the children around air pollution, what it meant, what was causing it, and again, what things we could do. And we actually did that with an air pollution expert, which in this case on the picture is Luke, as you've just heard. And we also developed teacher training and resource packs, so fabulous equipment for the teachers to be able to use to educate, play games, and really make it come to life. And we line that up with Ofsted and also the national curriculum to make sure it fitted within the kind of natural teaching year. So we made all of those tools available from an education point of view. If you click on, we also put a lot of technology behind it. Because it's very easy to say we need to change things in the future, but actually that can lose a whole generation. So what we also wanted to learn in those schools is, can we do things today to actually improve the indoor air quality for those learning environments? So we as the Philips Foundation also gave 10 air purifiers from Philips to all of those schools. So that's again with a significant value. And we train the teachers and all the staff there about how to use them and how to understand the use them. So we put the purifiers in the classrooms, into shared spaces like assembly halls, and actually what the research showed was fascinating, that if you use the air purifier in a classroom for a short period of time, you actually reduce this PM2.5. So this is the particulates in the air that are again polluting the environment, the smallest particulates that we really measure, and actually reduced by 37% in the classroom. So those classrooms were a third cleaner to learn in by just doing these things. So very simple things made a big action. And again, we had great feedback from the Russell Scott Primary School where we kicked this all off. And it really touched home when we did the launch of this, that when I asked the pupils in the hall how many of them were using an inhaler, around a third of the children in that hall put their hands up, which is just staggering. And they are in one of the areas where, again, we identified in Greater Manchester it needed some support. So a third of the children, and then we said, how many other people do you know use an inhaler? And then over half the hall put their hands up. So a clear call for action and a need to do something immediately. So we put the education out there, we put the technology in there, and then with the University of Manchester, we ran this research. And what's really interesting in the research is that we really identified something we knew, that children are particularly vulnerable to the impact of air pollution, both on their health, but also on their learning. So from a health point of view, what we really understood was that actually, if we could reduce air pollution by 50%, there would be half as many children having lung function issues around the country, which sounds logical, but again, is fairly shocking to see what we can do. So there's obviously a clear action we need to do for the health of these children, to get all of these children off inhalers where we can. But also the modelling was very interesting around learning. And what we actually learned with learning is that if we could reduce air pollution levels by only 20%, it would actually improve the ability to learn by 6%, which is the equivalent of 1 month's extra learning per year. So if you put that in context, so for 20% reduction in air pollution, a child gets an extra 1 month's education every single curriculum year. It's just a staggering piece. And when we were actually in lockdown earlier this year, unfortunately, we saw the national levels drop by 40%. So what we're clear on is that getting to a 40% permanent reduction is probably unlikely. But we think that actually a 20% sustained reduction in air pollution should be achievable if we actually take some of our new behaviours and our new activities and lots of the things we're developing in this framework to actually do that. And that would really make a big impact to children's learning, especially in those areas around the country where the air quality is so poor. So I'm a parent. This is very meaningful to me. This is very important to the foundation. I hope this is a wake-up call today. I'm delighted that on Clean Air Day we can, again, get the framework spread as wide around the country as we can to get schools to adopt it, communities to really take action, and so we can make a meaningful impact on the children in this country for the current generation. So that's what we're doing, Luke, and I'll pass it back to you to take over.
Great, thank you, Mark. Sheila, I just wondered if you had any thoughts yourself as to the statistics shared on the screen there. I know personally, I think when we heard that back from the University of Manchester, it did take my breath away.
Well, they're shocking, aren't they? And it's extraordinary that we live with this. It's extraordinary that we don't push back much harder. I mean, a month's learning when we all, as parents, I'm a parent too, and non-parents actually, grandparents, aunties and uncles, we all care about our kids' advancement and learning. And there we are throwing away a month's worth of their learning on this thing. And of course, every day something else emerges about the impact from the womb onwards of this dirty air on our kids. So it's got to be acted on. And I think Philip's Foundation intervention here is just very powerful. And as a parent, I thank you for it. And I hope and can see how the kids in school got a lot out of it.
Thank you, Sheila. I can see a few questions have popped up in the chat. We've got some time in at the end of this, so we'll be able to answer them then. So please do keep them coming in using the Slido function. Next, I am now going to talk about the actual framework. So as Mark so clearly put, one of the aims of the project was to give every head teacher, parent, governor across the UK who are concerned about air quality, to give them a tailored tool and a free online tool that they could use to evaluate the air quality in their school and to work out really what the most relevant and most suited actions were for their school. So the work that we did in Greater Manchester really did set the foundations. So the 19 schools we worked with helped us shape the framework. So the 37 actions that are included, we tested and trialed these with the teachers and took on feedback as to what was possible and what wasn't. We worked with the academics at the University of Manchester to go into schools and to test and to look at academic insights into the impact that the different actions have. We know that not all of these actions are free, and so we really dove into the detail in terms of the benefits that each action has, the amount of effort it requires to use it, and to really come up with what we feel is a complete set of actions and advice that schools can do. So the tool, I'll go through it in just a moment. It's online, it's free. Its aim is to inspire those to tackle air quality. Now, you'll see on the screen now that the framework was endorsed by our friends at Phillips Foundation, Living Streets, Moja Stars, Mum for Lungs, the National Association of Head Teachers, and many others. So the framework was designed really around these four key principles, and that is that to reduce air pollution from a school's own operations. So these are things like the emission from the boilers or the deliveries that the school gets delivered. Next are tackling air pollution at the school gate. So this is everything from idling vehicles through to promotion of active travel, cycle facilities, anything to do with that. Third up, we had education. And so this is around educating the next generation and really bringing families and students together so that they can make cleaner air choices, which is beneficial for all of us. And then finally, to become a local leader on air pollution, which is wonderful. Now, as I said, our 37 actions, we've split them up into 4 pathways that we feel really help to understand the aims of the framework. And so that is the student voice. We're going to hear from Sheila at the end of this presentation. She's going to talk us around the school run scandal. And that, I think, is the perfect example of students using their voice to tackle air quality. Education, so again, just the importance of bringing everybody on the journey of tackling air quality with you. Of course, there's a focus here on students and incorporate student learning, but it's not to be forgotten of embracing teachers, but also the school community on the journey. Operations, as we've said, what's going on in the school, and then the school gates. You know, we felt this deserved its own category because the school gates is definitely a large share of our actions and what people can do to tackle air quality. As I said before, all of our actions, they're split up in terms of the amount of effort that's needed for them, the costs associated with them, but also the amount of time it takes. And so what I'm going to do now is run through the framework with you and share the demonstration. So over to Claire, if you could move it to my screen share, please, that would be great. Great, okay, thank you very much. Let me bring you in. Perfect, okay, so that was my technical skills there letting me down. So as you can see on the screen now, this is our Clean Air for Schools framework. We'll share the link in the chat so that you can come along and check it out yourself. But I wanted to show and demonstrate just how easy it is to use. So first of all, a head teacher or teacher, local authority or parent, anyone can come along and log in to use it. So first up, you'd to be asked a little bit of information about your school. So you can see here, pop in your school name, your postcode as to where you're based, and also the number of pupils, as it's important for us to monitor the reach of the programme. Now, the next step is to complete our school air pollution survey. So the purpose of these 7 questions are really to tailor the experience for each school, and so that out of our 37 actions, we can promote the actions that we feel support your school in the best way possible. So these are things like, is there a major source of air pollution near your school? You can click yes or no. Are you near a busy A road? Again, yes or no. And you can work through these questions with advice if you don't know the answers on the side there to basically give us insights into what your school likes. As you hit save and you scroll through, this is now where you see our list of actions, which are great. Now we have them split into 4 pathways, as you see along the screen here, and you can go into each one. So for example, if you look on the left of the screen here, you go into our first pathway, so traffic at the school gate. You can go through the actions and learn a little bit more about them. So implementing traffic restrictions, I can see here that it's 3 out of 3 for its impact on air quality. It's got a cost estimate from ourselves of 2 out of 3, and then an effort of 3 out of 3, because we understand that from a school's perspective, this might take a little bit more time than some of the other ones. As you click on read more, you can see some of the suggestions we've got. So holding a play street, closing the road outside schools to cars permanently, or organising a car-free day. And then as you scroll down, you can see the co-benefits and also signposted to all of the resources and case studies that we have. Now, our friends that have endorsed this programme, as well as our own, this is where we've really scanned across the internet and looked for the most relevant resources we have and to signpost you then to here. So you can hide that, finish through, and now you can add all of these actions to your action plan, or you can skip to say we've already done this. You also have the option at the top of clicking view all actions. So if you want to see what actions we've got all inclusive of the 30 to 37 and not just the ones that are incentivized for yourself, you can scroll through and tick them off as you go. Then once you scroll through, it brings you to your Clean Air action plan. And here at the bottom really are then the actions that you've selected, all brought into easily and digestible format. So it's very straightforward. We suggest it takes users about 10 to 15 minutes to fully engage with the framework and read through the questions and click on the relevant resources. But we feel this leaves the end user with a perfect talking point to talk to your teachers, your head teachers, or your local authority on tackling air quality. So I'm going to stop sharing and go back now to our PowerPoint presentation, please. Excellent, thank you very much. And so we've just got up here now a screenshot of one of the Clean Air action plans, the one that I've done earlier in true Art Attack style. And now that wraps up the end of our Clean Air for Schools framework section of the presentation. And I think it ties in wonderfully well into the work we have done with Sheila Watson, Director of the FIA Foundation, called the School Run Scandal. So Sheila, I'm going to now hand over to you, if that's all right.
Yes, that's fine, Martin. Thank you so much. That's a really inspiring piece of kit that you've got there. I think that will be very welcome, and I hope it will be very welcome to people looking to take action in this area. So hello, everybody. I'm Sheila Watson. I'm actually the Deputy Director of the FIA Foundation, but thank you for the promotion there, Martin. It's long overdue, obviously. The FIA Foundation is UK-based. We're a charity. Our objective is to promote safe and sustainable mobility around the world. So we work in lots of different countries. And it was our pleasure to support and work with Global Action Plan on this project. The objectives of which really were pretty clear. You've had a great deal of the background laid out to you about the awful health impacts of poor air quality. And you've heard a lot, I think, from experts about the impact of those things. We believe very strongly that we need to give young people a voice in this debate, and their parents, but particularly young people. And so the objective of this project was to do that, at the same time as supplying useful educational tools for teachers, just like the wonderful Mr. Patterson. And I imagine there are many, many more on this call today, just like him, keen to share with kids good learning and to get them to challenge and to get them to question what they see in the world, which is really the core objective. So we teamed up with Global Action Plan in this project called the School Run Scandal in order to do just that. So next slide, please. Thank you. And so the challenge, as I say, I think we've heard a little bit about this. We know how awful dirty air is for all of our health, but it's particularly scary how bad it is for children. And it's bad because it creates problems in their childhood, which will have potentially lifelong impacts, not just obvious health issues such as asthma, but also even now it is becoming clear around their ability to learn and other developmental issues. Alongside that, we also know that we have a big UK manufacturing industry, a big global manufacturing industry around vehicles, not just cars, but vehicles more generally. And that those vehicles are actually responsible for about 80% of the problem pollution that we're thinking and talking about today. But that they make, as an industry, a huge contribution to the economy. And a lot of jobs are in this sector. So it's not an easy discussion to have sometimes about how we improve that sector. But it's a discussion which is happening, and it's very important to say as well, there are many new jobs to be had in the new technologies and many aspects of our industry which are leading those technologies. So that's the second consideration in a way within this discussion. And then the third consideration, as I've already described, is the voice of young people. And we know we're hearing that voice all the time now. We're hearing young people and seeing young people come together and say enough is enough really across quite a few environmental issues, but including dirty air. And of course, the great Greta Thunberg, who is leading a lot of this discussion and is seen as, in many ways, the key advocate among young people, I think is inspiring others to want to get engaged. So those voices aren't being heard well enough. So the project, next slide, please. Sorry, yeah, thank you. So the project was put together by Global Action Plan. We supported it with funding, had several elements, was rolled out into schools between May and September of this year. Not the ideal time, but thankfully there was take up, and we'll talk a bit about that in a moment. We provided a briefing pack, lots of information in there about those background issues, which I've just briefly touched on, and resources that enable students to interrogate different aspects of the elements of this debate, which can seem complex and difficult, and which were educational at their core, enabled them to deploy some aspects of some citizen science, to learn how to use data, to learn, as I say, how to question. There was some support from the team at Global Action Plan as the projects went along. And of course, and today is part of this, but there will be more of this, I know. We wanted at the end of that to say thank you to those who took part, to celebrate the work, and we'll share it now, and that's part of it, but also to go forward and do more work in the future together. Next slide, please. So we had 4 schools which took part in the School Run Scandal work, and coming out of this project there were several outputs we'll talk a little bit more specifically about, because they won't mean much to you just on this list, but there was a really quite reasonable response. But we certainly would want and encourage others to use this resource in the future. And I should say now this resource will be added to a resource, a toolkit which we at the Foundation host, which is globally focused, is the Child Health Initiative Toolkit. And it contains materials rather like the ones Martin just shared, which are there to support people trying to take action in this area. Next slide, please. So the students had, as I say, quite a bit of evidence put in front of them. The first piece of evidence, which we probably all could do with looking at, is the proof which the initiative called the True Urban Emissions Initiative has established, that very often on the road, when they're being driven, vehicles are much more polluting than they are said to be or described to be in tests. And that's not because people are cheating the tests, but it's because on road there are very often issues that are different, and because in reality sometimes the delivery, the vehicle operating on the road is just nowhere near as clean as we're led to believe when we first buy them or rent them or use them in some way. Now, of the children taking part in this, 105 ran their own cars, their mum or dad's car, I imagine, through the True Initiative website, and anyone can do this. You can find it at www.trueinitiative.org, and you put your make of your car in. It's really very like what Martin just did. You put in various aspects of what your car, the features of your car, and it will tell you whether your car is good, i.e. emitting what it should, moderate, which is emitting a bit more than it should, or poor, which is emitting 3 times or more than it should. And what was very interesting, as I say, is when the children tested their cars, they found that at least 2/3 of them were emitting more than they should. So 2/3 of them fell into the poor or moderate rating. And as you can see on here, our student investigators thought that that was quite shocking. I think they probably believed that if a car supposed to emit something, that's probably what it emits on the road. So they learned that. They also learned that there's an awful lot in vehicle advertising which is not quite as it appears. And so again, they took some time to look at a lot of adverts, finding that at least 3/4 were focused on old, as it were, technologies, petrol and diesel, and only 1/4 were for the new cars, which are lower carbon and less emitting, the electric or hybrid vehicles, and they were shocked by that too. And I think this is a great thing for kids to be doing, regardless of what the advert is about. We should always question what we're being told by people who are trying to by people who are trying to sell us things, and that's something that the kids learned in this part of the project. And the next slide, please. And then finally, they learned a little bit about some of the work and the other activities which are happening in the field, and what many other organisations, in this case Sustrans, are saying about the extent to which people want to see this change. And we learned from this project just how many children in this cohort were shocked by what they found out about real emissions, were shocked when they really thought about adverts for vehicles by how few really were saying anything to promote the new types of mobility, and also I think in many ways were encouraged by that into feeling they wanted to have their voice heard. And so very many of the students then took up the idea of writing to vehicle manufacturers to challenge them on some of these issues. So really getting their voice heard. Next slide. And I think, Martin, you're going to talk a little bit about what they wrote and the sorts of responses that they got back.
Yes, thank you, Sheila. So I'm going to share with you a quote now, which has just made my day when I read it, I must admit. So from the students that wrote letters to car manufacturers, 19 letters were sent. You can see at the top of your screen, shared with the likes of Volkswagen, Seat, Mercedes, Land Rover, BMW. The students were very passionate about actually taking what they learned from their activities and asking questions of the car manufacturers. And so on the left here, you can see a letter that a student from Glade Primary School in Essex wrote to the CEO of BMW. And I'm just going to read from it because I find this quote amazing. So car manufacturers are deceiving car shoppers by attempting to lure them into acquiring petrol or even diesel cars. This is annihilating the environment. And I just love how emotionally involved the student is, and perhaps saying things that as adults we find ourselves not necessarily as comfortable being able to say. And so what I can share as well is that the companies, they had a number of responses from the car companies. I know that VW got in contact with one of the students and actually came back to one of the schools to run a second workshop in the schools, and the students had the opportunity to talk to the car companies and ask them questions. And they had various other responses as well from car manufacturers, but none others that actually wanted to go into the school and talk to the students. So I think it is interesting actually looking at the responses from the car manufacturers to see how they responded to the students differently. There were 5 key themes really that came out of the students' work and the letters, and you can see them on the screen now. So first off, just a fairly large mistrust towards car manufacturers. There's a lot of frustration with car company behavior that comes through the choice of their language in communications. Next, the belief that car manufacturers appear to put profit over health. Now, we did provide evidence to the students, but it was very much encouraging them to go out and to kind of, in true investigative style, to do their own research. These opinions have come through that additional research that they've done themselves, which is lovely to see. Fourth, we've got suspicion that car companies aim to keep fossil fuels as their best sellers for as long as possible. The students were really quick to point out and were shocked when they saw just how low the percentage was of the advertisement budget that these large car manufacturers spend on advertising EVs in particular, compared to the fossil fuel vehicles that they see. And as you said, Sheila, the students actually got in front of their TVs and looked through their newspapers and did do their own research into see what adverts they would see, and then also what percentage of them were EVs. And then finally, the fifth point that came out really was the support and praise that came from some of the students to actually car organisations and industries that seem to be making a difference. Now, our brief to the students was to choose whoever they wanted to speak to. And it was nice to see actually that the students weren't just targeting those that they felt were at fault and to blame. In fact, they actually wrote to organisations like Tesla, for example, and wanted to ask their advice and encouragement on how others could follow suit. So that was really nice to see.
There's lots of tasks going through. The main task, though, is...
Right, okay, what I'm going to do now is share with you a video from one of our teachers at a school in Balham, who, because of the COVID lockdown across summer, the students were working remotely, but this teacher, Maria, her and her class did a wonderful job of writing letters, and I feel like the way Maria ended her presentation to her students was definitely worth sharing with you. So we're going to have a minute now of listening to Maria.
There's lots of tasks going through. The main task, though, is once we've collected all the information, is to write this letter. Please, 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 if you're in school, Mrs. Hatcher will help you. If you are at home and you need some help, put a comment on the stream and I'm there to help you. But it's really important that you complete this, because this whole thing is going to be presented to the government. So all the information that we've got from us and from the other schools involved is going to be taken by the charity. They're going to put it all together and then they're going to present it to the government. So it's really important that we help out, because we can change things. You know, we're using our voice to be able to change things, which is fantastic. I hope you enjoy it. Please, if you've got any questions, let us know. And I look forward to seeing you soon.
Wonderful. It's always nice to hear. Sheila, at this point, I'm going to invite you back, and really it'd be nice to hear what you think of Maria's address to the students there, but also any kind of final thoughts from the programme and why it stood out to you would be great.
Thanks, Martin. Well, I mean, I think it's amazing to hear Maria. It was amazing to watch the whole lesson that she led, and to see actually the extraordinary work teachers have been doing in the lockdown in general. But I think I just want to emphasize that this material that was shared with the kids was about learning. It was educational. It was basic information, which enabled them, I think, not only as investigative students, but as consumers of the future, to challenge what they're told about the things they're being encouraged to buy, and to run that information past what they really care about, which for very many of these children, as they showed here, as our children this morning showed in 2WP with Mr. Patterson, these are things they care about, and they should be helped to challenge that. Now, for the foundation, our work is very much about supporting children to have a voice, not only around these issues, but associated issues around road safety and other aspects of their journey to school and their time in school. So we're delighted that there was this response to the work. We'd love to see more response, and as I said, we'll share it further. And we're absolutely determined also to look at whether or not this is something that can be used internationally, so that children in other schools, these problems are really very global. Air quality is appalling for children all around the world. And I think there are aspects of this work, aspects of the wider work that you're doing, that we would want to see shared there as well. So thank you for the cooperation and for having us here today to talk about it and for sharing it. And yeah, we look forward to further cooperation in the future.
Thank you, Sheila. We have just under 5 minutes left, actually, and I think with the minutes we've got, we can dive into our questions, and I'd ask you if you can help me answer some of them if I read them out. Just before that, I wanted to share my thoughts on the school run scandal and just how it is the best example of that voice element of the school framework. It's a really strong resource, and to let everyone know that Global Action Plan had submitted a response to the government's consultation onto ICE phase out date earlier this year, and what we've learned from the student and their quotes and their emotive language and their data helped us contribute to that. And we're watching very interestingly onto what will happen with the government and the phase out date in the next few weeks and months. But it really is just a perfect example of students using their voice and changing things, if that's within the UK or if it's wider afield, as you said, internationally. Right, now I am going to share with you a video now from Southampton, a school in Southampton, on school streets and how they've been setting up a school street down there. In the few minutes, I'll look through what questions we've got, and then we'll come back to the questions at the end of the video. So thank you very much, and on to the video.
This is Shirley Junior School, and they applied for a school street just before the summer holidays because they were having problems with social distancing at the school gate. A school street is where the road outside of school is closed to cars at drop-off and pick-up times for around 40 minutes to an hour.
So normally you have cars coming up here and getting stuck, trying to turn around, and they've got nowhere to go. So this is always just nose to tail all the way up here.
We made the decision to apply for a street closure to keep the children and the community safe. We only have one entrance in and out of the school, so we felt this was a really good way to provide a safe space for the parents to wait and the children to access the school safely.
It's been wonderful to see how calmly the children have been able to go about their business, arriving at school and coming out at the end of the day. And the residents have enjoyed it too. We've had lots of comments from residents about how nice it is to have cleaner air and to have a quieter atmosphere around the school.
Great, wonderful to see. Now, Sheila, I've just had a look at some of the questions, and in the minute or so we've got left, one that comes out in particular is, how do you suggest we engage schools in the clean air agenda when they are short on time and resource with additional pressure from implementing COVID measures? Now I can go first, and then it would be good to hear yourself. So I think everything we've done and do at Global Action Plan is designed to make life easier for schools. We don't see it as additional work. All of our resources are designed to complement the curriculum, and also everything's free and simple and easy to use. And I think the co-benefits of not just talking about air quality, but talking about things that link well to mental health, and reinforcing the letter writing from students, and just generally tying in well. I know with additional pressure from school streets, with additional pressure from social distancing, school streets is actually a really good solution to having more space at the school gates. Over to you, Sheila.
Well, I think you're right, and I think for teachers and pupils and their parents, information is absolutely essential. The True initiative information that you shared just then, your toolkit, they're all independent, free at source, open resources for people to use, and I think it's great we put them together in ways that enable them to be part of a child's education. So that's vital. Alongside though that, I think it's absolutely essential that we all work as children and adults to address some of the very core issues here, which is our global fleet of vehicles, and not simply to place this in some sense of burden on schools, which, as you say, are very overstretched. I have to say, on school streets, which look like an increasingly exciting resource, we're supporting some work in London with Bloomberg Philanthropies to assess school streets, to just work out exactly how good they are in terms of air quality, and we're really hopeful that's going to show that they're a great idea and that therefore more people will do them. So I think we have to support teachers. I think we have to support parents and kids to know what's really happening and to challenge. And I think we have to act on the sources. And that's a lot of governments nationally and globally.
Perfect. Well, thank you for summarising that up. We will get back to the questions where possible later in the day. Thank you very much. And now I'll hand over to Luke.
Okay, so a great example there of students making their voice heard on the air quality issues through the school run scandal, and some fascinating and really important research helping to create a brilliant new tool for schools, the Clean Air for Schools framework. Thank you, Martin. Thank you, Sheila. And thank you, Mark. And I have to say, if that's not the perfect answer to the question that came through on Slido before, what is the most impactful thing we can do to clean up the air around our school? Well, I suggest you go to transform-our-world.org and download and access the Clean Air for Schools framework and get started on your very own tailored air quality action plan. Now, news just in on the socials. We're seeing that schools in Mendip are promoting no idling today. Fantastic work over there. Great to see. Keep those stories, quotes, comments, videos, photos coming in through the various communication channels. In particular, as I said earlier, on Twitter using the hashtag Clean Air Day. But that's it from me this morning. I hope you've enjoyed the session so far. There's so much more fantastic, inspiring content to come for the rest of the day. I hope you stay tuned and enjoy that as well. And now I'm going to hand over to my colleague, Catherine, who's kicking off the session on campaign. Thank you, everyone.
Hello, good morning. So my name is Catherine Kenyon and I'm a Programme Manager at Global Action Plan. Thank you very much for taking the time this morning to join our campaigning session. I just wanted to flag that we're really excited, as Luke mentioned, to see groups across the country taking action on Clean Air Day. So we've seen Trinity Active Travel Hub have been running a pledge competition. We have Clean Air Cheltenham are running several events, including a poetry workshop, and Extinction Rebellion Banbury are hosting a walk to school day. So in today's session in particular on campaigning, we want to take a closer look at air pollution and sharing our favourite imagery, our assets and campaigning tools to help people see and understand air pollution. We're going to be discussing how we can become more powerful in getting our points across by collective posting on socials, simultaneously with other campaigners. We're going to hear firsthand from a range of campaigners, followed by an opportunity for you to ask them questions in a live Q&A session. We're really pleased today to be joined by Clover Hogan. Clover is a climate activist and researcher on climate anxiety, and she's also the founder of Force for Nature. Force for Nature is a launchpad for young people to realise their potential by taking on the planet's messiest problems. Clover will be talking us through the campaigning tools and strategies that can help people to better see and understand air pollution. And then, so there'll be a chance to ask Clover a couple of questions. And then we've also got Afsana Salik, who is a community organiser at Citizens UK, talking about her work in Tower Hamlets. And then we're going to be joined by Andrew Grieve, who's been working with fellow parents in Islington on a Nocado campaign. So first I'm going to hand over to Clover. So Clover, a very warm welcome to Clean Air Day Live.
Thank you so much for having me.
Excellent. And right, I'll hand over to you.
Awesome. All right, hi everyone, and thank you for that brilliant introduction, Catherine. So my name is Clover Hogan. I am a 21-year-old climate activist. I'm a researcher on climate anxiety and our psychological responses to big, messy challenges like climate change and air pollution. And I'm the founder and executive director of Force of Nature. So for a little context about how I arrived where I am today, I grew up in Australia's tropical North Queensland, fishing frogs out of the toilet and dodging snakes that hung from the ceiling. So for me, nature was never an other. It was always a really important part of my lived experience. which is why it came as such a shock to the system when at the age of 11, I first started watching documentaries. So I watched The Cove, An Inconvenient Truth, Food Inc., and it felt like I was having the rug kind of pulled out from underneath me, which I think is the case for many of us when we first learn about the problems and we learn about how humongous they are. And yet in that kind of mix of overwhelm and anxiety and fear that I felt about the future, I also felt a lot of hope. And that was hope that came from the people on the front lines of this movement, shining light on the issues, the journalists, the filmmakers, the campaigners, who were bringing these problems from the kind of periphery of our awareness to taking front and center stage. So at 11, I decided that that was what I wanted to do, and that's what I wanted to commit the rest of my life to. So my first act as an influencer and using persuasive tools was to convince my family to leave Australia to move to Indonesia so that I could go to a place called the Green School, which is wall-less bamboo classrooms in the middle of the jungle. And other than having compost toilets, Green School is unique in that instead of asking young people to pursue careers that are convenient or that we don't really have any love for, it asks young people which problems they want to solve. And I found what that problem was for me as a 16-year-old campaigner at COP21 in Paris. So the global climate meeting when leaders from around the world came together to actually discuss what are we going to do about climate change. Up until that point, my campaigning had been at the grassroots. So I was very connected to the people I was trying to persuade and motivate. And yet at COP21, it was the first time I was really in that seat of power, and I was where decisions are actually being made at that level. But I was also, for the first time, confronted by vested interests, greenwashing. So companies saying that they're doing one thing and then doing another. And it was the first time that I really experienced kind of bureaucracy. So I felt very frustrated. I felt very overwhelmed. And for the first time, I felt powerless. I felt like the challenge was too great and that I was too small to do anything about it. And that ignited in me a fascination with why we respond to challenges in the way that we do, and why it is that we shut down rather than step up in the face of existential threats like climate change, or even invisible threats like air pollution. And so in the past 6 or so years, I've really been lobbying decision makers, policy makers, and business leaders to wake up to the urgency of the challenges. And in that time, I realized that both the greatest threat is this feeling of helplessness in the face of the problems, but also that the greatest tool that we have is that of mindset. So our ability to actually change the stories that we subscribe to be able to create much greater change in the world. And so I've had some success in being able to persuade and influence in different spheres of power. And so today I would love the opportunity to share a little bit more about what some of those tools have been and some of the strategies that I've employed that can be used for getting people to care about air pollution and really take action on the issues. So the first lesson, I suppose, is around how to frame your problem and knowing who you're actually framing that problem to. So as I mentioned, climate change is a big nebulous threat. Air pollution is largely an invisible threat. And it's really hard to get people to care about things that are so far removed from their day-to-day, right? We already have lots of stressors and anxieties and things, a lot of people are more concerned about, how to get food on the table at the end of the week. And so we have to identify what those barriers are, and we have to identify what it is that people care about. So for a long time, climate change has been talked about in the context of polar bears and solar panels. And I don't know about you guys, but I've never seen a polar bear, and I don't think solar panels are all too interesting. And so in the climate kind of sphere, we're learning new ways to actually articulate climate change in a way that relates to what people care about in the here and now. And the same goes for air pollution. So first, you really want to identify who it is you're speaking to. You have to make the problem visible to that group of people, and you have to make that problem relevant to their personal lives. So you have to identify your audience and you have to identify what it is that you care about. The tendency, if you're someone who wants to become a campaigner, is like, I care about this issue and everyone should too, and I'm going to get the world to care. But the problem then is that you can really dilute your message and you're not really targeting anyone in particular. So you want to get super clear on who is it that I'm actually trying to persuade or influence or invite to change. And when you've identified who that person is or who that group of people is, then you can think about, all right, how do I craft a compelling message to the things that they care about? So the Clean Air Day campaign has identified that they're really trying to create change in the UK. So that's why you don't hear kind of global statistics about air pollution, but they're very specific to the country. So they share stats that from the UK, air pollution causes up to 36,000 deaths per year. They've also identified that something that is super personal to people that they do care about is our health. They talk about how poor air quality causes heart and lung diseases, how it impacts children's lung development, and may even contribute to mental health illness, which is something that we all kind of understand and is something that we all care about. And one way that they've done this is through the Build Back Cleaner Air campaign. So you can go to the website there at Global Action Plan and actually see this really compelling campaign they've pulled together around lungs. And you can see these beautiful kind of flowering lungs that are flourishing when the air is clean versus the kind of dying, decaying, flowering lungs when the air is dirty. So it's showing a very clear distinction about this is what clean air looks like versus dirty air, and here's how it specifically relates to my own body, which of course is something that I'm going to care about. And they've also been super successful in identifying key stakeholders and key audiences too. So as much as you have focus to an audience, you can have specific audiences that you're speaking to, but you're not going to expect them all to kind of care about the same things, which is why you need to tailor your message to each group. One audience that Clean Air Day has identified is obviously parents. And one way they've kind of targeted parents is by shaping the message around children. I just saw from Global Action Plan that there was, stories in the newspaper talking about how clean air can actually boost your children's memory, and how cutting air pollution near schools could actually improve learning in the classroom. Now, of course, this is something that parents are going to care about. And so by creating that visceral emotional link, you're going to catalyze change in a new way. And I've seen the same impact when I'm campaigning in the boardroom. So I will walk into a boardroom and my job there is to wake up a group of business leaders to the urgency of climate change, to wake them up to their responsibility and the role that they have to play, and to actually catalyze them to act. Now, I don't kind of waltz in there and say, well, you should care about this problem, or it's important to me, or you should do something because I say so. None of those tactics are going to be very successful. But one thing I have identified is that business leaders, even more than their bottom line, how much profit they make, ultimately care the most about their kids too, and the young people in their lives. And so I found that one very compelling stakeholder group and one very compelling ask to those business leaders is that they should be doing it not for their company, but they should be taking action for the future of their kids and to make sure that their kids are able to inherit a thriving planet. And that has by far been one of the most effective tools that I've identified to date. The second big lesson is around creating your vision. So many young people today are very despairing about the future. When I asked my parents about the future they envisioned, it was one of flying cars and disease being eradicated. And yet when I've worked with 8 and 9-year-olds in the classroom today, they've described something quite different. They talk about cities being underwater, they talk about empty supermarket shelves, and they talk about a planet in decline where air is too toxic to breathe. This is really heartbreaking and scary to hear because it shows that we're really lacking a compelling vision of what it is that we're working toward. And it's not surprising that this is where we've landed by way of vision. Whenever we think about climate change, we think about the fear and the doom and how scary it is that this thing is coming toward us. And it's much the same with air pollution. When we hear some of those scary stats about just how many people die every year from poor air quality. So as much as we focus on the problem, we need to balance that communication with the vision of what is possible. So what is it that's the alternative that we actually want to work toward? And once you've identified the problem that you want to take on, be it air pollution or microplastics from the fashion industry or food waste or racial inequality, you need to be just as good at articulating and imagining a world where those problems have been solved. And the flip side of how royally we've messed up the planet is how many ways there are to help it. So as much as you speak to your problem, you need to invite people to be part of a really compelling and exciting invitation of how this is an opportunity to rethink the way that we live and to lead much healthier, greener, happier lifestyles. Which takes us to our third point, which is to get clear on your goals. So you can't become a campaigner until you know what change you really want to create. It is easy to talk about all of the problems, but it's quite a bit harder to actually think, what are the changes that are going to help us deliver on that vision that we just mentioned? So think about what the changes are that are going to deliver on that better, brighter future. As you think about that world where that problem has been solved, in between that better tomorrow and where we stand today, what had to happen to bridge between those two places? So think about what those steps are going to be and condense them into clear goals that you can articulate to the audience that you're trying to get on board. So what are the alternatives and what are the solutions that you're really presenting? So once you're clear on your targets, you can then package them in a way that are really easy to understand. And in the case of Clean Air Day, they've identified 3 key goals, which you can see on the website at cleanairhub.org.uk. So the first is to improve public understanding of air pollution. The second is to build awareness of how air pollution affects our health. And the third is to explain the easy actions we can all do to tackle air pollution, helping to protect the environment and our health. So they have clear goals that they're working toward, and that's why all of the communication around this vision piece and the solutions is super compelling. We know what they stand for, not just what they stand against. And then to get clear on the changes you want, you really need to be clear on how to invite people to be part of that solution, which takes us to our 4th point around how to be an effective campaigner. So for a long time, sustainability has been really synonymous with sacrifice. So it's kind of been about how to pressure people into doing the right thing, or how to kind of sometimes guilt people into changing the way that they live. And the reality is this isn't a very effective campaigning tool. You know, people don't really like being told what to do, and especially if it's coming from a place of us versus them. So I have the solutions and I'm telling you how to live your life. You can be much more effective if, in line with creating that vision and getting clear on your goals, you can find fun, exciting, compelling ways to invite people to be part of the solution. And so one way that we did this in my first job was at Impossible Foods. So Impossible Foods is a headline grabbing company that makes meat from plants. So we realized that one of the biggest environmental polluters and one of the biggest air polluters, and of course one of the driving leaders of climate change, is the animal agriculture industry. So how many 4-legged animals we have in the world today that end up on our dinner plates. So Impossible Foods came up with an incredible solution, which was actually we can have meat, but instead of taking it from animals, we can take it from plants. Now, why this was unique is that Impossible Foods wasn't trying to force people into different behavior. We said from day one, we want to invite people to do something that makes them feel good without having to give up any of the things that they love. And the same thing applies to air pollution. It's not just about scaring people. It's not trying to pressure them to engage in a certain behavior. It's really thinking about how a certain behavior changes or certain actions actually going to improve my life so that I can be happier and healthier and more fit. So that's the invitation that we want to create. And obviously that can best come from a place of understanding what it is that your audience really values. So I'm going to wrap up there, and just as a quick recap, we talked about our 4 key kind of themes, the first of which is how to frame your problem and knowing who you're framing your problem to. The second is around creating your vision, so getting super clear on what it is that you want to work toward. The third is to know your goals. So identify the targets that are going to take you from where we stand today to where we want to end up tomorrow. And the fourth is to invite people to be part of the solution. Don't force them or bang them over the head with it, but give them an opportunity to care. That's one thing that I've really learned in my time as a campaigner, is that the problem isn't that people don't care. It's that often we aren't empowered to care. We aren't supported to care about the issues. So make it your job to get people to care, and make that as easy and fun and exciting as possible. Thank you. And then Catherine, I think, is going to come back for a quick Q&A.
Yes, I'm hoping my video will come on, but can you hear me?
Yes, I can.
Excellent, there we go. Clover, thank you so much for that brilliant presentation, and I think really, really helpful to see it in that light. We're going to have a little bit of time now just for some questions, and then we've got some really excellent case studies of campaigners really kind of living and experiencing what you're describing and working on the ground to mobilise for change. So in terms of questions, so we've had some on the live feed, and I guess really relating to your point on how we frame the question. So one of the questions we had is, why do you think that the issue of clean air, for example, has not been seen in the same way in terms of a threat as the global pandemic has, for example, with politicians, and what more can we be doing to show it in that same light?
Yeah, that's a really, really great question. So this is one of the things that really stuck out to me when the pandemic first happened, is the fact that, you know, air pollution is potentially, you know, killing up to 9 million people every year. Why is there not the same kind of urgency that there is? And I think so much of this has to do with the stories that we kind of subscribe to and how, again, we frame the issues. So the pandemic, I think we could all see that it was something that affected us very personally and very viscerally. And there was a lot of fear kind of enshrouded in that as well. But with air pollution, it's something that seems so far removed from our lived experience that it has kind of become normalized. And I had, you know, a moment when I first moved to London, and I'd blow my nose and there would be this like black kind of soot in there, and I was like, what on earth is going on? This is horrible. And I spoke to some of my friends at Global Action Plan, and they said, well, that's the pollution that you actually can see, right? And that's not nearly as dangerous as the stuff that you can't see, that you're inhaling every time you go on the tube and every time you're kind of breathing in gases from these vehicles. So I think a large part of it is just about visibility, and of course how media is kind of on board as that vehicle for change. Obviously the pandemic is all we've kind of seen in the news cycle for the past few months, and yet air pollution has never in history gotten that same kind of attention. So I think it's about making it that much more personal and waking up parents, teachers, people in power to realize the impact that it's having on ourselves and also on the people that we love, and to stop normalizing it. It's quite astonishing that we aren't talking about this more, but again, we don't kind of want to add to the fear burden that is already there around climate change and pandemic, etc. As we've seen over the past few months, air has gotten much better as we've kind of changed our behaviors. So let's encourage people to subscribe to those solutions for the long term, rather than just shutting off from the problems because it's yet another thing to care about.
I could not agree more. Excellent. Clover, the next question relates to a kind of a tool that's used by a lot of campaigners, so social media. So we've got a question on, is social media just shouting opposing opinions at each other, and does it help to build movements?
Oh, I love this one. So I feel in two minds about social media. So on the one hand, I think social media can cause us to feel really overwhelmed every time I go on Twitter, it's kind of like a black hole of doomsday news because there's so much kind of fear mongering. And it's the same thing when I go on Instagram. You know, I want to care about all of the issues, but in fact, in trying to spread myself super thin across them, I just end up feeling really, really overwhelmed. And that's in part, again, because the message isn't balanced. The fear messaging is not balanced with, you know, here's what you can actually do about it. And it's one of my great criticisms of how we talk about environmental and social justice issues in mainstream media is often we'll spend 99% talking about the problem and 1% kind of tapped on the end about like, but here's why there's hope and here's what we can do about it. And so we need to really rebalance. Social media is an incredible connector. There's no doubt about that. And I think Global Action Plan has, you know, done some really incredible campaigns about bringing attention to, you know, the number of ads that I'm exposed to and the time that I scroll through social media and the impact that has on my mental health. So I think it would be crazy not to use social media as a campaigning tool. But again, you don't want to just shut people down when they're already kind of at capacity. You want to say, well, here's the reality of the situation. Here's what you can do in a way that makes you feel good, in a way that is kind of empowering. And that isn't, as the question kind of framed, just more shouting into the void. You know, I think we can do more than turning off the lights when we leave a room or making monthly donations or signing petitions. I think you can create compelling invitations to get people to take ownership of problems and show up according to their skills and talents and passions. But you have to think from that place of balance and you have to think from that place of invitation.
Excellent. And Clover, just a last question from me before we hand over to Afsana. So we're going to hear some examples from campaigners, but I guess I had a question of, are there any other campaigners or campaigns that you've seen that have particularly inspired you, that, you know, you want to kind of give a shout out to or mention that you think, yeah, people should keep an eye out for?
Yeah, absolutely. So I went to school with two girls called Isabella and Malati. And when they were 10 and 12 years old, they decided that they wanted to take on plastic pollution on our home island of Bali. So in Bali, plastic is everywhere. It's in the waterways, it's in the gutter, it's when you go out to the beach snorkeling, you see more plastic bags than you do fish in the ocean. So at that very young age, they decided we want to do something about it. Now, they realized that plastic pollution as a whole was a huge kind of overwhelming challenge. And so they decided to get a little bit more focused. So they said, we're going to take on plastic bags. And I think this is a very important tip with campaigning as well. Get clear on your problem within a problem. So they identified plastic bags. And then they did the very audacious thing of saying, we want to get 1 million signatures to ban plastic bags on Bali. And they at that time didn't quite fathom how huge of a number that was, but they did something very clever. They stood at the airport every day and got the tourists arriving in Bali to sign this petition. And then they took this petition to the governor of Bali, who cares about tourism more than anything else because it's the main industry. So they identified that a key person of influence and change was the governor, and they identified that pressure put on from tourists was going to be something that actually catalyzed him to act. Now, a few years later, they still haven't reached 1 million signatures, but because of their campaigning, Isabel and Malati have gone on to become UN ambassadors. Their movement has now become a global one. They're in over 26 countries around the world. And as a direct result of their campaigning, Bali is the first island in Indonesia to ban plastic bags. So here's the power of two young girls saying, we want to do something about this issue. We're going to be super audacious. We're going to be targeted in our messaging. And we're going to identify the people in this system who are capable of creating change. And we're going to identify what it is that they care about so that we can kind of twist their arm to get on side and to do so from a place of how we can restore the beauty and the nature of our island. So there are two campaigners who have been super effective and have the results to show for it. So I would definitely check them out and encourage any young person listening into this to show up with the same audacity and imagination and not be limited by what it is that you're capable of changing.
What a superb example for us, Clover, and something that I hope we can apply that learning to in terms of the clean air world. So thank you very, very much.
Of course.
Okay, so Clover, I think you're going to stay online when you have some other presenters speaking, and then a kind of wider Q&A session, but we're now going to move over to Afsana Salik. So Afsana is a community organiser at Citizens UK, an organisation that organises communities to act together for power, social justice and the common good. Afsana will be speaking about how air pollution became a priority for Tower Hamlets community and Telco members, where among other things, she helped to win campaigns for electric ice cream vans. So Afsana, a very, very warm welcome to Clean Air Day Live.
Thank you. Can you hear me?
I can hear you, yes. Hi. So I understand you have a presentation to share with us today.
Yes, great. Yeah, I do. If I can. Thank you very much, Catherine, for inviting me here. It's a pleasure to be here with such a number of panelists sharing a lot of great work that's happening in our city and around the world. That is giving us a lot of hope that we can come across and we can actually tackle this crisis that we are facing in our environment. Very lovely story from Clover. Thank you for sharing this. Shall I begin, Catherine?
Yes, please, thanks.
Right, thank you. Hi, everyone. My name is Afsana Salik, and I'm a community organizer for Citizens UK. So in my session, I will be focusing on how community organizing and citizen science method helped us improving air quality in our neighborhood. And also we made some great change in our local parks and while building a very good relationship with our local council. Firstly, I would like to talk about what is community organizing. Community organizing is all about bringing people together to work on common issues that our community is facing today. Air pollution is certainly one of the common issues our institution was facing. And we found out about that by doing community organizing training through our listening campaign. Why did we believe in community organizing? Why is that an effective method? So we have seen a lot of protest on our screen every day. There's a lot of mobilizing going around our cities, people fighting for racial justice, environmental justice, economic justice. A large number of people, they do get involved in this sort of protest. They get a lot of attention from media. I always wonder, like I studied international relations and politics. Yeah, it is one of the methods I've been taught, but I've always wondered how much change people make by joining protest. And I always wanted to know, do we make change on the street? Or does change and policy, people make policy in a room? So I, as a BAME woman, a woman of color and faith, I always want to be part of decision-making table, part of the process, not just a big, mobilized crowd that sometimes only get a lot of attention, but not much done. So we thought we will organize our community. And how we do that, we become very intentional about change. We work based on common self-interest, not based on what the media or the statistics is saying. Although it was very clear that Tower Hamlet is one of the worst borough when it comes to air pollution. But still, we wanted to begin our campaign by doing a community citizen science training. We wanted our people from each institution, like East London Mosque, Queen Mary University of London, Salvation Army, St. George's in the East Church, the schools, to go physically out there, use the tube to test, what is the level of pollution, air pollution level, or how poor the pollution in their neighborhood, to understand the seriousness, to feel the urgency to take action now, and also to take ownership of the project. Can I ask you to probably move to next slide, if that's okay? So here is one of the difference between mobilizing and organizing, which probably I just touched on a little bit. Bringing people from just asking, hey, join the protest, versus bringing people from institutions, and then later on they develop themselves through the process. They aim to become more powerful than they were before. They learn about the method of change, and then later on they do bring change by themselves using this method. What I'm going to do now, this presentation will just show some of the pictures how we done that. Catherine, if you could just click, this is one of the method, which is community organizing method. We bring institution together first. We listen to what is their issues, the people within their community facing. For example, when we listen to the Islamic mosque, pollution didn't come the top issue. I'm gonna be honest, for mosque, for Muslim community, is Islamophobia is the top issue. They are facing a lot of hate crime, but they also have issues like housing. They also have issues like health. And we have seen recently from the Public Health England report, British Bangladesh community is twice more likely to die from COVID. And first 6 doctors in NHS died. They were all Muslim from migrant background. You cannot say these people don't know how to look after their health, but they are victim of the system. They could not use the system properly. A lot of things was not translated properly to them. So they have many other issues. But what we could do, we could connect how air pollution is also affecting all other issues that they're facing. For example, damp housing, for example, the health. They're living in a damp house, their area is very highly polluted, the houses condition are poor, and their health, having like people born with asthma, achievement rate is low in terms of going to school, and therefore they don't get into really good universities or probably get a good job, and that is affecting. So a lot of mistakes we make sometimes, especially the campaigns, they just talk about climate crisis, which sometimes, as I myself, me, I don't see how it's affecting me directly. We need to connect the dots, how pollution and all other social injustices that they're facing, they're all interlinked. After listening to that, we planned, then we took action and negotiate. So next few slides, I will just go through quite quickly how we organize power. So Catherine, feel free to go a little bit faster probably. These are some of these institutions, they in our membership, who agreed to work with us, who saw that this injustice is one of these issues that their people facing in the mosque or church or their university. And then we began with citizen science training. We wanted to make sure it's inclusive. We are welcoming all these type of people in our community. It's not just for certain groups. So we did in the evening time, so parents could come, or people who work in the daytime, they could come in the evening. We did also different other timings. We educated, because one of our aim was to actually educate people about pollution, air pollution. So we let them use these tubes and put on their neighborhood, and then 6 weeks after they send this to laboratory, and they got the results. So they were in every single processes, in the every single stages, and that was very effective for us to actually keep the group still working on air pollution. It's been 2 years that's still fighting for this justice. Yeah, these are groups finding out the result, Wood Street, and some of them were very shocked. Yeah, continue, please. Yeah, carry on, keep moving probably. Like these are just some of these pictures. I thought it'd be nice recognizing those leaders. Yeah, so we, after doing the research, we came to know, yes, this is one of the area probably I want to talk more. So we found many issues, and we brought the issues into tangible, many problems. So these were big problems, and we broke them down into tangible issues, and those were more easier for us to do, winnable and worthwhile campaigning for. So one of them was just like school street, low emission zone, ice cream van, in a park, and especially also timing and mapping of what other people are doing. So there's a lot of work going in there around our borough. But there's a very little connection of how each of these organizations coming together and what we can do together. So this we identified issue, and once we decided the issue, we came to know one of the things that we can definitely win. We have enough power to go to our local mayor and ask him to change, and also we saw that he has power to say yes and no. Right, so we went to do the campaign on ice cream van, and that came from a lot of listening, a lot of stories we heard from parents who said that in the weekend, whenever we go to the Victoria Park, especially or summertime, to have fun with our family, or there's a festival going, or just to have like clean years, or because Tower Hamlet is a very busy area, very congested as well at the same time. But there is always ice cream van there who is keeping their engine on, and that was an issue for a lot of parents. They didn't want to ban ice cream because they love it, but they were just saying which way we can make it better so we can have ice cream at the same time clean air. So this is when we one of our leader came who was doing research about Germany. They were talking about converting there are some of the ice cream van in some areas and that. So we're just looking into that, and we found really great that. And when we said even some ice cream van were okay with that, so we want to negotiate with the local mayor. Can you help ice cream van converting from the current way of doing it to like electronic ban? And also, could you please put more electric charging point so that doesn't affect their business? The council thought about it. It's a great thing, and of course it's also in self-interest of the council to make their area better, because more and more young people having asthma. GPs are full of like appointments with children with asthma, pregnant women who never smoke, but doctor is saying you need to stop smoking because of the area they live. It almost seems like they are smoking, so they said yes. So the council agreed to work with us. So we want that by 2022. We hope to see all the ice cream van, especially those who are around Victoria Park, are changing from the current way of doing their business to actually becoming more electric. Alongside with that, we also wanted to bear in mind, like, Tower Hamlet has a large number of BME communities. So sometimes you can't scream and shout about climate change. You need to, we need to work on that. They need to fully understand how they are contributing to air pollution, how their action, which probably they don't know, unknowingly they're doing it, and how can they change their habit. So we wanted our institution take ownership of that. So we said to each institution to go and on Sunday, yes, you talk about what's on Bible, but also talk about what Bible says about air pollution, about your neighborhood. Mosque was doing sermon on this sort of crisis, climate crisis, and in that way we tried to change the behavior of local people, and how can they contribute to have better air quality in their neighborhood. The student went to talk to the parents, and they created a nice video, which I'm going to present in a bit, where they actually said that there's many ways you can help creating a greener community, only if you just become creative, which I'm going to play now, if that's okay. Yeah.
This is our Tower Hamlet story. It might also be yours too.
Here is the highway.
It's a very busy and important road that takes very busy and important people into London.
Over the years, this road has become busier and busier. Do you know who else is busy and important? So what's the problem?
1 in 10 Londoners under 18 years of age has asthma.
Road transport causes almost half of London's air pollution. Children are most vulnerable to air pollution, but we are all affected. London's air is some of the dirtiest in Europe.
The vehicles that use it produce harmful fumes.
There are lots of nasty things in these fumes,
Such as carbon monoxide and particulate matter.
These are big words for horrible, nasty things floating around in our atmosphere. Our amazing school is right next to the highway. The nasty fumes travel from the highway all the way to our school.
To our playground.
This can make us feel unwell. If we are unwell, it is difficult to learn new things.
So what can we do about this?
I know, we can plant trees around our school to add lots of fresh air and block the fumes and noise pollution. I have another idea. We can ask people to avoid using cars if they can. How would the people get to work?
They could walk, they could ride a scooter, they could take the bus or train, or they could use a hoverboard.
There are lots of ways to prevent pollution if we just get creative and think about it, so please.
Help protect our school from pollution.
Spread the message.
Not pollution.
We can make a difference.
Thank you. Yeah, so we engaged in almost all our institutions to do more. We asked our local communities what they can do because it's sometimes we think it is just the government, it is just the people of power, people in power can do, but we have lots of power. The best, the easiest way to feel powerless is just by thinking you don't have any power. So when we asked our institutions, our leaders within the institutions, can you do the following? And they realized that they have lot to offer in contributing to make it better, quality, in our neighborhood, and also just to emphasize on because we organize and our community know the importance of that. As a result, the team is still working, and they recently just asked for a big funding from Grow Back Greener. So hopefully we'll continue with this work. And also our council is updating us on next time when they get funding, they will work with us more. So these are just some of these success that we had in last 2 years working in air pollution. So yeah, any reflection on that?
Afsana, thank you so much for that excellent presentation. I think it's so powerful to see those examples, and I think that might be my favourite ever video on air pollution. I quite like a hoverboard to get me to work in the morning. Thank you for sharing. What I'm going to suggest we do is we've also got Andrew Grieve with us, who's going to talk about the Nocado campaign, and then I think we'll come back for questions because I'm sure there are many to talk about those rich experiences from Tower Hamlets. And I just wanted to flag for anyone who's online the project that Afsana was mentioning. So Global Action Plan are also doing a Clean Air for Communities project over the next 3 years in Lewisham, Enfield and Barnet. So if you're based in any of those boroughs and would like to get involved, do let us know. Okay, without further ado, I'm going to hand over to...
Have you guys?
Yes, hi Andrew. So just to explain, so Andrew Grieve is based in Islington, and we're going to be joining him and some fellow campaigners outside their school to talk about the Nocado campaign. which is working to stop Nocado building a 24-hour distribution centre next to a nursery and primary school. This is our first attempt at Clean Air Day Live to do a live screening outside, and my goodness, you are facing the elements. I'm glad to see you're well prepared with your raincoats. So Andrew, thank you so much for joining us. Maybe you could just take a few minutes to explain who you are and how the Nocado campaign came to being. And I think you might be on mute. Hold on one moment.
Unmute.
There we go. If you can start again, thank you. And you muted yourself again. Hang on.
Unmute. You got us now?
Got you now. Got us? Yeah, go for it.
Great. Okay. All right. Well, we're just a group of parents who all have children at this school that you can see just behind me, this primary school. But just behind this fence here, I don't know if you can see that fence, that's where Nocado were trying to set up their 24/7 distribution depot. So the first we learned about it was a letter that dropped into the school in December saying that Nocado were going to set up shop, and they wanted to set up three diesel petrol pumps to refuel 100 diesel vans that they were going to be using to distribute their food from. That was the first we heard about it, and that was a massive surprise, obviously. So then what happened after that was we started investigating how they had managed to get onto this site without anyone knowing. And what they had done basically was they'd used a back door, a loophole in the planning process called a lawful development certificate, which meant that they didn't have to put a planning application into the council. So nobody knew. The first we knew was when they wanted to put these diesel petrol pumps in. So that's the first we knew about it. And we've spent then January and the rest of the time campaigning. Maybe need your umbrella, campaigning to get it stopped. And it's such an important issue that we will be out here, rain or shine, to get it stopped.
That's brilliant. Thanks very much for that introduction, Andrew. I know you have some campaign videos as well that you wanted us to show. Maybe if we can go to those, and then maybe it would be great to hear from fellow parents as well from the school. So we'll head over to those videos if it's possible to bring them up. So Andrew and fellow parents at school, thank you for sharing those videos. I wonder, Andrew, maybe if you could introduce your fellow parents, and if they would like to say a few words about the campaign and what they've been up to and next steps.
We've got Sabrina here, we've got Natasha here, we've got Zoe behind the iPad holding an umbrella so that everything doesn't get ruined by the rain. Do you guys want to say a couple of things?
Yeah, it's been quite a year, really. Not only have we had to deal with, the normal things with coronavirus that everyone else has, but, that has made this campaign so much more difficult because, all the things that we had planned, we were planning a big protest where we were going to walk down from the Marks and Spencers up in Archway down to the site of the proposed depot, and obviously that couldn't happen. So you're trying to find ways that we can protest and make our voices heard, make ourselves newsworthy, because otherwise it's so easy to ignore campaigns like this. It has been really made so much more difficult by the current global pandemic, which obviously isn't a normal thing for people to have to deal with, but we have definitely felt that sorry, I'm losing the plot a bit. Sorry.
It's been hard going, but we've been trying.
We have, and I think it's amazing how the children, despite the pandemic, were, they're still very engaged in what's going on. Mostly because they can see it every day, they can hear it every day, and so also for those that were at school for a brief time during summer, it was a constant thought. And so, despite the fact that we cannot, go and march in the street, we're here under the rain today, and we can do whatever we can do to let everyone know what's going on, and we don't want to be ignored.
Yeah, we've done online protests. The children have written letters to Tim Steiner, the CEO of Nocado. They've drew protest vans, as you saw there. We've had socially distanced protests. We've leafleted several times around the community. If you walk around here, actually, you see lots and lots of houses that have got Nocado leaflets in the window. The strength of feeling in the community is really strong. And yeah, it's kind of amazing that there's still this strength of feeling after months and months and months from January all the way through to now. But now is a crucial time. It's an absolutely crucial moment because the council is due to make its decision on whether they're going to take away Nocado's current licence that they got through this backdoor route and make them apply for a proper planning application. I mean, what we obviously want is that planning application to then be refused, because at the moment they can do whatever they want because they've got their certificate. So we're at a crucial moment now, and Islington sadly have been dragging their heels, and every day that they don't make a decision, Nocado continue to build this depot behind us, and the children can see it before their very eyes unfolding before them. So we want Islington to hurry up, make that decision, get the certificate revoked, make them do a planning application, so that the community can have a say in what happens to this. I mean, obviously, we're going to be protesting to say this should not happen. Given what we know about the impact of air pollution on children's health and noise on children's health and education, there's no way that this should be allowed. This is an absolute nightmare. You would not get planning permission to build a school in an industrial estate. You wouldn't. And what's happening here is an industrial estate is being built next to a school. It's outrageous. So we're going to try everything we possibly can. And if Islington Council can't stop this, then we call on the mayor to use his powers to step in and pull this development in to review it. He has the power to do it. He's made protecting children from air pollution one of the central planks of his mayoralty. Here's an opportunity for him to save 470 children and generations of children at this school into the future from a future of pollution and noise, hundreds of vehicles, motorbikes, HGVs, cars, you name it, next to this school for generations to come. Please, Mr. Mayor, if Islington can't, you must step in, save these children, save this school from a future of diesel and noise right next to the playgrounds.
Andrew, thank you to you and others from the school from sharing your experience. I guess we've got people online who are community campaigners, but maybe some who are, just, members of the public who are interested in finding out more and maybe want to be involved in community campaigning. And I just wondered, you've obviously kind of built this quite big movement, but what advice would you give to community campaigners as they start out in terms of how to mobilise and get people involved and to run an effective campaign? Are there any tips that you would share in terms of your work?
It's hard, actually. It's hard. Organizing and keeping going and having ideas and keeping doing it is really hard when you've got everything else that you're trying to do on top of things. In the beginning, it was kind of a bit easier because we were able to have meetings. We used our local community hall. We had hundreds of people there, and we could sort of sit down and organize. It became harder when the pandemic came along, but we've kept going with weekly meetings online. And I think the important thing is keep having ideas and keep going and keep, that's that's all you can do. Keep having ideas and keep going, and keep the momentum and keep being organized. Yeah, that's my only advice. Natasha, you want to add?
I was going to say, I think communication is really important because people don't necessarily know what's going on, and when you're actually in the middle of everything, you're up on everything that's going on, and it's important to make sure that you communicate everything that's happening to everyone else, because it's very easy to assume that everyone else has the same level of knowledge about what's going on as you do. So I think that's one thing that we've learned, is that it's constant communication, really.
Super, thanks very much. And I'm going to move to kind of broader questions too. So Afsana, I think you're still online, I hope, because I was keen to get your response to the same question, Afsana, in terms of the kind of community mobilising in Tower Hamlets. Are there any kind of top tips that you would give to grassroots campaigners or just members of the public who are thinking of maybe starting a group and getting involved in clean air campaigning?
Right, thank you very much. A very good question. One thing we always say that you can't change until you can imagine something. So we need to think about the world it should be. How do we want to see our world look like? Do we want to see a big, massive $1 billion company coming next to our school and affecting our children's future? Or do we want to see how do we work together while creating jobs for our parents at the same time our health is not being risked? So it's about seeing how the world should look like and where we are right now and how do we go there. One thing we also say, the one closest to the pain are closest to the change. So we need to bring those people who are directly affected in the front row, not just for their testimony, but they need to be developed so they can speak by themselves, not on behalf of somebody. And also they need to have the platform, and especially those people who are affected. A lot of people are coming from diverse backgrounds, and I keep emphasizing on that. They need to completely understand the climate crisis and how they are the victim of that. So there is more work needs to be done on this.
Afsana, and I just wondered, Andrew kind of reflected on the fact that there have been challenges on campaigning during lockdown, so not being able to physically meet, for example. Have you experienced that too, or do you have any other suggestions on things that have worked effectively when trying to remotely campaign during this time?
I think it's one of the challenge a lot of us are facing right now. How do we carry on living life even in the pandemic? Definitely, we have had similar challenges, especially a lot of people who they don't have a phone that would allow them to use Wi-Fi. They, like parents, they had to choose: would they pay £30 to get Wi-Fi, or they're gonna spend that money buying food for their children, especially first few weeks when the children could not go to school. They didn't have free school meal, so children were hungry. So parents had to make all the decisions. With our organization, we have had these challenges, and we tried to overcome some of the challenges by actually providing sometime Wi-Fi and phone, digital inclusion, digital devices to our member institutions, those who are having a lot of challenges. Yes, it's going back to the relationship, is going back to the self-interest. The people who fought for hate crime, they're still fighting for it, although it's pandemic, because it is their self-interest. They know it is still affecting them. So this is where we always take pride of organizing, that organizing doesn't happen just because there is like a crisis. Newspaper is telling us, or statistics is showing. It is at the end of the day built on things that people are affected, and they will find a way at the end of the day, whatever way, to change that because they have been affected by that.
Thank you, Afsana. I think it's such an important point, thinking about how we can be inclusive when we move more to kind of online and digital world. And I know, I mean, other people have said, you know, there can be some benefits on online meetings if you have children, for example, and don't have childcare support, that maybe online can be sort of add some benefits to them. But I think it's really important, as you say, to consider that access. Before I head back to the Nocado team, because there's a couple of questions for them, Afsana, there was a particular question from somebody saying, where can I get your diffusion tubes from? So I think there was somebody interested in knowing how they can be monitoring at their school.
Great. I think you're in the definitely right call. So we worked very closely with GAP. I think formerly there was a group called London Sustainability Exchange, which is part of now GAP. So we worked with Ben and Alice. They taught us on citizen science, and they gave us the tubes, about 60 tubes, and we put in 60 different places within our neighborhood. So yeah, please, I'm sure Ben, if you can get in touch with Ben, or he's probably on this call, he will be able to give you those tubes.
Yes, yeah, do feel free to get in contact with Global Action Plan on that. Now I'm going to hand back to Nocado, if you're still there, still braving the elements, I think. So back to Andrew and team. So we've got a couple of questions for you. So there's one question on, do you have any indication of which way the council's decision will go? And also people wanting to know how they can get hold of your videos. So two first questions for you there.
Okay, well, the easy one is where can they get our videos, which is either on our Twitter feed, which is @campaign Nocado, or our website, which is nocado.org. The trickier one is what the council is going to do. So we've had a couple of letters from the council to Nocado saying, yeah, we don't really think that you should be on the site because we've looked at the history of the site, and the original planning consent that was given to this site in 1984 specifically ruled out warehousing. It said no warehousing. And that's why Nocado tried to use this back door to get onto the site, because they saw that in the 1984 consent. So there's been a couple of bits of correspondence back and forth. They seem to be saying that they're going to take away their current license, but we don't know for sure. And that's what we're waiting for now. We're waiting for that decision. Is it still there? Is it gone? Are we still on?
We're still here. I'm hoping.
Yeah. Okay. Yeah. We're waiting every day for that decision. But as I said, every day that goes past at the council don't make that decision, Nocado can build, and the children are watching this depot unfold before their eyes, which is causing an enormous stress in the school and also at the school gate. You know, every day we turn up to do pick up or drop off, we can see Nocado measuring the curtains, pulling pallets in there. It's crucial. It's crucial that the council makes this decision as soon as they possibly can, so that everybody knows where they are.
Okay. Thanks for that. So I'm conscious we're nearly at time. If there are any final questions from people online, feel free to put them in the chat box. But
Catherine,
yes, hello.
Catherine, I've got the headmistress here. I've got the head teacher here of the school.
Hello.
Hello
Would
there.
you like to introduce yourself? Hello.
Hi, my name is Cassie Moss and I'm the head teacher at Yeobury Primary School and have been there for 7 years. And yes, I'm obviously supporting this campaign avidly. I think it's fantastic what you guys are doing here, and obviously what the parents here are doing. Especially in line with sort of what's happening in the world right now. Also the government guidance that is coming out in regards to outdoor learning being particularly important now, and children being in the fresh air for mental health, but also in regards to health. I think it's amazing that you're still doing this kind of an activity to highlight the need for clean air. And yes, I'm just glad there's still a focus on it and it's being highlighted. So well done, everybody, and well done you for organising this.
Super. Thank you very much for joining us. So I think I'm conscious of time, so I think we're going to wrap up today's session. But I wanted to say a massive thank you to all of our speakers, so to Clover and to Afsana and to the Nocado Campaign for really talking us through some of those issues on how we can campaign effectively, whether it's kind of looking at how we're framing the question, making sure that we're targeted, looking at how we can campaign positively, really looking at how we can be inclusive in our campaigning. I think we've seen a really kind of rich range of examples from all of our presenters here today. I think we posted in the messenger bar a selection of different links to some of Global Action Plan's kind of campaign resources. So just to say that there are a number of resources on Clean Air Day Live if you're interested, from videos that you can share with colleagues or within schools or with friends. We've also got a Clean Air Hub, which is the kind of public go-to space for information on air pollution. So within that, we have a clean air calculator, so you can look at your own footprint when it comes to air pollution, but also provides a kind of official advice on the sources of air pollution and the impact to your health. So without further ado, I will end this session, and a big thank you again for listening in. We're going to take a short break now and then hand over to my colleague Ben to run the Unequal Air session. Thank you for your time. Bye-bye. Bye, guys.
Bye. Thanks. Cool.
Thanks.
Thanks.
This is our Tower Hamlet story. It might also be yours too. Here is the highway. It's a very busy and important road that takes very busy and important people into London. Over the years, this road has become busier and busier.
Do you know who else is busy and important?
So what's the problem? 1 in 10 Londoners under 18 years of age has asthma.
Road transport causes almost half of London's air pollution.
Children are most vulnerable to air pollution, but we are all affected. London's air is some of the dirtiest in Europe. The vehicles that use it produce harmful fumes. There are lots of nasty things in these fumes, such as carbon monoxide and particulate matter. These are big words for horrible, nasty things floating around in our atmosphere.
Our amazing school is right next to the highway.
The nasty fumes travel from the highway all the way to our school, to our playground.
This can make us feel unwell. If we are unwell, it is difficult to learn new things.
So what can we do about this? I know, we can plant trees around our school to add lots of fresh air and block the fumes and noise pollution. I have another idea. We can ask people to avoid using cars if they can. How would the people get to work? They could walk, they could ride a scooter, they could take the bus or train, or they could use a hoverboard. There are lots of ways to prevent pollution if we just get creative and think about it, so please.
Help protect our school from pollution.
Spread the message.
Not pollution.
We can make a difference.
Hello, hi. I'm Ben Hudson, and I'll be your host and moderator for the next 2 hours for this session as we explore inequality and air pollution. Air pollution, as we all know, is the largest environmental threat to health in the UK, responsible for 36,000 deaths per year. However, the burden of exposure does not fall equally, and that's what this session will explore. Simply put, inequalities are greater in areas with the poorest air quality. In this first session, we're going to look at positive action, and in the second session, +1, some speakers will share their lived experience of inequality and air pollution, and hopefully there'll be some positive action there too. This is a Q&A session, so I'd like to remind those watching at home, you can interact with the speakers and ask questions through Slido. If you are watching on the Clean Air Day site, specifically on the Clean Air Day Live tab, you will see this next to the stream. Alternatively, you can join sly.do and enter the code 72733. So to our first session, I'm very pleased to be joined by 4 excellent speakers and Penny Hosey, writer, editor, and Clean Air advocate and organizer of this session, and she will tell us more. Penny?
Oh, thank you, Ben, for your kind introduction. And thank you to Emma Hibbert and David for generously sharing the session. It seems really timely to be discussing environmental justice in relation to air quality at the moment, with everything that's going on in the world right now. This is a deep injustice and inequality, and affects millions of people all around the globe, very vulnerable minority and minority communities across all areas of life, from the cradle to the grave. We wanted to put this section together on Unequal Air to give these vulnerable communities a vital and visible voice. I'm delighted that all the speakers in this session and in session 2 are immensely well qualified in all their respective fields, and they're going to present in session 1 positive, workable solutions and actions to mitigate against this continued injustice. So I'm really happy that Kate Langford and Rosamond Kizzy-Deborah are on board to discuss the health aspect of air pollution and in the communities and projects they work in. I'm also pleased that Professor John Fairbairn will look at policy interventions, and Araceli Camargo has a very important talk on how the built environment and the inequality within these environments affects health and people. So I suppose the real take-home message I hope you'll get from this session is that I hope you'll be inspired and include these deprived communities in your conversations and activities moving forward. Thank you. Thanks for giving us this platform.
Thank you, Penny. So our first speaker is Kate Langford, Programme Director for Guy's and St Thomas Charity and the new 10-year programme on the health effects of air pollution. Guy's and St Thomas Charity, I'm sure Kate will tell you, is an independent health foundation focused on addressing health inequalities in the London Borough of Lambeth and Southwark. So I will hand over to Kate.
Great, thank you for having me. As Penny said, I think this is so timely, and I'm really excited to be such a part of such a great panel. So Rosamond and Professor John Fairbairn and Araceli's work has definitely all inspired the work that we're doing here in Lambeth and Southwark. So as Ben said, I'm Programme Director at Guy's and St Thomas's Charity. And really in this 10 minutes, I want to tell you a bit about why as a health foundation we're focusing and putting investment behind tackling air pollution, and particularly its impact on and intersection with other health inequalities, and practically what we're hoping to do about it over the next 10 years. As Ben said, this is year 1 of a 10-year programme, so we're also really, really interested and keen to hear people's ideas of what we should be doing and what types of organisations and programmes we can be funding and supporting here in Lambeth and Southwark. So, great. Just going to try and get this slides to move on. Ben, I might need your help. Oh, no, it's happened. As I've said, Guys at St Thomas's charity is an urban health foundation. So we work to tackle the major health challenges affecting people in inner city areas. And we focus on 4 main issues. So we've been running programs looking at childhood obesity in inner city areas and multiple long-term conditions for 3 years now. And this is our 3rd program, our program on the health effects of air pollution. And later this year, we're going to launch a program on adolescent mental health. I think the really important thing to highlight here is these are all really sticky, complex health issues. There isn't a single silver bullet for any of them, but they're also, air pollution contributes to all of the other issues. So we think it's a major driver of some of the poor health outcomes and health inequalities that we see in our boroughs. And also how much in the patterns of ill health that we see, how much where you live determines the health outcomes you have. And I think Ara Shelley will tell us a lot more about that in a second. So we're going to focus most of these sessions on kind of positive ideas for actions, but I just wanted to kind of start with the why. So why are we focused on air pollution and health inequalities? This isn't new. So Professor John Fairbairn's work has showed this relationship between socioeconomic inequalities and exposure to air pollution for 2 decades now. So there is nothing new about this. But I just wanted to share how it plays out in boroughs like Lambeth and Southwark. So this is some work we've been looking at locally. So on the left-hand side of the screen, you'll see a map of Lambeth and Southwark. And what we've done here is we've looked at areas where we've got high levels of exposure to air pollution, so particulate matter and NOx, but also a high proportion of people who might be more susceptible to the health effects of air pollution. So areas of our boroughs where we've got a higher proportion of children, people living with heart and lung conditions, and older people. And for me, this map is starkly similar to the maps that you'll see in the middle and on the side. So in the middle, we've got a map of the prevalence of childhood obesity at year 6 from across our boroughs. And on the right, you'll see that there's a map of median household income. So we think that the communities who are most impacted by this issue are those who are also impacted by other health issues, and that a key driver of a lot of this is income. And in addition to that, I just want to say some of the kind of things we've observed over the last few months as we've been starting up our programme. So fundamentally, we think that there's a triple inequality. So that those most impacted by air pollution are the least likely to contribute it. So they're less likely to own a car or wood burner. So those areas that you saw in our map that were highlighted, those are areas with some of the lowest levels of car ownership in the whole entire country. So we think people's health is being impacted on something that they are not individually contributing to. The second is that those most impacted by air pollution are more likely to be negatively impacted by other determinants of health. So whether that's unemployment, low income, or systemic racism. So we think there's a layering effect, and Araceli's work speaks really strongly to that kind of layering of both socioeconomic, psychosocial, and environmental stresses on people's health. And the third, which I think is really important for today's conversation, is our evidence suggests that those most impacted by air pollution are less likely to be involved in decisions to improve air pollution. So we see this in consultation exercises, we see it in who has the kind of time and space to campaign on this issue. And so I think how we can involve those people is a key part of this problem. So on to, I guess, what we can practically do about this. I think both John and Rosamond are going to talk to what we can do about this nationally. So I just want to share some ideas about what we're thinking about doing locally. So there's lots that needs to be driven nationally. So the Environment Bill is a key upcoming opportunity for us all to influence air pollution for decades to come. But I want to share a few things we're thinking about doing locally. So the first one is, as I said, we see that people from the communities that are most impacted by air pollution are at the moment less likely to be involved in decisions and consultations related to air pollution. So for us, it's really important that we amplify these voices, that we really listen to people, and that we do deep community research to understand how air pollution, active travel intersects with the other challenges people are facing. So I'm really excited that we're working with an organisation called the Social Innovation Partnership, and a set of community researchers who are recruited from the communities most impacted by air pollution to both understand how people feel about living in these areas, but also to come up with practical solutions. And the other example, which we have had nothing to do with, but I just love to share, is please watch this YouTube video from the Advocacy Academy, which is 4 young women from South London talking about the impact that air pollution has had on them. And it's the most powerful articulation of inequalities and air pollution that I think I've heard to date. So it's brilliant. I really highly recommend it. But I think it's really key that we invest properly in amplifying the voices of those people who are impacted by this issue and involve them in decision making and make them key to driving those decisions. The second is really understanding where people are spending their time and trying to reduce air pollution in those places first. So obviously we want to reduce air pollution across the city, but can we understand where people are spending their time? So where are children in these neighborhoods spending their time, and use that to really drive what types of interventions that we do. So for us, we're going to be focusing on the neighborhoods that we think are most impacted, which are shown on the map above, but we're also trying to do kind of deep research to understand where people spend their time, whether it's in nurseries, playgrounds, high streets, and prioritize those areas for intervention first. And the third area is, I think there's lots and lots of debate at the moment about active travel and how people get around, but residents and how residents get around London is only part of the problem. So there's so much air pollution in our city that is driven by businesses and large employers. So in our boroughs, we've seen that construction industry contributes to 25% of particulate matter. So I think in terms of social justice, it's really important that we ask businesses to play their part. And we're going to hear more later today from GAP's work on working with businesses as part of their Clean Air Task Force. But there's also great local examples that we can look to. So Guy's and St Thomas's Hospital, our NHS partners, have already consolidated a lot of their freight, which has reduced truck deliveries by 90% coming into central London and coming along some of those major roads where we know that there are communities living who are being really negatively impacted by air pollution. So I think there's lots of great examples. What we need to do is to be looking at what can incentivize businesses to take up those examples and to make that more systematic. So those are some of the ways that we're thinking about this locally. As I said at the start, we're really keen to hear people's ideas on how we can improve air quality, and particularly how we can do that and reduce health inequalities. So please look at our website, please send us your ideas, and looking forward to hearing from the rest of the speakers today.
Thank you, Kate. So I didn't remind you, but of course you don't need to be reminded, but I can say this to remind our other speakers. You'll have 10 minutes each to talk, and we will jump in when your time is running low. Our next speaker is Araceli, who is a cognitive neuroscientist and co-founder of the Centric Lab, which is a neuroscience lab focusing on understanding how the built environment presents risks for certain health issues and individuals. I'm fascinated to hear more, so over to you, Araceli.
Great, thank you very much. And thank you, Kate, for all the awesome shout outs. Oh, cool, it's already on the screen. So I'm Araceli Camargo. I am one of the scientific leads for the Centric Lab, and all of us in our lab are neuroscientists. there is a colleague of ours that is also on the urban side, which he helps us translate the science work into the built environment, which is mainly where we execute our work at the moment. But we are now starting to veer into working in public health, because through the research we have uncovered very much that the work that we set out that was going to live within the built environment really is a public health issue, and it's very relevant to public health. So we are taking a little bit of a left turn to include public health organizations. Sorry to be an absolute dunce. How do I get to the next slide? Oh, thank you. So this is, I think, an important acknowledgement that the work that we're doing in clean air has to come with an anti-racist or an anti-racism framework. Equally, it has to be an anti-classist framework. Many of the initiatives that we hear that are meta or macro tend to forget the people that are most affected by this. So in the United States, it's BIPOC or Black, Indigenous people of color that are more disproportionately affected. And this isn't just in the urban areas, this is also in rural areas as well. And in the UK, of course, it's BAME communities. And what does it mean to be anti-racist? It means that it doesn't matter how you feel on an individual level about racism. If your outputs are racist, then your actions are racist. And that's what we have to reframe when working in public health and working in the built environment, that the decisions that we are making, who we choose to ignore, whose voices we silence, is very much important, is as an important part of the work than the technical sides of it. And also the technical sides of it, even how we're looking at data plays a role in anti-racism. So if you are, for example, looking at the data and the data may not reflect what is happening on the ground or the experiences of people on the ground, which is what is happening in South Hall, and I will let those guys tackle that question. But when those voices are ignored and the data may not be supporting yet because its data doesn't equal lived experience, that's also racist work or classist perspective. So we have to be really careful with that. And we also have to acknowledge where the sources of air pollution come from. Again, we have to think about it systemically. So it's industrial, it's construction, it's soil vapors. Our soil is heavily contaminated by runoffs of various industries. So if you're walking through you could be walking through a very lovely green space, but if the water that they're using and the fertilizers that they're using are contaminated or are toxic, you're also breathing that air in. Of course, automotive vehicles also play a role, but as well as materiality. One of the things that we have to also think about is indoor air quality, because in areas where there is high levels of air pollution, there's also higher levels of deprivation and poverty, which usually means that the home that a person is in isn't adequate to live in. So it could be that it has poor ventilation, so whatever is happening outdoors is coming indoors. And once it comes into that indoor environment, it can change the chemical composition of some of the pollutants and become more toxic in the indoor air. But also you're talking about a smaller cubic space, which means that you are trapping those particulates and you're breathing them in. The second thing to consider is how those toxins or particles that are coming in from the outside are also combining and interacting with the pollutants inside the home. A lot of these homes are built cheaply, which means using cheap, unnatural materiality, which also has a constant release of toxins. And so what does that cocktail also look like is really important to note. And then the final thing is the materiality as well of the built environment. In areas that have higher levels of air pollution also have lower green space, which means that they have higher levels of concrete and asphalt. Asphalt is incredibly toxic, even without the car on top of it. It still releases air pollution, especially when it collides with heat, because the heat acts as a form of catalyst to release more toxins. So in the summertime, in the areas in the neighborhoods where there is urban heat index, or the urban, the urban island effect, I should say. The urban island effect is the areas, well, first of all, it's a phenomena that cities are hotter than the countryside, but it's also micro environments within the city that might be hotter than others. In our data research, we have uncovered that the heath, for example, can be up to 15 degrees cooler than areas in Peckham where it's more urbanized. So the people living in those environments are, again, that heat is also colliding with air pollution. So air pollution is something that we have to look at from various lenses, which brings me to my next thing, which is ecological viewpoint. An ecological view on health is anti-racist view, or is anti-racist work, because you're not just looking at the individual, you're looking at the entire system. Both, you're not looking at yourself also as an individual, as a contributor, or somebody working in public health to think, how are my actions affecting the rest of the ecosystem? Am I supporting racial capitalism and white supremacy, or am I trying to dismantle it? I really do think it's that binary. You're either one or the other. And so, but the same thing happens on the individual receiving it, that we don't just blame the person. We have seen it with COVID, that BAME communities, and I say they got blamed because they were told that it was either the vitamin D intake, nope, or they were told that there was something different about their genetics. Nope, we are all genetically the same. And if there could be something where they have more prevalence in their communities of diabetes, it's because of the environments that they're living in, specifically air pollution. Air pollution, because it gets into our bloodstream, can change so many different things in our biological systems. We specifically look at the stress response, or the HPA axis. And what we also find is that insulin, for example, changes, as in the insulin response changes when especially a child or a person is exposed to air pollution from a very young age. So that means that person's ability to metabolize sugars is already changing. So if we then just focus on, oh, let's just have a sugar tax, or let's simply get them to eat more vegetables and do that campaign without looking at the environmental ecological system around them, we are doing them a disservice. And not only that, but if we blame them that because they haven't done their 5 a day or their active walking or whatever it is, it's actually, what we think in Centric is that it's immoral. It's immoral to blame the person when they are living in a systemically oppressive environment that doesn't do anything to support their health. So what we want to say from that perspective is that air pollution does equal to poor health outcomes through a systemic manner. And if we want actually to improve health outcomes, especially now that I think and I hope that we've learned our lesson with COVID, that without health, we do not have anything. We do not have culture, we don't have society, we don't have economy, we don't have innovation. So health has to be the ROI. The ROI can no longer be, I'm sorry, but it cannot be money anymore. The ROI has to be health, for health's sake, because without it, we do not have anything. We don't have any sense of society. But it does mean that we have to look at this in an ecological view. So if I go to my last slide, we then talk about susceptibility and biological inequality. So it's not only that poor air quality is inequitably distributed across a city like London, i.e. not everybody suffers the same peaks and troughs of air pollution. Poor people of color are disproportionately affected by air pollution. And something that Kate said about the lived experience is super important, because you can have a neighbor side by side living with both experiencing the same levels of air pollution. But if one neighbor has to also do shift work, which means that their metabolical response again is being challenged because of the shift work that their sleep-wake cycle is interrupted, which again we know is a contributor to obesity and to diabetes and depression and anxiety, and then that person is going to be more vulnerable, more susceptible to the effects of air pollution at a lower level. Okay, so let me break that down. That means that when, and by the way, that is called a psychosocial stressor. The experience of poverty or the experience of an unequal environment. That vulnerability of the psychosocial stressor, of the lived experience, of the different lived experience, is the mediator in the long-term effects of air pollution. So children and adolescents, for example, that have lived through trauma, that have lived through the trauma of poverty because of the different experiences, whether it's violence directly or structural violence, which means not having enough food in the home, having parents that are unfortunately not able to be there with them because they're trying to sustain them economically. Those children are affected by air pollution at much lower levels. So in essence, the body becomes more vulnerable to air pollution when it also is combined with the experience of poverty.
Araceli, I'm so sorry. I'm going to have to stop you there.
Oh, no worries, no worries.
Thank you.
Can I just say one last thing is that we just have to move away from data and start looking at action, because I think we do all understand that air pollution affects us. And then that is our urban health index, where we are asking people to log in, see where you live, because knowing where you live and how it affects your health is a human right issue.
Thank you, Araceli. There's so much to unpack from just those 10 minutes of you talking. Hopefully there'll be a chance to answer some questions at the end of this session. We have two more speakers coming up. John, he is John Fairburn, Professor of Sustainable Development at Staffordshire University. He has worked on environmental health inequalities and environmental justice for over 20 years, including research for the Environment Agency and the World Health Organization. And he joins us now. Hello, John. You have your 10 minutes now. Thanks. And we'll be able to progress your presentation for you.
Thanks very much. And hello, everyone. You can see my details there. I'm on Twitter and very active on there. And there's a lot of stuff going on with Clean Air Day today. If you could advance the slide, please. I wanted to start with this, which is the Ostrava Declaration. The Ostrava Declaration was signed by ministers and covers virtually all European countries and some other countries as well. I picked out just two important points for it here. The first is the issue of equity, which has just been talked about, and why equity is important. And the second is issues specifically about indoor and outdoor air quality for all. And those are key measures that are decided and agreed on at the ministerial level. So if people ask you, why are you doing this? Why are you complaining to me as a politician? You can say, well, you've signed up to this. Our government has signed up to this. Next slide, please. And since that time, we've a large group of experts and stakeholders has been working together.
Are you still there? We seem to have lost your sound. Can you speak, John? Okay, well, John is having some technical difficulties. John, I think if it's okay.
Can you hear me okay now?
Yes, that's better.
Right. If we move the slide on, so a group of us has been working, and one of the outputs we've put together is this environmental health inequalities resource package. This is aimed really at anyone who is working in this field at a local or a national level. And particularly it deals with health and health equity issues as well. So if we go to the next slide, please. What does this involve? It's very practical help that's in this document. It was pulled together by several of us over a couple of years, and it went out to consultation with a lot of different groups who are working in this area. So if you're an NGO or you're a voluntary group and you've got new people coming in and you want to give them something to get them started, then this would be a very good document. We've got things here like the key definitions and glossary, bringing out what is the difference between equality and equity, for example. How do we have different levels of vulnerability? If you move to the next slide, please. We've got a chapter that talks about distributional methods. How do you go about doing distributional studies? How do you go about doing equity sensitive analysis? Because that is often a very important first step that can be taken, and you can get into a procedure of doing this regularly to monitor the effectiveness. So this takes you through a step-by-step, and whether you're a researcher or a local authority person, or you're thinking about what to write to your local MPs or politicians about what you'd like them to do, you can have a look at this. Next slide, please. We've got a chapter which pulls together lots of different tools and guidance. This is to help people with the procedural aspects. So you've often got evidence, or you've gathered evidence that you think there's a problem. How do you go about using that evidence to lobby and to influence policymakers, health authorities, environmental organizations to take some action? Okay, so you can have a good look through there. Next slide, please. I'm just showing you really a few highlights. There's, the document isn't big. It's very concise deliberately. We've cut it down as much as possible. One of the key messages, we need to be putting out is issues around equity. You will often see graphs that show a massive improvement in air pollution over the last 20 years. If you look at the national data, and that's true, there has been a huge improvement in air quality for many people, but not all people. And what we find is that general policies are not effective for all people. We need targeted policies that are going to deal with this equity issue. And so we've got issues in there, messages in there about how you should go about, or how you can go about bringing those messages to politicians. Next slide, please. Hopefully, I can't see the Zoom, so I'm not seeing this at the moment, but hopefully what you're seeing at the moment is a Annex 1. And we've laid out here what different actors, different professions can do. And there's a wide range of different people in there. So urban planners, what they can do, academics, what they can do, NGOs, what they can do, citizens, what they can do, health authorities, what they can do, all laid out for you in an annex to give you some ideas. Next slide, please. I think a very important thing I'd like to stress is that the World Health Organization is currently going through a very big review of air quality standards. It's quite some time since the air quality standards have been set, and they're very important standards because they are based solely on health evidence. And governments and the EU, governments around the world, look at those very seriously when they're considering what air quality standards to set. Now, they don't always adopt them. They don't always adopt them because they may say, oh, we've got to consider other things such as the cost, or they may get lobbied against. But this is going on right now. We're not sure when those standards are going to be published. It could even be another year or two. It's almost certainly the case, because I've attended some of these meetings, that the standards will tighten, because there is so much health evidence around now about how air quality impacts on people's health, in all sorts of ways, it's very likely that they will tighten. And governments, as you saw earlier in the second slide, have signed up to improve air quality. So if you want to do something, lobby governments to adopt the WHO standards when they come to set theirs. That's really important. Next slide, please. Just a bit of, there's an event, Public Health England, I've got their annual air conference, annual air quality conference next week. In the morning, we're looking at indoor and outdoor air quality. In the afternoons, dealing with climate change. This year it's free because it's online, but you do need to sign up by tomorrow, end of tomorrow. The morning session is specifically looking at vulnerable groups and inequalities. And I'll be talking at that session about the systematic review that I did for the World Health Organization across Europe on air pollution. So if you want to come and see more of that, then sign up by tomorrow. Next slide, please. I'm fairly sure that Ben and Clean Air Day are going to put this presentation available for you, so you'll be able to download it and get the links. I've put together a blog there with the work that's gone on with the World Health Organization over the last couple of years. It's got links to all the resources that have been produced, very useful for anyone working in this field, both the scientific evidence, and there's also a link specifically to the toolkit I've just been talking about to you. So you can download that directly or make it available to everyone, but everything is on the blog if you want. Next slide, please. And so this is just contact information really, but particularly if you're on Twitter, if you have a look at my Twitter feed, I've created an air quality list. And there's all sorts of people on there. So everything from school groups working at the local level to politicians and international people at the World Health Organization. So you can have a look at that and follow them or subscribe to the list if you want. You'll find a lot of useful information there. If you're interested in any of my publications, because I've been working in this area for so long, you've got a link there. And feel free to connect with me on LinkedIn. I'm pretty active on LinkedIn as well, and we can follow up. So I just finally like to finish my talk by saying thank you very much in particular to Penny Hosey, who pulled together a lot of the speakers for this session, and for Ben Hudson for organizing this. Thank you very much.
Thank you, John. That's my alarm going off right on time, despite the technical hitch. Well done for powering through. Our next speaker, we have health campaigner and World Health Organization public advocate for public health and air quality, Rosamund Kissy-Deborah. She set up the Ella Roberta Family Foundation following the tragic death of her daughter, Ella, in 2013 from a rare and severe form of asthma that was exacerbated by London's toxic air. Rosamund. Just need to unmute yourself there.
Hi, can you hear me now?
Perfect.
Yeah, I said, can you give me a warning when I've done 9 minutes so you can show the video at the end? Yes. Air pollution is, for me, is the single greatest threat to the environment. I believe if we clean up the air, then we clean up the environment. And it's really interesting these days when people mention COVID and they talk about it in terms of a pandemic. I would say the same applies to air pollution also. At the moment, COVID has killed over 1 million people. And just bear this in mind, air pollution actually kills 7 million people each year. So that is the scale of the actual issue we are dealing with. More people die from air pollution than HIV, AIDS, tuberculosis, all those illnesses actually combined. And now when you look at the tobacco industry, there's 8 million people that die from it. But air pollution is fast growing with 7 million. And unless we do something, it is actually going to get worse. In the United Kingdom, the figures vary from 36,000 to 40,000 every single year. And to get that again in some context, we've all been watching since March, the figures go up every day of people who are dying from COVID. And I think now it stands over 42,000. So try and think every single year, 40,000 of those people will die from air pollution. And in London, we specifically have a major problem. 9,000 people die in London every year from air pollution. And it is related to asthma, heart attacks. I don't think there's been a study out recently in the last 3 years that I've seen that has not got any links to air pollution. Low birth weight, miscarriage, suicide, depression. I could go on and on and on. So that's how important it is that we clean up the air. And the reason why I am particularly interested in this, as Ben said, my daughter suffered greatly, and she is not the only one. There are 2.5 million children and young people in London, and at least 10% of them have asthma. So that would be about 250,000 children have asthma. Now, I must say, you know, when people talk about asthma, asthma is not a little disease. It varies from mild, moderate to life-threatening. And what is quite sad to also mention is, do you know that most people that die from air pollution, they actually have, from asthma, they actually have mild asthma. And that's because asthma isn't taken seriously. So when people have asthma, they just feel, you know, I can just, you know, squirt my pump and all is going to be okay. Or they leave it at home, they don't carry it with them. So these are the reasons. And it still saddens me to say that in London every year, still between 8 to 12 children die. And there is no one in the year 2020 who should die from asthma. Asthma is something that you could prevent children from dying, but every year still. And I'm afraid it is still going to continue because, as we know now, after lockdown, that the air pollution has gone back up. But the good news to actually say here is during lockdown, so it actually shows you that something can be done, because during lockdown, no child died from asthma, as far as I know, all over the UK. So obviously you can see the link with air pollution and asthma. So if the air is cleaned up, lives will actually be saved. Now, the situation seems to be getting worse. And I think before lockdown, on average, in the class of 30, between 3 and 4 children had asthma. And as I've just mentioned, this is growing. Now, one of the things I do want to mention, I need to take the opportunity here is, if you have asthma, every child that has asthma needs to have an asthma plan. Every single child with an asthma diagnosis. You also need to make sure all your medicine is updated, and you need to at least have a review once a year. That is very, very important. If you find that your asthma inhaler isn't working, then don't wait for the 1-year review. You need to go and see your GP. But no child should be walking around with asthma without an asthma plan. This is very, very, very important. Now, the other thing also that doctors know that children who live on main roads are more likely to have asthma because of the air pollution. So if you map out where children with asthma live, a lot of them live near main roads, or they may go to school on a main road. And as we all know, there are issues with main roads, with noise, there might be light air pollution. And recently, during lockdown, we also realized that there is an issue with ozone air pollution. So the hotter, as much as we love hot air, we love when it's sunny and it's hot, it also comes with its downsides, I'm afraid. Now, Dr. Grigg has found out that living alongside a busy road carries about the same risk as passively smoking 10 cigarettes a day. So try and imagine that if you live near or on a main road, it is similar to passive smoking 10 cigarettes. Now, this is very, very important because we all know the harm the tobacco has done, and we all know how long it took for people to take that seriously. So this is going to be an ongoing fight. Now, what's also really important is, as we sit here and we talk about this, what I've actually realized is those that contribute the least air pollution seem to be the ones that are exposed the most. This is unbelievable. And those that are also impactors, they are also least likely to engage. So as I'm talking, I am very aware of that we need to get communities on board to engage. And we need to start asking questions actually now. Who are those being engaged right now? And whose views are we actually listening to? What message are we giving out about this topic? Because it seems asthma deaths don't seem to be going down. It seems air pollution is getting worse, but for some, it is getting better. So why is that? We need to ask all these questions. We claim we care, that Black Lives Matter. We go out marching, but do they though? These are questions you need to ask yourselves. Now, we always seem to blame everyone else. It is all our problem. I need to do my bit, you need to do your bit, local authorities need to do their bits, and governments need to do their bit. And the finger pointing does not help anyone. As we head to winter, I always mention this, we have flu season, we have asthma, and now on top of that, we have COVID. And there seems to be a link that is emerging between COVID and air pollution. There has been lots of talk, and I want to come up with some positive messages before I actually end what we can do. We all know now, during lockdown, a lot more people cycled and walked, and we need to continue this. We need to make the decisions for ourselves. We all enjoyed the clean air, but it sounds as if we are not prepared to go through the pain for it. I don't think these things are going to come easy. And we need to look at communities again, as I said, when it comes to things like cycling. From what I've looked at in different communities, not all of them have access to cycling. So maybe governments might need to make grants available for them. Now, I'm going to end here, and I would like to show you a short video that we did for Every Breath Matters to try and show you the extent of the problem out there. And Ben is going to kindly show the video to you now.
We're going to do our best, Rosamond. We may not have the right video, for which I apologise, but here we go.
What video have you got? Oh, God.
Yeah, we've taken this. Some very stark and hard-hitting messages in that video and across all of our speakers today. I mean, where do we start asking the questions here? There is so much to unpack, and we have 12 minutes left to do that. I think the fairest way to do it is to go through in order of our speakers and give them a question each and maybe 2 minutes to answer. So we'll turn back to our first speaker, Kate, and we'd like to, people have asked about the lived experience work that you're doing, and basically how this could be amplified nationally for other people.
Yeah, so I think a lot of what the lived experience work that we're doing, and that goes, I mean, we're trying to make it a theme throughout everything that we fund. I think there is a lot that can be shared and generalized to other parts of the country. So I don't think it should just benefit people living in Lambeth and Southwark. So, I mean, part of it is trying to understand, like, why do people not engage sometimes with this issue, even though it's impacting on them? And what are the better ways to engage them? So some of the things that we've been thinking about is digital exclusion. And, you know, at a time when we're all relying more on digital platforms and things like Commonplace to run consultation exercises through, if certain people can't or are less likely to engage with that, is that good enough? So what other ways do we have to engage people, especially when you're thinking, how do we engage those most impacted by this issue? So digital exclusion is like one of the things that we're trying to learn about. How do we, what other forms of kind of consultation there are? And also, who's the right person to be asking some of these questions? I'm really conscious that in a lot of these communities that, you know, we're trying to kind of look at air pollution in, that these communities have been asked and consulted about a million different things, and quite often they don't see things changing. So, you know, just some of the kind of early insights from the work we're doing with community researchers, they're saying, yes, people know that it's polluted. It's not that they don't know it's polluted. Yes, like they're worried about it, but actually they don't think that they're going to be listened to, and they feel neglected. So how can we work with communities to also show that there is progress and that things can be implemented? So I think there's some kind of, you know, it sounds quite techie, but I think there's some lessons that we can all learn. And I know there's lots of people across different parts of London doing great work like this. So how can we gather lots of lessons from that? Like the work you've done, Ben, when you were part of LSX, the work that's going on in Southall. How can we gather lessons about, like, how do you engage these communities really well? And like, what are the different tools for doing that? And I guess the last thing I'd say is, like, part of it is also about money. So how can we fund and support grassroots campaigners who actually represent these communities? And some of that does come down to money, because not everyone can do it for free. Not everyone can do it out of, you know, in their spare time, because, you know, as I said, these communities that are most impacted by air pollution are often those living on the lowest incomes. So I think part of it is about financial support for kind of grassroots campaigning from these communities themselves.
I think that is an excellent segue to my next question. Thank you for that answer, Kate. So talking about money and investment and return on investment, and Araceli, who spoke about return on investment has to be health for health's sake. And I would like to unpack that a bit more and hear from you in terms of, you know, how can we do that? What can individuals do to protect themselves in their environments when, you know, all of these injustices are around them?
Well, I think that's exactly my point. It's not down to the individual. We have put too much burden on the people that are already overly burdened, and that is the injustice, right? That we have people who not only have to experience, because another thing is that experiencing the effects of air pollution is also traumatic. It's a stressor in itself, right? To see your child be sick, to see your child be hospitalized, to see your parent be hospitalized, that's trauma, right? And so you're asking a person with a system that is physiologically being burdened, but also mentally being burdened by this experience, to now also go out and campaign. That is the very definition of injustice. So it is up to public health organizations, it is up to developers, it's about to real estate, it's about the people who cause the injustice to take responsibility, right? We know this from the Me Too movement. We can't victim blame, and therefore we can't burden the victims as well to carry this. So that's what I want to be really explicit about the anti-racist work and the ecological work, is that we can't expect these communities to tackle this alone, and that it's not about the individual, but the system itself.
Thank you, Araceli, and thank you for putting me in my place there and answering that and so eloquently explaining this. So now we have a question for John about how health authorities can do more to improve air quality locally, and if you have any examples, that would be great.
Yeah, improving air quality locally by health authorities. I think they've got to start with, or very useful to start with, an evidence base. There are plenty of data sets around, so they can start to look at an equity analysis and to really identify particular hotspots that may need tackling. Unfortunately, I'd say a lot of the evidence for health authorities is more likely to come from Europe or mainland Europe than it is in the UK. I think there's been a really poor implementation or failure of implementation of policy in most UK cities compared to many in Europe. So if you look at what Paris is doing at the moment, Paris is basically trying to get rid of the private car in the city. And one of their biggest arguments for that is it's a minority of people that have got the private car in the city anyway. And we are putting in public transport, we're putting in active transport, but we cannot go on with just polluting these neighborhoods. So I think I would encourage people to look a bit wider over to mainland Europe, because the problem in Britain fundamentally is that power is so centralized in Parliament and local authorities have very little power, and even where they've got power, very little resources. I mean, they've had a 40% cut due to austerity over the last decade. This is why we've been struggling to even deal with COVID, because we've undermined local authorities so much. So have a look at what's going on elsewhere. We've got some stuff in the toolkit I've talked to you about. You know, people might chip in and say, oh, but there's great things going on in some places. There are in some places in Britain, maybe, but there's not the substantial transformative environmental change that we need in general in British cities. You know, to give people the choice, the option to walk, to cycle, to get clean buses, free buses, reliable buses, trams, underground, whatever it is. Our cities are held hostage by the private car.
Thank you, John. I think this is certainly the issue that we have here, that everyone needs to do more, but as well, that is not an equally distributed equation, and there's more certain people can do. So Rosamond, finally, for the last 2 minutes of this session, can we ask you, what easy wins are there that can be achieved in local communities?
I think the easy wins, Ben, will be things like, as John has mentioned, travel. So maybe free travel. There are already rumours going around on my screen that the government is trying to get rid of bus travel next year for young people, which would be catastrophic, because we already know people are losing their jobs. So to remove free travel will be devastating. And also, we talk about walking and cycling, but let's be honest, looking around our communities, parents actually do want their children to cycle, but they feel nervous about it. It's too dangerous. And I continue to be hopeful that these segregated cycle lanes will pop up. And also, as we're talking about inequality, not everyone is able to afford something as basic as a bicycle, but we want young people to do this moving forward. And those that come from, so for example, children on free school meals, why can't they get a grant, for instance, to buy a bicycle? And there does need to be a whole culture, actually, a whole change of thing, because we are known in this country as fair weathered cyclists, and unless you're completely committed. So maybe the way swimming is introduced in schools in year 4, maybe cycling needs to be introduced, and young people need to be encouraged to cycle at a very young age. And the same will go for teenagers, because I know there are a lot of secondary schools that do have bike racks that's actually empty. teenagers don't cycle. But you need to give them incentives, because if there are any young people watching, they're going, I'm not going to cycle. I bet you if I gave you an incentive, you actually would, wouldn't you? So give them an incentive and then they will actually do it. And I think for me, the biggest thing, and maybe John, I think it might be John who might have mentioned it, is the WHO targets by the government. They need to be, I need to take every opportunity I can to say they must be enshrined into law. And how about we start the new year with a diesel scrappage scheme? How about it? So those are really easy. We need to make things easier. Where I live, the infrastructure isn't great. So if you want people to change their habits, you need to put things in place. That's it, really.
Thank you, Rosamond. Thank you to our five speakers in this session: Penny, Kate, Araceli, John, and Rosamond. And I'm sorry I don't have more time to talk to you more, ask more questions, and have this discussion further. We'll have to have you back another time because there's so much to talk about in this session and so much to learn from all of you. So thank you so much for joining us. So as we finish session 1 on Unequal Air, we now move to session 2 on Unequal Air. And this session will explore further the lived experience of inequality and air pollution, but there will still, of course, be lots of positive actions and inspiration for all of us. We're going to hear from 4 speakers, and we will have an intro coming from Emma Hibbett, PhD student at Imperial College London and organiser of this second session. Emma, are you here?
I am. Hi, Ben. Can you see me?
Hi, I can.
Thank you so much for the introduction, and for everybody in the first session for your insightful perspectives on workable, positive solutions to fight injustice at a local to national scale. As we've heard in the first session, the burden of air pollution is not equally distributed across society. And during the next hour, our panel of academics and activists will discuss the lived experiences of environmental injustice. They'll highlight their campaigns and research on health inequalities and air pollution, and then we'll open the floor to a panel discussion to explore how our society can improve air quality for all. We hope that these conversations will inspire everyone to take up the fight for social, racial, and environmental justice. And so our first speaker in a fabulous lineup of inspiring activists and academics is Dr. Jo Barnes. Jo is a senior research fellow at the University of the West of England, where she focuses on urban air pollution and helping to raise awareness of the health impacts and environmental justice issues relating to local air pollution. So over to you, Ben and Jo.
Thank you, Emma. I needn't say any more and just hand straight over to Jo.
Thanks very much, Ben and Emma. So yeah, thank you for the invitation to speak today. Hopefully you can see, yep, there's my slides. Excellent. So yeah, I'm Dr. Jo Barnes, Senior Research Fellow in the Air Quality Management Resource Centre at the University of the West of England in Bristol. And I'm going to talk a bit about some research that we've done and others have done on environmental justice and air pollution. So on to the next slide. Starting off with some headline figures, I'm sure you've heard these throughout the day. 28,000 to 36,000 people dying prematurely each year as a result of exposure to particulate matter, fine particulate matter and nitrogen dioxide, and associated health costs of 157 million per annum. So it's a significant issue. If we can move to the next slide, please. And we do tend to sort of focus on that number of deaths figure. However, we should also bear in mind that that is only the tip of the iceberg, if you like, and there is a huge number of morbidity issues around that as well. So ill health, essentially diseases associated with air pollution. So that's linked as well, and how air pollution affects health. So there's a lot of evidence around particulate matter, ozone, nitrogen dioxide and sulfur dioxide, particularly around particulate matter. We know that particulate matter doesn't just affect the lungs, very fine particulate matter gets into the bloodstream and has cardiovascular effects, so it affects the heart. And actually the WHO have actually classed particulate matter as a carcinogen in its own right. So we know that air pollution is something we need to do something about. and it affects people throughout their lives. So children, adults are affected by air pollution when they're exposed to short-term and long-term episodes of air pollution. Even within the womb, we've heard that there is evidence to suggest that babies, or preterm babies if you like, are being exposed. So we've got low birth weights, preterm births, and small babies effectively. And there's also emerging evidence that air pollution is strongly related to diabetes, neurological development. We've seen evidence out just this week around that, psychiatric disorders, dementia, a range of other things as well. So there is evidence coming out all the time to link air pollution with all sorts of different diseases. And as I mentioned, it does affect people differently throughout their lives. We've seen pregnant women, it affects their unborn babies. Children, particularly young children, are particularly affected by air pollution as their lungs are developing. And then we get the cumulative impacts of living with air pollution throughout a lifetime, affecting adults and the elderly. So within that, there are particularly vulnerable groups. So as we've mentioned, pregnant women, children and elderly people are particularly vulnerable, as are those that are living with pre-existing conditions and people that are living in areas of poor air quality. And we'll talk a little bit more about that in a second. So just to introduce this Venn diagram. So this is what we call a quadruple jeopardy effect. So here, this is building on previous work by Jarrett et al., which is identifying the first three linkages. So people who are living with low socioeconomic status, people living in deprived areas, are already suffering ill health associated with living in those conditions, and are also more likely to be living in areas of high air pollution. Those three things are already recognised, but if you consider the vulnerable groups within that as well, and the particular susceptibilities of pregnant women, children, etc., then we've got this quadruple jeopardy effect. And while the Venn diagram suggests that that's only a small overlap, actually that's a much bigger overlap. This obviously isn't to scale. So some of the work that we have been doing around this to illustrate, this slide demonstrates some work that was done by a PhD student of ours, Hugh Brunt, who works for Public Health Wales, and he was looking at areas in Wales and comparing data on health statistics and deprivation. And actually he found that rather than, yes, the two were associated, but actually air pollution was having a multiplicative effect on health. So actually the two combined, the effect was stronger than the sum of their parts. And some further research that I've been doing or have done with Tim Chatterton and Jim Longhurst was also looking at exposure to air pollution and households in poverty. And here you can see in this graph that on the far right hand side of the graph, those areas with a high proportion of households in poverty are exposed to higher concentrations of nitrogen dioxide, whereas at the other end of the graph, those areas with fewer households in poverty have much lower concentrations of nitrogen dioxide. So there's a clear issue here, as other speakers have mentioned in the first half of this session. Moving on to the next slide, the first graph, or the graph on the left-hand side, is the same as the one you've just seen. The one on the right-hand side is showing actually the generation of pollution. So we've still got households in poverty along the bottom axis, the x-axis, but on the y-axis, we're here now showing the total private vehicle emissions per household. So in contrast to the one on the left, you can now see that areas with a high proportion of households in poverty are actually not the ones that are generating the pollution. And I know some speakers have alluded to this earlier, and actually here's some evidence to suggest that. I should mention these figures are across England and Wales. So quite clearly there is an environmental justice issue here where people in poverty are exposed to air pollution but are not the ones that are generating it. And unpicking that a little bit further, we can see that that is because they have lower, so households in poverty have lower private vehicle emissions per household, but that is because they are less likely to own a car in the first place. They are certainly less likely to own multiple cars. They have the vehicles they do own tend to have a lower NOx emission factor, so they're generating per household an average figure of less NOx than more affluent households. They're also less likely to own diesel vehicles and definitely less likely to drive as far as more affluent households. And although they are likely to have older vehicles on average, they are on average just only over a year older. So actually there's quite a contrast there. However, as we've seen, they are exposed to the highest concentrations of traffic-related pollution. And just moving on to the next slide here. So this is some research by others, Mitchell, Norman and Mullen, which was looking actually at 2 census periods, and actually this is 2001 to 2011, and showing between more affluent areas and more deprived areas, the change in pollutant concentrations over that period. So Q1 here relates to people in more affluent areas, whereas Q5 is more deprived areas or more deprived households. And the blue bars represent the concentrations of nitrogen dioxide in 2001, and the red pink bars illustrate the concentrations in 2011. So you can see for the more affluent households under Q1, the concentrations have improved hugely over that time. Whereas if you look at the other end of the graph in Q5, the concentrations are higher and haven't reduced by nearly as much. Other research they've done or within the same paper also demonstrates that actually for particulate matter PM10, concentrations have actually increased more in poor areas. Now, recognizing that this is now nearly 10 years old, it will be interesting to see whether or not in the next census, whether that data still continues, whether we still start to see those increasing inequalities in the next census. And in the last slide, really, apart from my summary slide, I just wanted to highlight also that air pollution is also related to a number of other health determinants that are particularly affecting people in low socioeconomic status. So here is some work that we contributed to from the European Environment Agency, which was also looking at the combination of effects of air pollution, noise, and heat as well. So when we think about environmental justice, we need to really think about the whole picture of exposure. So yeah, just really to summarize in the last slide, we know that air pollution has significant effects on health and quality of life as well as on mortality. And there are different health impacts throughout the life course, particularly vulnerable groups include pregnant women, young children, the elderly, and those with pre-existing conditions. And there are
yes, that's your time, Jen.
That is my timer, so that's telling me to stop, isn't it? Have I got time to finish the bullets, or should I just leave them there for people to read themselves?
You can leave them there for people to read.
Excellent. Okay, that wasn't too badly.
No, great. Thank you very much, Jo.
Thanks, Ben.
Our next speaker is Sufyan Abdul Qayyum from the campaign group Clean Air for Southall and Hayes. Sorry. Sufyan is the youngest member of CASH, and he will be speaking about the campaign's fight against environmental injustice in their community. Are you here, Sufyan? There you are.
Yes, I am. Sorry, I was on mute.
All right, over to you. You've got your 8 minutes.
Yeah. So yes. Well, firstly, I would like to thank Emma for getting us in contact with Global Action Plan. And second of all, I want to thank Global Action Plan for obviously letting us speak at this event today. So as mentioned by Ben, my name is Sufyan. I'm the youngest member of Clean Air for Southall and Hayes, also known as CASH. I became involved with campaigning against the air pollution from Southall Waterside, which is a formal gasworks site which is undergoing regeneration, as I believe it has had a negative impact on my health and the wider community's health. Now, what roles do I play in the campaign? Well, I'm an administrator for the group, as well as I play a key role in the campaign strategies, including organising public meetings, such as the one in July, which held Ealing Council accountable for failing to take action against Berkeley Group, the site developers. Just a bit of background about the site now. So Southall Waterside is the largest brownfield site, the largest brownfield redevelopment, in the UK, and no model exists for developing the site. With such a range of dangerous chemicals next to homes, the development will provide 4,000 new homes, leisure activities like a cinema and retail space alongside the Crossrail route into central London. Now, Cash totally understand the need for new homes in the capital, but the cost of the development to the local community's health are far too high. So it's, in our opinion, it's not worth it to obviously affect thousands of people's health just to put another 4,000 homes into Southall. Now, I don't know if Ben's got the slides, which, yeah, if the media slides, sorry. Yeah, so there's a list of our media, our social media. So you can check us out on social media where we've been featured in The Guardian, we've been featured in My London and The Mirror several times. Just talking about our story. And yeah, so just a few other points I want to mention. So we've actually been in contact and liaising with a group called Mapping for Change, who have developed an app called Odor Collect. You can use it nationwide as well as internationally to report odors on your phone rather than contacting your council or your local authority, because in Southall, we found it very hard to get through to our local councillors, our local MPs, to complain about the odour. Now, there have been spikes of particulate matter 10 and particulate matter 2.5, which, as Araceli mentioned, are very dangerous to your health. And unfortunately, in our group, we have actually lost there's a group member who actually lost her mother to lung cancer, which she strongly believes was the cause of this site. The site was held, well, she wants to hold the site accountable for it. Obviously, we can't prove it's the site, but it's a very big coincidence that people are developing lung cancer, pneumonia, and there's a 7-year-old girl in Southall sleeping in an oxygen tank just because she can't breathe. Now that is something which was very hard hitting to myself when I first heard about it, and that is featured in the Guardian's film. So if you would like to look at that, the article will be, it's called Is My Neighbourhood Poisoning Me? And it's about a 14-minute documentary on the Guardian website. The asthma rates in Southall are actually 30% higher than the national average. From these statistics from the year 2016 to 2019. And Southall Broadway and South Road, which are the road right next to the site, are actually the highest polluted roads outside of the ULEZ, which is the ultra low emission zone. Obviously that is also quite concerning, because I understand this is a clean air meeting about the wider air, but I just thought I better mention the site, because that site is very polluted, and across Southall, the amount of pollution we get is absolutely ridiculous. We've had residents' complaints of coughing out blood, having nosebleeds, having nausea spells. So it was all quite hard hitting to myself when I got involved. And that's why, as a 19-year-old, I'm very committed to this campaign. And I've been going strong on it for the last 2.5 years since we've come about. So yeah, thank you very much, Ben, for letting me speak today. And thank you very much, Emma, once again, for getting us in contact with Global Action Plan.
Thank you, Sufyan. I mean, yeah, I just exactly what our previous 6 speakers have been speaking about, and the injustices on around particular sites, around particular roads, that you and your community are living that. So thank you for sharing that experience. We'll have some questions for you at the end, I'm sure. So,
Yeah,
so stay with us. Up next we have Jeffrey Smith. I believe he's here. He's a consultant with the World Health Organization. Jeff's consultancy work examines urban health and air pollution with a focus on citizen science and community engagement. Oh. We seem to have lost you, Jeff.
Hello?
Yep, there you are. Hello.
Okay. Could you hear me before?
No, this is the first words we've heard from
Oh,
you.
okay, okay. So thank you, Ben and Emma. First, I want to thank the Global Action Plan for inviting me to speak this year. And I must warn everyone that I have a habit of including more slides than time allows. But that's because I like, in these days with the recorded sessions, viewers can pause and see the studies and look at the research for themselves. So let's see, to advance the slide, I don't see an arrow. Ben?
You can just press the slide and it should move, but just give it a moment. There's a bit of a lag there.
So I've just clicked the slide.
Should move.
No.
Ah, there you go.
Okay. So our national governments determine what choices of energy and materials and processes we have. And we need to look at who's the most vulnerable. And this slide, the blue and red dots in this graph represent 40 different causes of death in WHO's review of the progress towards health-related sustainable development goals. When WHO works with its partners, they concentrate and focus their attention on who's the most vulnerable. And I believe this is something that should extend to city and community managers, and they should do the same. So around 20,000 people a day die due to air pollution globally, all around the world. Dr. Maria Neira, the WHO Director of Environment, Climate Change, and Health since 2005, she likes to share that we really don't need any more evidence. Dr. Neira and her team have identified more than 70,000 scientific papers to demonstrate how air pollution is affecting our health. Some of the other speakers have already mentioned this, how diesel particulate and all particulate PM2.5 is a cancer causing, but we also know that ozone in cities and in certain neighborhoods, the NO2 oxides of nitrogen combines with ozone and is creating other hotspots of air pollution that we need to look at. So in this slide, we have, I'd like to turn now to kind of nanoparticles and what recent science has found out about nanoparticles. I've added a black blob here, you see, underneath those viruses, and that is diesel particulate. And the average diesel particulate is 18.5 nanometers. Just suffice to say, it's average than most viruses. It's smaller than most average viruses. There we go. Okay. And so these nanoparticle researchers, they found in human lung cells, after they were exposed to wooden burning smoke, they found that the lung cells on average died within 4 hours. That's represented by the blue bars there. The green bars are these researchers, they generated ultra clean black carbon nanoparticles in their laboratory, which didn't have any toxins from the exhaust of the smoke, from the wood burning, like formaldehyde and others, or attached to them. And in those cells in the green, you see that to the control, the yellow, there wasn't any more death. So what does this tell us? This tells us that black carbon particles are carrying the toxic gases on their surface, a lot like a Trojan horse. And because these particles are smaller than viruses, they can reach our bloodstream in every organ of the body. Oh, sorry, I went too far. Can I go back one? Ben? So researchers counted the number of particles emitted between Euro 3 and Euro 6 diesel engines. And here you can see at the bottom, the Euro 6 diesel engines are still emitting 100 billion particles every 2 minutes in the space of about 7 cubic meters. That's like 7 double door refrigerators. So what does that tell us? That we have a lot of these particles. But we hear a lot about diesel, but Swiss IMPA researchers found in a long list of toxins in the emissions of petrol vehicles too, just in the last 3 years or so. Benzoylpyrene is especially nasty one that causes cancer as well. WHO doesn't want us to have any of that in our environment. It's a major pollutant that enters our homes through and bloodstreams, of course, from wood-burning stoves, fireplaces, incineration hotspots, and of course, vehicle exhaust. And I want to point out that a lot of these sources of pollution have been located near communities, poorer communities over history around the world. So researchers found that the cancer-causing potential of benzoylpyrene in the acceleration of exhaust of Euro 5 and Euro 6 petrol cars was up to 1,700 times greater than the EU standard and 6,800 times greater than the UK standards. Here we have black carbon nanoparticles that reach every organ of the body. And in this image, we can see that the nanoparticles have reached the fetal side of the human placenta. This was discovered also in the last 3 or 4 years by researchers at the University of Hasselt in Brussels. So I don't have time to go into this one that much, but experts have long been able to measure the length of the DNA structure of telomeres. And so we now know that air pollution, that mothers exposed to greater levels of fine particulate air pollution in the study they found gave birth to newborns with shorter telomere length. And so telomere length is known to be associated with our life expectancy. So in other words, some children are being potentially pre-programmed with a shorter life expectancy when they're exposed to more of these PM2.5 fine particulate particles. So for the rest of the time I wanted to turn towards solutions and ideas and what we can do. And this study identified affordable tailpipe emissions controls that we can retrofit on all those older Euro 5 diesel vehicles that are still running on our roads. That doesn't help with the petrol vehicles and beta-alpha pyrene, but it does help reduce NO2 in the cities. So why should we try to monitor the progress of SDGs? No, not why we should, but we should monitor the progress of SDGs, not just at the national level, but also at the community and local level. And we can get together citizen scientists, community activists, corporations, city managers, and we can all come together and create this open data because that's transparency and low cost capacity, which is going to allow us to do what we need to do. So, but to do that, we need to know which communities, regions, and areas are making progress. And this is a problem because a lot of that data is not available, or it's all bundled together and we need to disaggregate that. But we need to spend money on this type of disaggregation and acquisition of data, all data, not just health data, but health-related data as well. So I wanted to show here that John Snow, the father of modern epidemiology, it's the guy at the top, not the guy at the bottom. But he just went into communities and asked questions and mapped the results on a map. And this is something that citizen science does. And so we can see and hear lots of traffic, as you can see in the insert that I've put there. But the solutions is going to have to be that we do something different. And that's what we propose. And citizen scientists have made maps that we can map and show hotspots of air pollution. We need to integrate our data types and sources to be able to know what actions are making that impact. And so integrating that data, again, as I mentioned, is also key to help reduce the burden of disease.
Thanks, Jeff. I'm afraid we're going to have to cut you off there.
Okay.
I mean, we could continue that talk for probably another hour.
Yes.
There's a lot there. I'm so sorry to do that to you. We'll have questions for you.
Right.
Yes, we'll have questions for you.
I'll summarize in the questions.
Cool. Now we're going to move to David Smith, who is the founder of Little Ninja UK. Dave's Little Ninja campaign focuses on reducing children's air pollution exposure and champions the fight for environmental, racial, and social injustice.
Hi, Ben, and thank you to Emma and to the Global Action Plan, and thank you to the speakers who've come before me. You've set it perfectly. There's lots I could talk in my presentation, which I no longer need to. Just to highlight a few things, the question earlier from Kate around where do those children who are exposed to illegal levels of air pollution, where do they spend their time? Nursery, playgrounds, high streets. From Araceli, whose voices we silent, and Rosamond, the bit there around those who contribute least suffer the most, and exposure to 10 cigarettes a day, passive smoking for children who live on main roads and go to schools on main roads. And it feeds in perfectly to my campaign, Little Ninja UK. It started up 3.5 years ago when I discovered that my child was likely to have between 5 and 14% reduced lung capacity because we live on a main road, but also because of the time we spend walking on main roads, the potential for him to go to nursery, our local nursery on a main road, our local schools on a main road, and that kind of real world health exposure to air pollution. So I started campaigning. It was Little Ninja UK. We discovered that kind of part of the problem was all this congested idling traffic, whether it's in traffic or actually if it's parked outside schools or our home or a nursery or a hospital, GP, surgery. And so we started the No to Idling campaign, NO2 idling. It's still there on change.org, please do sign. And it really was around saying there are things we can do to reduce exposure just by reducing the unnecessary burning of fuel, which is what happens when people leave their engines running just to charge a mobile phone or, you know, to stay warm or cold, to cool down. So from there, we kind of understood, has been shown today, the impact on main roads in terms of for the unborn child, in terms of being born early or low birth weight, the impact on IQ and intelligence, cognitive development, but also on children in terms of more chance of pneumonia and also asthma, and as we mentioned earlier, the reduced lung capacity. So this year, it kind of hit us for 6 with coronavirus. And once again, it is the poor and the BME communities who are most at risk. I, as a black male, 4 times more likely than a white male to die from coronavirus. When you strip out the social economic factors, still twice as likely. And the link between air pollution and coronavirus, higher levels of air pollution equal increased infection, also increased death rates. So when we look for this kind of opportunity to have a COVID emergency response, part of me inside is kind of celebrating because actually it's going to tackle the air pollution problem as well. And it seemed to be doing that at first, when the idea was to actually reduce space for cars on main roads, increase space for cycling, increase space for pedestrians, increase space for buses, 24-hour bus lane. And this not only reduces air pollution on the main roads, but it also increases the distance between the vehicle exhaust pipe and the people on walking and scooting along these main roads, particularly the children who are closer to the source of the air pollution, the exhaust pipe, and babies in buggies who are even closer, up to 60% more exposure than an adult. And obviously they breathe more rapidly as well. So very excited about this. When the Mayor for London started doing this, myself very excited about these main roads. And then the money came down to councils, and the decision was, what are councils going to do? And there was a list of things they could do, which included things like school streets and tackling car storage on these side roads, because, as you know, very busy, both sides of the side roads filled with cars makes it difficult for social distancing and difficult to cycle through, because obviously you might get hit by doors opening and so on and so forth. So I was a bit shocked to find out that the solution being put forward was low traffic neighbourhoods, which is actually to reduce traffic on these quieter, less polluted side roads by closing them to through traffic. And these are the areas of high car ownership. But when you close these roads, that traffic is displaced to other roads, other residential roads, particularly in cities like London, Birmingham, Manchester, and Liverpool. These roads aren't arterial roads and distributor roads, and that's how they're described, and main roads and where traffic belongs. No, these are residential roads. These are our homes. These are our schools, our nurseries, our hospitals, our GP surgeries. These are our high streets. You know, these are places where we live and breathe, and we are already exposed to the highest levels of air pollution. And that seems to just be pushed to the side in this eagerness to what it appears to be to reduce traffic and air pollution in areas of low air pollution, the side roads, in order to make it nicer so that car owners might think about driving less. Now, it kind of sounds like a good plan, and when you look at the studies around Waltham Forest and you think, actually, look, air pollution fell, you know, traffic fell, and you've got this thing called traffic evaporation, where traffic will disappear, and you kind of look a bit deeper into the evidence and you suddenly find out, actually, I don't like to use the word maybe tall tale or a good story, a very compelling story, but when you look at really at the evidence, traffic in Waltham Forest actually increased. Car use didn't actually decrease, not significantly. There are trends, there are suggestions of these things might happen, but did it? No. Even the NO2 data is modeled on, but actually includes things like ULEZ and Euro 6 cars and lots of other things rather than responsible by the LTN. So in terms of the LTN, given these benefits, the evidence from what I see just isn't there. In terms of traffic evaporating, well, actually, even if you get 5% evaporation because you've closed these side roads, maybe even 10%, let's say everything was working perfectly, you got 15%. 85% is still going and being displaced on the main roads where people are already most at risk, and not just anybody. These are the groups who are least responsible, very low car ownership, they already walk, they already scoot, they already use public transport. These are almost the heroes of climate change and air pollution in terms of doing the right thing, and they are being disproportionately punished. So I first came across this in Stoke Newington, where parents there kind of highlighted the issue, 3,500 children at local nurseries and schools on the main road, side roads going to be closed to make an LTN and push that traffic to the main road. And they protested and they did all the right things. They got into the TV, ITV, into newspapers, and the council did a survey and they did a consultation, and it showed 70% said, we don't want it. And so it was held at bay. But now, due to COVID, emergency says, actually, we can just enforce it. And they say, well, hang on, consultation. Don't worry about consultation. We're going to impose this. What about equality impact assessment? We're going to impose this. So this is a situation now right across the UK. And it's really neat to say there are voices like myself. I'm a cyclist. I'm an ambassador for cargo bikes. I'm not a motorist. I'm not part of the motoring lobby. My voice doesn't get heard. The millions of people who live on these main roads isn't being heard. Now, I'm running out of time. Any questions, please? I'm on Little Ninja UK on Twitter and David at littleninja.co.uk. So please do get in touch.
Thank you, David. That's the alarm. And thanks for sharing your concerns on that difficult topic. I think we can agree that evidence is mixed, and there are a number of factors at play for road traffic increases on main roads at this time, not least of all because of coronavirus restrictions on public transport. But I think you and I and everyone on this panel can agree that we need to drastically reduce motor traffic on both main and residential roads, and that can be done with the right mixture of interventions. Hopefully we can use this Q&A time, so we have, I think we might be a bit ahead of time actually, to unpack some of those issues and interventions. So I'd like to thank our speakers and go back to our first speaker, Joe, and I'll start the questions there. So Joe, how can we manage the compounding threats of air pollution, noise and heat, which disproportionately impact vulnerable groups?
That's a massive question, Ben. Thank you for that.
You're welcome.
Well, I guess that's the challenge, isn't it, really? Yeah. Yeah, thanks for putting me on the spot. How do we manage it? Well, I guess by looking at the sources, essentially. So I think there's 3 different ways that you can reduce the impacts. You can either reduce those that are being exposed, move the receptors, if you like. You can reduce the amount of pollution that's being produced by a different source. So, for instance, going for electric cars rather than diesel or petrol cars. Or you can remove the source. And given the number of co-benefits associated or sort of combined effects, I think that actually that's probably the better option. I know it's more difficult, it's obviously more challenging, and some might say less feasible. But ultimately, I think that's really where you need to be to gain the biggest impact. So, for instance, pedestrianising a street, for instance, you're going to get rid of both the air pollution and the noise, and all of the other associated things such as road safety, for instance. It's going to improve. So, yeah, I mean, it's more of a challenge for local authorities and for governments to do that kind of thing, but actually, that's where the biggest gains are to be made. So.
Thank you. Sorry about the tough question. I
don't okay, no, you just put me on the
spot. Okay, stay with us because there'll be more questions cycling around. I have the next question for Sufyan, and I mean, I have one hard one for you and one easy one for you there if you're there, Sufyan. So I'll start with the easy one, which was, how did you get involved in community campaigning?
Yep, am I muted? Yep, yep. Well, how I got involved was actually when I was 14, I was just at my local library, and where my local library is situated, there's a community hall right next door. So they were advertising for a meeting. Said a public meeting, come along and voice your opinion. So that's what I went and did, and then voiced my opinion there, got headhunted by Clean It for Southall and Hayes, and then got in touch with Angela Fonzo, who is another member of the campaign, and one of a mutual colleague between myself and Angela. He actually vouched for myself to Angela Fonzo, who, as I said, manages the administrative side of things. And then, yeah, so I got sort of headhunted by them, and then I do a lot of their administration work now and digital marketing for them.
Great. Are you responsible for the very cool acronym CASH?
No, I'm not. I can't take. I can't take. I actually don't know who is.
Worked out very well though.
Yeah.
Cool, thanks, Sufyan. I'll cycle back around to you with another question a bit later. So Jeff, you started by saying we don't need any more evidence. We have enough evidence. How is citizen science different, and how can it help achieve environmental justice?
So yeah, I guess that would probably be my summarizing slide, really, because as I was mentioning in the last 2 or 3 slides before I ran out of time, is that we can all work together, and we have to work together, and it's when this data is open and available that in the communities that then the awareness occurs. And so this typically starts at the city level or the courts, where we're able to make the kind of reforms that are required. So there are many examples of how risks occur in minority communities. For example, there's Flint, Michigan, and the water in parts of the southern U.S. There are, let's see, well, Hurricane Katrina. 50% of all the deaths were amongst the African American community. 80% of homes that were destroyed or damaged during that hurricane were in the African American community. Also, you go north of there, there were not homes built near pollution sources. There were pollution sources built near homes of African American communities. And so this type of environmental justice, we're all better off when we're all better off. I'd like to say that, as I mentioned about the flooding, right? This pollution that's happening in communities in places like London and all around the world because of these nanoparticles that are invisible, but view those as waves of pollution. These waves of pollution are hitting people where they live, and we've got other communities, and it's okay. We should create little islands as safe havens, right? But we shouldn't leave the people who are on the front lines there behind and vulnerable to those waves of nanopollution that we're seeing. Are they're damaging DNA. The telomere length means that potentially it could damage the DNA of the children and grandchildren even. We don't know that yet, but science has to research that and find that. In other words, let's not leave people to sink or swim, right? We all need to do this together because we're all better off when we're all better off.
Thanks, Jeff. That's a lovely saying. Sufyan just wanted to come back on something that that he was talking about previously. Sorry, Dave, we'll get to Sufyan.
Yeah, hi, sorry. Yeah, I did actually forget something to mention while I was doing my talk. Obviously, I am from CASH, Clean Air for Southwell and Hayes, but we are also part of a wider alliance called Gasworks Communities United, who are a group of campaigners who are suffering environmental injustice at the hands of Berkeley Group, the site developers. So we're a group of people from Brighton, Hornsey, Leighton, and Southall. That is another channel. If you want to reach out to us, you can reach us out. You can reach out to us on Gasworks Community United. That's another channel you can reach out. Yeah.
Cool. Thanks, Sufyan. Sorry to interrupt the flow there, David.
Sorry about that.
You mentioned some voices are being excluded from debates on air pollution, which is something, of course, that Araceli and Kate also mentioned in that first session. How can we ensure that more community voices are heard in political discussions around air pollution?
Well, I'm delighted you asked that question. I actually had a quote which I was hoping to mention earlier. It was from Sustenance. They said, for healthier, happier and fairer cities where all communities can thrive, we need to ensure the often unheard voices are heard, amplified and included in urban design discussions. Ties in perfectly what Jeff just said in terms of, we can all work together, leaving people on the front line behind. It's not to have a debate about LTNs, but just using it as an example. It's a wonderful scheme in terms of on paper. The story is compelling. It's needed in terms of ways to reduce car use. I think we all agree more active travel is actually better for our individual health, but also for society. How we get there, how we do that, that should be a discussion that includes everyone. The discussion in terms of the design of the low traffic neighborhoods has been going on for years and years and years. If we were honest and took a good look at the people who designed it, and I think we'd find, and if I'm wrong, it'll be great if someone can outline that. I think we'd find that it's mostly white, affluent men, and a percentage of women, but mostly men, probably a lot able-bodied. And so therefore, when you look at that and then you see consultation, and again, it will be those who have time on their hands to log in, do what they need to do on these different, community websites and stuff. And then when it reaches that kind of point of going to the councils, again, the councils don't necessarily reflect, London's diversity. It's 40-odd%, BAME. I think it's that one which is, when you have these kind of schemes, can they be designed to be so inclusive that when the output comes out, it actually reflects the ideas and the desires of all of London, all of the communities, particularly when you're going to put it into such a diverse community like Lewisham or Brixton, you know what I mean? What's the impact going to be? Because I think that's been a lot of the issues. It's not that low traffic neighbourhoods are bad, it's actually the way they're actually being implemented, what actions have been done for the main roads and the residential main roads, is everybody being included, and is everyone's voice and ideas being heard? I think when we get closer to that point, I think we'll find less kind of animosity, and certainly there won't be a need for me to come and talk about these issues because, you know, they'll already been included through the design.
Thank you, Dave. I see we still have Rosamund with us, and I wondered if you wanted to pick up on that, Rosamund. So, you know, how do we do it? How do we include voices and make sure that health and social justice issues are addressed?
I think we're going to have to probably ask doctors to speak out, because we've all admitted that the people who are most affected, they are not engaged. I think, as David mentioned right now regarding low traffic neighborhoods, and for me personally, I am never, ever going to find it acceptable that a scheme can be introduced that young people who already have asthma, it will exacerbate it and they will end up in hospital. And again, the problem, like air pollution, we don't see them. You would need to go to A&E and they will be there, just because we don't see them. So maybe someone's going to have to speak up on their behalf, or we actively engage them. We know where they live. We know they're on main roads. What do they want? Have we asked them? We seem to make decisions for them rather than asking them. How can we implement something that they are even worse off? And I have asked Jo for her slides because I was really interested in NOx straight away. So we already know these things. How can we make life in 2020 even worse for these young people? And I repeat it again, and it's not pleasant. And those of you that know, my daughter wasn't the only one to die. 12, and this is just in London, up to 12 children every year die. And if the pollution right now is worse, we're going into winter season, we have COVID, it's not a nice conversation. This isn't frightening people, by the way. This is being honest and speaking the truth. We keep on saying we care. We keep on saying all these things. How can we design something that some people can get better air than others? How can we do that as a society, that those who are already suffering are even suffering more? Personally, I don't understand it. I'm going to read Jo's slides again to get more of an insight into. No, I really.
No, sure. Yeah, we're going to hear from Jo again.
No, I really don't understand it, and I need to read more to understand how you can implement something. And I have asked doctors, and I'm going to make more noise about it. They need to speak up, because we clapped for the National Health Service, so I know people trust them. They treat these young people, so people don't think it's just me saying it. They need to come out the same way they were about the tobacco, how doctors fought about it. Remember years ago, they need to come out about air pollution. I want to hear doctors' voices. They need to lobby the government now. I've said it. I bet you they're sitting there going, we've got enough to do without you increasing our workload. But no, they've got to do something. You can't have young people being rushed to hospital in the middle of the night in 2020 because of a scheme that's been introduced. It is unacceptable.
Well, I think the fair thing to say is, you know, air pollution is what's rushing people to hospital, regardless of any intervention or scheme that's currently taking place. But I accept the sentiment.
No.
I'm going to have to ask.
We'll have to disagree on this. There's spikes in air pollution. It is a spike in air pollution that causes asthma attacks and heart attacks. It's not the actual scheme, it's a spike in air pollution. Sorry if I wasn't clear about that. I do apologize. So yeah, it is the spikes in air pollution. No one has on purpose designed something that is sending children to hospital, no. But when people have come up to you and say, this isn't working, our children are suffering, people need to listen. Those in higher places, like David said, they need to be listening.
Yeah, thank you, Rosamund. And not to put too fine a point on it, but somebody did design something that's causing air pollution, and it is the car. So I got a question for Jo, and hopefully this one won't take you too much by surprise. It's just about the key areas scientists should focus on over the next few years to help combat social and environmental injustice.
Yeah, again, it is a bit of a tricky question. Yeah, you have stumped me again, Ben. I really should be better prepared for these questions, shouldn't I? There isn't really a single issue. I think I think that's the thing. I think that's the thing that's come across from a lot of these talks as well, is that it's very integrated. And I think that is what we need to take to heart, is that we need to be thinking not about issues in isolation, but how do we actually manage not just whether or not people are being rushed to A&E in terms of sort of acute impacts, but the chronic impacts throughout people's lives, and how we deal with these disparities of effect as well. So it has to be dealt with at a more kind of systemic level, in thinking about planning, in thinking about transport planning, and thinking about sort of how do we design the places that we live. So yeah, I'm not sure if I went completely off topic there and started answering my own question, but I think it was more about kind of where the researchers need to go rather than where policymakers need to go. But I think the research needs to be done to inform the policy. So yeah. Obviously, there's some more work to be done around understanding any linkages between COVID and air pollution. A lot of research that's being done on that at the moment is indicative as work that's coming out, but it's not really peer reviewed. So more to clarify the linkages there potentially could only strengthen the argument in both cases. There's always more work to be done on the combinations of pollutants as well. So when we talk about the health impacts of PM2.5, fine particulate matter, and the impacts of nitrogen dioxide, we can't really think about the impacts of these things separately, because we don't live with pollutants separately. We live in a cocktail soup of pollutants. And so what we really need to understand from the science is what are the health effects of the combined impacts of those pollutants. So there's a lot of work to be done there. Yeah, now you got me thinking. There's lots.
No, I could see.
You can stop me now if you like.
I could see Jeff nodding along to what you were saying. I wondered if he wanted to come in now.
I'm sure he does.
Yeah, just to segue to that, you know, because this is it requires a holistic response. But I was just thinking that, you know, if COVID, and what Rosamund had said too, and we've all thought about it, and we've seen Build Back Better, but also if COVID has taught us anything, it's that the asymmetrical threat to our health and safety is far greater from things of how we treat and mistreat the environment. And we've got decades of data and information, as Dr. Nera had mentioned, 70,000 documents, right? So we know this is happening. We don't have to find any more evidence before acting. We do need to collect more data to know what we're doing and what works best, so that we're making good, intelligent investments. But to move that, the investments, we need to think of this, we need to invest as much in health, and we need to bring health in all policies to everything we do. And we need to invest in at least as much as we do into the military threats that that nations face. And I served 14 years. I don't look it in the Army Reserves and the U.S. Army on active duty. And so I've seen a lot of investment, and we can do the same sort of investment. And our medical professionals are the new heroes, and the greatest asymmetrical threat to our health and safety is from how we mistreat the environment and how that causes death, disease, and disability. And then the last thing is clean air is a human right as well. If we think of clean air as a human right, Rosamund? It was, is it David Boyd? Who's the UN special reporter who discussed and goes every year to the UN and asks them to consider clean air to be, and water and food to be a human right. And we need to think this way. That's all.
Thank you, Jeffrey. And I have to wrap up now and thank all of our speakers at this double session, Kate, Araceli, John, Rosamund, Penny, Emma, yourself, Jeffrey, John, Sufyan, Dave. I hope I've not missed anyone there. Thank you all so much for joining this session and joining this debate. I think I'm going to have to watch it back and take notes this time, because there's so much to unpack, and I hope that we can talk again soon and learn from each other, because there's a lot we need to do here. So thanks for joining us. I'm going to close off now, and there'll be a video before we move into our next session.
Air pollution is a public health crisis.
Sorry, everybody, just a momentary technical hitch. We'll get this video working imminently.
Air pollution is a public health crisis. It causes the premature deaths of thousands of people in the UK every year. And it leads to countless others falling sick with life-changing illnesses and respiratory conditions. That's why, as the Mayor of London, I'm proud to support Clean Air Day. This day is about raising awareness of the dangers posed by poor air quality, as well as promoting efforts to tackle it at every level, from governments and businesses to local authorities, schools, and our communities. In London, I'm pleased to say we're already implementing some of the boldest and most ambitious plans anywhere in the world to clean up our air. We've introduced the toughest emission standards of any global city, the ultra-low emission zone. We've cleaned up our buses and taxis and taken action to address emissions from construction sites. And we're now transforming London's roads to make it easier and safer for Londoners to walk and cycle. On Clean Air Day, I'm also calling on the government to adopt the World Health Organization's recommended targets for air pollution. This is because everyone, regardless of their background, neighbourhood, nationality or income, should have the right to breathe clean air. And because as we emerge from this pandemic, we believe we should be taking the lead in driving a greener recovery rather than our cars. Air pollution.
Hello, good afternoon, everyone. I'm hoping you can hear me. We're about to start our next session for Clean Air Day Live. So this session is really looking at what the health sector can do to tackle air pollution. We think this is a really, really vital discussion for the health sector. We know the health sector can play a role in terms of leadership in reducing emissions in its own sites. We know that health professionals can play a role in terms of informing their patients, particularly as trusted individuals within society. And we also know the health sector can play a key role in terms of supporting policy measures on air pollution. In terms of what we'll cover in today's session, so we're going to be looking at examples from hospitals and from health professionals who are leading the way in this area. We're going to be looking at the Clean Air Hospital Framework and also new piloting projects which are working to look at how we could roll out a national campaign to support training on air pollution with health professionals. Joining us for today's panel, so we have Nick Martin, who is the Head of Sustainability and Environmental Management at Great Ormond Street, and also Lawrence Burton, Communications Manager at the UK Health Alliance on climate change. So very, very happy to have you both with us. And we're going to start today's session with Nick Martin, so talking about experiences from GOSH in terms of developing the Clean Air Hospital Framework alongside GAP, and really practical experiences from a hospital of ways that they have implemented supporting clean air around their hospital site. And then we're going to have some specific kind of Q&A immediately after that for people who have questions about the framework. And then we'll focus a little bit more in the second half of the session on what we can be doing to communicate with our patients. So I will hand over to Nick. And Nick, thank you very much for taking your time out of a busy schedule to join us this afternoon.
Hi, Catherine. Yeah, no problem at all. Can you hear me?
I can, yes.
Great. Hi, everyone. So yeah, I'm Nick Martin. I'm the head of sustainability at Great Ormond Street Hospital. Yes, a real pleasure to be involved today and get an opportunity to share some of the things that we're doing and hopefully create some collaborative opportunities and everything else. So just to begin with, I'll draw your attention to the beautiful collage on the screen that was made by some of the children in Gosh Care. You've got a vision of their clean air future there for the planet. There's lots of trees, there's cycling, I think there's scooters and swings, lots of bees, lots of planting in general. So this is something they made with our play team as part of the engagement process, and we'll go through some of that, but I think it's rather beautiful. Okay, so I'm trying to move to the next page. That's currently not happening. Okay, so I'm going to run through the Clean Air Hospital framework and what it is. Next, how we created it in a collaborative manner. That was really important. And again, if it's being replicated, something similar would be done. And the impact of its implementation in Gosh so far. And again, it's all very replicable. And then finally, some of the next steps that we're going to take. And throughout this, look out for the little drawings here. This is another one from some of our children. Okay, next page. Okay, so what is the Clean Air Hospital framework? Let's go back. I'm not sure if I'm doing the controlling here or not, but we'll get through that. So it's a free resource. I want to emphasize that. This is something that we can all access and all use. A free resource designed by Great Ormond Street Hospital in partnership with GAP, with Global Action Plan. And it's to enable hospitals to understand what it means to be a clean air hospital. Hospitals are obviously complex systems, lots of inputs and outputs. So it really brings that together and makes it easier for a hospital to understand that. It also allows a hospital to self-assess progress against 7 key elements of what it is to be a clean air hospital. The 7 key elements include transport, include education and engagement, etc. And that's great. How to develop an action plan, so a bespoke action plan that a hospital can then deliver on, and to assign ownership within the hospital to take these actions, and then to track and report progress as we go along. So fundamentally, it's about improving air quality inside and outside of the hospital and minimizing sources of air pollution that we have control over. So the leadership in that respect, there's an advice element. So how we as an organization can educate our staff and get our staff to communicate with patients as well. And then finally, how we can be role models as an organization, how we can work to change the agenda, to become part of, yeah, that would be great, Catherine, if you don't mind.
Hello, and we seem to be having some issues on the technical side, so I'm just going to suggest our lovely technical team, maybe if we take the slides off for a minute and just sort out, they seem to be on automatic, and maybe Nick and I can just have a quick chat while we sort that out. So sorry about that, and sorry for
okay.
people watching. So Nick, I know you're going to cover a little bit more about the kind of hospital framework and its origins and how we're kind of rolling it out. But I guess it would be also interesting while we're sorting out the kind of technology side. So are you aware of any other hospitals that are using the framework at the moment? Has it gone beyond kind of Great Ormond Street so far, and kind of, yeah, where else are we seeing it at the moment?
Well, I believe it has. Peers that I speak to are using it. To what degree, I don't know, but it's certainly something that, as I say, it gives a nice structure to what is quite a complex problem, complex sets of inputs and outputs. So it sort of brings it all together and brings a blueprint. So I know some of my colleagues, I think in Newcastle and other places, are certainly using it at this stage, and yeah, really keen that more continue to do so. Let's have a look how that's working.
Now I can see it looks like the slides aren't jumping around anymore, so maybe if we can take you back to where you were.
Are you controlling or am I?
I'm not controlling, and we have a fantastic tech team who have been supporting. Maybe
well, let's carry on from,
let's see, yeah, how we go
from here. My apologies all. Okay, so breaking down from here, we're looking at 7 key categories. We're looking at our deliveries, our procurement, who we're buying from, what we're buying, do we consolidate our deliveries? Secondly, we're looking at design and construction, how we design our buildings, how we ventilate them, etc. Thirdly, we're looking at the local community, the local area, how we engage with them, what we do to influence, have influence positively or negatively on the local area. Energy generation is key, how we heat and light the building. Communication and training, how we train ourselves, educate ourselves, but are also able to do the same with our patients. NHS staff, medical staff are trusted messengers, so that's key. Hospital outreach, how we engage with our local community, and then travel. Travel planning for staff, for our contracts, the vehicles we use in our fleet. So this is just an image of what a clean air hospital might look like. This is actually a board that we use and we take round to work with patients. It has magnetic stickers on, so it's a really nice way of having a dialogue with our patients. But again, it's covering their community, indoor air quality, infrastructure that we are going to need to invest in the hospital, etc. So really we'll get onto this, but it's about simple actions, but there are some more complex and systemic actions as well which need to be taken, which we'll look at in the next slide. Okay, this is an example of one page, our travel page. For example, here is hospital travel planning, simple action here. Basic is worth a point, getting there is worth 5, and excellent are worth 10 points. So for example, providing basic information for staff is a 1-pointer. We can all do that. But in the excellent column there, we're talking about working in partnership with the local authority to ensure planning and development decisions minimize air pollution. So that's much more systemic, takes time, and they're worth 10 points. So as part of our tracking process, we're looking at building up to actions like that. So again, the framework takes all that into account and starts to really factor in progress in that respect. Okay, so how did we create the framework? Working collaboratively was really important, and we worked internally with teams from across the organisation. We ran workshops to understand how can we deal with this problem. It wasn't something that people had thought much about, but it was necessarily to get their input from across the hospital. Externally, we worked with many different organisations, the WHO, NHS England and others, to get their input. So with the activities that we created were real, they were precise, and they were realistic as well. Okay, so let's go from here. We will. Okay.
Nick, I think it's jumping again. I might just ask our tech team to help, but I just had a question on that in terms of engaging kind of all these different stakeholders, because certainly, you know, when I've spoken to other hospitals, they've said it's a real struggle to try and sometimes to get everybody in the room. You know, that everyone is really, really busy, and kind of that's often the starting question that we have at Global Action Plan when we're talking to hospitals. They're like, you know, what's the most effective strategy in terms of making sure that you are engaging with all of those different stakeholders?
Well, I think yeah, it's demonstrating how this is relevant, how it's actually going to potentially help with your processes to make things more efficient. But it's, yeah, also there's to some degree a little bit of insistence there that this is where we're going, this is the direction we're going. There's some leadership say in that. So once you bring people together into a room and you get a realistic understanding of what they think are the barriers and what they think is possible. So we start from a sensible baseline and create activities to move on from there. And I think that session itself is educational and helps in building that belief in what we're doing. So we did that. We created it collaboratively. We had lots of input externally as well. So in terms of the type of engagement that we took part in, we have some examples here, but we may see them, we may not. But basically, there were lots of simple, for example here, simple messaging that we start to get across the hospital in regard to how air quality can affect your lungs, because that's the basic kind of information that we start to put up. Followed on from here, so messaging around the types of actions that people can take, the types of actions they should be encouraging with patients. Working from home a lot, so keeping your home ventilated, often forgotten the indoor air quality side of things. Obviously in the hospital, indoor air quality is very good. And taking quieter routes, etc. So transport, so some simple messaging around this type of thing. And then some more involved. These are laminated cards we work with the children with and look at the source, symptom and solution of the problem. The source is a lorry, a building site. Some of the symptoms that we'll move on to here are coughing more, visits to A&E, and some of the solutions are avoiding heavy traffic. So breaking it down into a slightly more involved way. Of course, we're just still talking about education side of things here. Then we move on from there to again, more involved forms of involvement. This is artwork with our children and our teams here. So some lungs, a bicycle, non-smoking. So we start to engage that way and then use these as methods of communication with the rest of the organisation. Simple activities here, my Clean Air superheroes, so some of the children here. Nikita has created a clean air tree, which is sweeping up all the dirty air, again, because we don't want to breathe clean air, dirty air. So it's starting to get the children thinking more about that type of element. We'll move on soon. Here we go. And again, this was with our a more involved communications campaign we're running. This was a particular group around cargo bikes. So they're looking at how they can create a film to encourage us to get more cargo bikes, consolidate our deliveries, etc. And you can see they've broken that down into quite a lot of detail. So again, our children are pretty much at the heart of a lot of this decision making, or a lot of the creativity as well. So moving on, educating some of our contractors, so working with some of our patient transport teams about idling. We did this with Global Action Plan, not idling outside the hospital, eco-driving in general. So that was all extremely positive. There's lots of angles of that. We're starting to link into the service we provide beyond the education side of things. And then hopefully we'll move on to outreach and innovation. This was a really lovely example. The previous work built our confidence to start to take more systemic actions like this. Here we closed Great Ormond Street and turned it into a playground for the day. This involved some systemic changes to how the hospital functioned, but we were able to get through all of that, and working with our security team, our sustainability and play teams, we created this environment with a racetrack, with Kaylee dancing, with all sorts of activities. We basically took a very busy, polluted and congested street and made it a playground for the children and local community for a day. So a really good example of visualizing the future. This really moves on to the infrastructural changes that the framework is allowing us to really consider. It allowed us to really visualize what this road should look like, a resource for us as opposed to a negative when people arrive at the hospital. Again, some of the children hadn't left in many months the hospital, and again it was about building the confidence for staff to bring children out and to really enjoy this space. Again, we'll be linking this into our future development plans as well. Well, we may be able to move on. Here we are, one lad. He was borderline obsession with the fire brigade and was very lucky that we had the fire brigade there. Again, it's a chance to link in as anchor institutions into our local communities. And he had a great time with the fire brigade. He'd made his own hose out of cardboard. And here we go again, engaging with the local community, looking at idling. This was volunteering with our local authority and local volunteers. Okay, measuring and monitoring. We've got measuring and monitoring equipment on the street for particulates and NO2. We'll show you a graph here. Often we're over WHO levels, but you can see on the right, the red mark is where it went when we closed the street. So really positive there. And again, it's about starting to normalize this type of data and the fact that so people start to think about air quality. Please shout me, Catherine, if I'm time-wise. So yeah, normalizing the data is absolutely key. And this moves on to the broader infrastructural place that we're getting to now through work through the framework around public realm, how important that is for our children, for our relationship with our local area. So this is Great Ormond Street on a very quiet day, I must say. But if you look from the left, poor visibility, no separate cycle paths, that poor cyclist there, people smoking there and parking on both sides. It's very congested. So we're looking at engaging staff through the framework type activity in a process of developing this and the public realm around us more broadly. So I'm going to show you the way that we're looking at doing that here. So again, we've broken it down. In the center, we have 2 lanes of traffic, a narrow path on each side, really unsatisfactory really currently for what we want, and the Play Street obviously demonstrated how that can be a whole lot better. We'll move on to this next slide here, which demonstrates if we made it one way, we would have in blue here a cycle lane with the pavement on one side, but frees up space on the other side for a barrier of planting, for other types of activity there, and a pavement as well. So this is another alternative that we're looking at and engaging staff with, again on the back of the education work that we've been doing over the last year. So potentially we'll get to the next slide shortly. This is an overview here of what it looks like from above. Very congested at the moment, lots of parking, quite an aggressive place sometimes in terms of people losing their temper. Not what we would want ideally. And then moving on to where we will want to be over the next year, we're going to be doing more activities, pop-ups, pilots, play streets, parklets. Hopefully with our local authority, we're looking at that to again test the options that are available for us, building up to our broader vision in a few years' time. We're involved in building a cancer centre on Great Ormond Street, which will change the facade and relationship with the local community, we hope very positively. But during this construction phase, 2022 to 24, it will become one way. So we'll use that opportunity to measure, monitor and trial more activities, leading our way up to, as you will see in the next slide, our vision for 2025, which is a slow, child-friendly street, wider pavements, activity opportunities there all the time, and a real asset for us with greening, with other types of activity the whole way along. So really this is how it starts to feed into this, how it starts to feed into where we are now, which is a relatively hostile, the opportunity to pilot, gain data, build interest and support leading up to 2025 with a completely transformed street, public realm, relationship and access into the local community and vice versa. So that's very exciting. Again, it taken a bit of time, but lots of engagement, and especially with our young people on that. And then finally, we will move on to the COVID situation and how that's impacted on our work. So firstly, I'll lay out that we've created a safe, sustainable, active and sustainable working group to look at commuting and staff getting into work, etc. This has created a cycle to work group, which is very supportive. We're looking at our cycling infrastructure. We're looking at, we're registering bikes, helping people repair bikes. All of this is starting to be built around that. And we're about to start an electric bike partnership as well. But this was a piece of analysis we did about where our staff live and how they commute in. Now this is going to be fun because there's lots of moving from slide to slide here, but fundamentally we analysed where all our staff were coming from in terms of their postcodes, and we broke it, we're A in the middle, and broke out into zones around the hospital from central London. We broke this down into how many different people are in these different groups. So we have A, staff have the opportunity to walk to Gosh. B, 25-minute walk maybe to Gosh, or a 15-minute bus ride. C, a 40-minute cycle ride or less. D would be above a 40-minute cycle ride, so much more committed cyclist, or the electric cycling option. E is outer London, which would be reliant on a train hub, but there's a choice of transport in from the train hub. Lots of these people sometimes were driving in during the first wave of COVID. So again, it links into trying to work with them on the next wave. And then finally, F is outside London, and how we can work with staff to get in from train hubs in a safer way, but also in a way that causes less pollution. So we're nearly there. We have employee numbers for approximately for each of these categories. So it can help us direct our messaging and direct our interventions. So for example, walking to work is fine, but if we go into group C, an easy cycle, that's 1,300 people we can work with on that. Of course, you won't have everyone, and some people won't want to cycle. Group D, again, a large amount, 1,300 employees on a longer cycle, or the electric bike option. And then E and F is again about hybrid journeys, which of course ties into our health and our well-being and our choices that we have. And just a little visualization of this, Gosh in the middle, our local train hubs here and the number of employees. So Euston, St Pancras, 605 employees would probably be coming into there. And if you broaden it out, these are 20-minute walks into work, something people don't necessarily obviously think about. And then out to the other trains here. So Liverpool Street, 212 employees, Waterloo, 112, Charing Cross and Blackfriars. So again, it's starting to get these messages out, which we're doing slowly. We're working on these at the moment and having the interventions to try and support some staff to make some other choices. Just finally, this is the geographic postcode areas that we used to break this down. Again, this is just rushing through it. And then finally, our next steps. We will be linking that work into our HR and into our health roster. So it's much more formal, so we can hopefully target our communications and activities even better. We're going to have a phased approach to that public realm transformation, building up to the Children's Cancer Centre in 2025. A phased and engaged approach to doing that, evidence-based as we go along. A major campaign of education with our clinical staff working with patients. We're going to be pushing that over the next few months as well. Supporting the local authority, Camden, around low traffic neighbourhood work that they're hoping to do around Holborn. So we're going to be giving advocacy around that and trying to involve other healthcare institutions where possible. The Clean Air Hospital framework, so dissemination of that where possible across the health sector, because really a clean air movement is necessary here. And we believe that could be one part of doing that. And generally much more collaboration around with tech, potentially with infrastructural organizations, with education organizations. We and obviously others will want to be doing that. So we hope to do that over the next year. And finally, we'll continue to be led by our children and our young people in terms of ideas, but also governance. Our strategy, new Gosh strategy, a 5-year strategy has just been released. And Great Ormond Street will have 6 guiding principles, one of which will be protecting the environment. So that's a fantastic step forward. And obviously the NHS's net zero by 2040 goal, which came out last week, which is of course hugely exciting for everyone. So we look forward to be linking in with that. That's me for the moment, Catherine. Thank you. And thank you all for your patience.
Nick, thank you so much for that presentation and for you. Oh, hang on, let me turn on my video. There we go. Thank you for your patience with the technical issues. So sorry for that. I just wanted to, we're going to take a few questions. So if anyone has questions specifically on the Clean Air Hospital framework or actions hospitals can take in terms of improving air quality around sites, please make sure you're including them on the Slido chat. I just wanted to frame the Clean Air Hospital framework in terms of some of the wider work that GAP's doing. I just wanted to flag. So we're currently doing work with the Royal Free, with Royal London, with Whipps Cross, the Whittington and UCLH on a Clean Air Hospital framework. So the idea is we'll be going into those hospitals and, well, actually we're more likely to be doing virtual workshops with them, looking at the Clean Air Hospital Framework and creating action plans for those hospitals to improve air quality around those sites. So if you're based in any of those hospitals, I'm sure you'll be finding out more. We're also going to paste in the comments box just a link to the Clean Air Hospital Framework. So if you work in a hospital and think they might be interested in finding out more, the link's there and you can download it. And the idea is it's a tool that you can, the hospital can use itself, or if you do want support, please do reach out to GAP in terms of facilitation, particularly on developing action plans. Okay, so in terms of questions, so I've got, I think one of the first ones, which you touched on a little bit, which was how are hospitals working with local councils to improve air quality outside them? So obviously you touched on street space and some of the work with Camden Council, but I don't know if you have any other kind of wider recommendations for trusts or hospitals in terms of working collaboratively with councils.
Yeah, Camden have got a great air quality team. Generally, councils may have that or a sustainability team, so link in with them, and also transport, really important to work in with them. A baptism of fire for us was the closing the street, and it gave us all an opportunity to work together with a bit of rigor around an issue that was quite administratively heavy and other things, but that worked really well, and that really has helped create the relationship. So we were looking at parking suspensions and all sorts of closing streets and things. So we've done that. Now we're looking at things like, which many local authorities will be looking to do, hopefully, is low traffic neighbourhoods and the broader piece there of supporting and advocating for that, because we know how beneficial that type of thing will be to us, to others in the area, to schools, to hospitals. So I suppose it's, yeah, for us was is a staggered approach, but they're the teams generally to work with.
Okay. We had another question earlier that was emailed in terms of for hospitals where budget is very limited, so say if that's their kind of starting point, what would you say, kind of where should they put their energy if that is a stumbling block? Well,
I think at the moment people are quite becoming more aware and mindful and concerned about these sorts of issues. We're in a point where Zoom meetings can be organised within a hospital, so you need to work with leadership. But I think we can, you can get together a session on this and have hundreds of people turning up to it. You need to think about what you want to get out of that and think about how structurally with the organisation you're going to move on. But I think you can create a lot of will, a lot of momentum for at the beginning for very little cost. Then you can start to find advocates in different areas and start to drill down on actions that need to be taken. The framework has done a lot of that for you, but there is a lot of engagement that still needs to occur. But I think you can begin by doing something like that and assessing what's going on. There's also lots of local partners that you will want to link in with as well, which is very necessarily. But you're looking at your service heads and other people like that as well. And these are things that they will be integrating into their contracts as we go forward anyway in many organisations. So again, you'll be giving them a head start.
Okay. And then linked to that, I think we kind of touched on it in my question earlier, but somebody had to kind of what has been the greatest challenge you faced in terms of engaging internally. So I know we were talking earlier about how you get everyone in the room, but are there any other challenges that you faced, that any other examples you can give to us, and how did you overcome them?
Well, we've still got an awful lot of engaging to do. We haven't engaged with everyone by any means at all, but we did engage in order to create the framework and start on these different activities. Often it begins with, I think, with focusing on particular activities that are tangible and people can get quite passionate about, and then it sort of moves on from there. But yeah, I think if you have the opportunity to just put out the fact that this is on the agenda, that's a really good start, and then get people's input as to which of the areas of focus. And I'm sure but there'll be people coming back. As I say, we have people leading on our cycling side of things, leading on going out and advocating in the local community. We've got lots of local community members doing the same. So I think it's different for every organisation, but you need to, sow the seed and have a structure there for if it takes off. But again, this isn't necessarily costing money, but it's time and it's that will. I think you've got to go in with the approach that might be there, especially if you structure it correctly, structure the way you're communicating correctly, and also involve the right people, because this needs to be done. I think organisations know that now, and it's not actually a draw on resources. It's about efficiency. COVID, it links in very, very strongly, obviously, to that from a medical perspective and a practical perspective about getting to work.
So linked to that, so we've had a point just coming in, encouraging working from home and completing virtual consultations are also a huge factor in reducing emissions. Do these play a part in the framework?
Well, definitely. A lot of these things have happened, you know, irrespective of it. Complete transformation in some regards in terms of that, and people are formulating how they feel about that. But of course, our virtual appointments have rocketed. Working from home, the same. It was very rare before, and that is working well in itself. So absolutely, and we'll be looking to how to regain that data, but how we obviously make on the well-being side that as good for everyone as possible, and just be mindful of watching that and checking that it's all going in the direction that we want in terms of care, but also in terms of staff well-being and everything else. So that's an unintended positive consequence in some way, but still needs close attention. So we'll focus on attending to it and seeing the direction that it's taken, and that it's still all on track.
Lovely. And another question in. So do most hospitals have heads of sustainability who are able to lead on the framework?
You don't need to be a head of sustainability, I don't think, to lead on it necessarily, but you do want to find an advocate, senior, higher level advocates, of course. And I think, again, this agenda is, you'll probably find one. So I wouldn't say you do. There are our Cycle to Work group, and some people are putting an awful lot of time through that and other elements of this while doing other jobs. Yes, we have built momentum, but there are people like that in all organisations who will be driven to do that. And I think, you will push it up the agenda through that. So no, I don't think you do, but it's obviously helpful. But bear in mind, my role it relates to climate, to broader sustainability, to energy, to waste. So this is one facet, but one that people are very passionate about, can really relate to. So I don't know if you do. Of course, it's helpful.
Lovely. Okay, the next comment I wanted to make, so somebody had made more of a comment than a question, but I thought we could add to it too. So somebody had said, parklets are great, let's have worklets too, sitting outside for more green space. Councillors could provide Wi-Fi, good for mental health too. So I know that was certainly, when I started at GAP, it was one of the examples given from kind of a hospital, in terms of, a quick intervention where there are spaces that were identified outside that weren't being used, and actually were really important in terms of kind of supporting mental health. I don't know if you have any reflections on that, and also any other kind of quick interventions you've seen in addition to those you've mentioned that you think had a real kind of impact at the start.
Well, yeah, the parklet, the parklets that we're looking at with Camden, it's a great thing that Camden are doing there, looking at a whole a series of parklets potentially, and we would focus that on our staff and maybe local community as well, not so much the children necessarily initially. So, and that could be a multi-use space which will evolve as we go along and see how it works. And absolutely, that could be for a bit of work, it could be for having a meeting in a different context, a more stimulating environment. It could be around particular subjects. It could be a way of consulting locally in this space. So I think we'll have we will use it with that approach, and we'll develop ideas for what works best as we go along. But I absolutely agree, that's great. We hope to have 2, and then you would have more, because it would make sense to do that. Obviously, we'd be taking up parking spaces, but potentially that's a positive as well, as long as we've worked out, what the repercussions of that are. And then in terms of other interventions, well, I mean, in terms of the sort of the ones that impact people on a deep sort of emotional level, but do involve some serious logistics, the things like the Play Street work was very much that. You had to really analyse the workings of the hospital, risks in a very serious manner, external and internal, and make sure you were confident covering all of that off. But the result, and it needs to be done properly, was a massive partnership network, a co-collaborative, a creative process, but also people, I think, impacted on a deeper level, and a visualization of what's possible. So anything like that's obviously good, and they can be done on smaller levels as well. And I'm really happy to talk to anyone about our experience, of course.
Super. Nick, thank you for answering those questions. I'm going to suggest we move on to speak to Lawrence, who's with us from the UK Health Alliance. Although Nick, I'm hoping you'll stay online just in terms of wider questions, because I'm sure you have lots of a wealth of input and knowledge on these topics. Lawrence, we were hoping that you can tell us a little bit more about the Mobilising Health Professionals project, which is kind of more focused not just on hospital sites, but actually the really important role for health professionals in terms of talking about air pollution with their patients. So I know you're going to kind of do an introduction, and then I'm going to cover a little bit of content from GAP on that too.
Yes, fabulous. Thanks, Catherine. Did you want to put up those insights as well, or in a second perhaps? I'll just start with a brief introduction to the Alliance and what the project is really quickly. So hello, I'm Lawrence. I'm from the UK Health Alliance on Climate Change, which brings together health professionals to advocate for responses to climate change that protect and promote health at the same time. And so our members include most of the medical Royal Colleges, the Royal College of Nursing, the BMA, and the two leading medical journals, the Lancet and the BMJ. And air pollution has been one of our sort of major focuses of our work. Two of our members, the RCP and the RCPCH, have recently put out reports on indoor and outdoor air pollution, and we also put out our own paper a while ago, which is a sort of policy recommendations paper. So most of our work until now has been about advocating to the UK government, for example, around the setting a net zero target and around the Environment Bill and how that could be used to improve air quality. But with this project that we've been working on with GAP, it's kind of our first foray into mobilizing health professionals, that's what it's called, and engaging with the individuals rather than with the organizations that represent them. So we think that health professionals have always had quite a big influence over people's behavior, and I think that in a time when everyone's so used to listening to health advice and realizes the importance of that, I think that influence is probably greater than it has been before. So a while ago, GAP and UK HACC, that's us, asked some of our members what they thought about the role that health professionals could play in providing advice to their patients on how to protect themselves from air pollution and how to help to reduce that problem as well. Do you want to pop up those insights, Catherine?
Yes, my very kind colleague is hopefully going to bring them up in one moment.
Fabulous. So start from the top. The first and most important one is that health professionals are willing to provide advice on air pollution. So that's obviously a good starting point. They also said that the ways that messages are communicated have to vary between professions and according to the groups that they are aimed at. And obviously, in addition to this, we've found recently that the ways that health professionals can communicate with their patients have also changed dramatically because of COVID. So in our most recent workshop, we found a lot of people suggesting that perhaps at the moment physical materials might not be the best way to do it, and face-to-face consultations aren't quite as regular as they used to be, obviously. So so we've, as Catherine will probably talk a bit about in a second, the materials that have been produced to help health professionals get these messages across are designed to be specifically aimed to certain patient groups. While those messages do need to be targeted at certain groups, and we've started with respiratory health professionals and patients and pediatric patients, it's also the evidence is also clear that air pollution damages every organ in the body and not just those that you might think. So, obviously respiratory patients are particularly vulnerable, as are children, but the evidence is clear that we need to get these messages across to everyone. and not just those people. And from the sort of experience that we've had in getting people to sign up to the workshops, we found that lots and lots of different health professionals are also keen to get involved and recognize the importance, even though it might not initially seem central to their patients' issues. They also told us that patients shouldn't be made to feel responsible for overcoming the challenge on their own. And that's probably where the rest of our work comes in, the sort of political advocacy, is we've been working for some time on campaigning for changes to legislation to the Environment Bill, which actually has at the moment been paused for about 200 days, over 200 days. And so the main change we want to get there is to strengthen the legal targets for PM 2.5 pollution, which has probably been mentioned a million times already today. But I'm going to talk in a second about how other ways that health professionals can help that to happen. And just as patients shouldn't be made to feel responsible, also health professionals the burden shouldn't be all placed on them. So they need a resource that they can refer to get extra information, but also that they can refer their own patients to. And I'm sure Catherine will talk in a second about that. And that in this project is the Clean Air Hub. And lastly, to make the biggest impact, air pollution needs to become part of professional training and development for health professionals. This is probably the trickiest item of feedback to react to, because there's always going to be a lot of competition to get anything into the medical or nursing curricula and training, and that takes a lot of time. So through this project, we're hoping to demonstrate that it can be effective to train up health professionals to advise their patients on air pollution, and thereby encourage the people who need to buy into the changes, that it is a good idea to make these changes more broadly about training. And just before I hand over to Catherine, I'll just say a few more things about other ways that health professionals could make a difference to air pollution. So firstly, we've talked about political advocacy. The UK Health Alliance on Climate Change is soon going to be launching an online advocacy platform that we intend to use to enable health professionals to urge their MPs to support changes to the Environment Bill. And so that's not quite live yet, but if you follow us on Twitter at UK Health Climate, you'll be able to find out when it is. And they can also obviously lobby their places of work to do things like taking up the Clean Air Hospital framework that's been talked about, or indeed the Green Impact for Health toolkit for GPs. Or you can join your hospital's green group or start one. There are lots. Barts has got a good one, Green at Barts it's called. And lastly, as has already been discussed, the NHS has made this big commitment to achieving net zero, which is obviously going to improve the air quality as well, associated with, and reduce the pollution associated with the NHS's activities. So if you don't know about that, you can go and read it, and even just raise awareness by sharing it with your colleagues. Catherine, I'll hand over to you.
Lawrence, thank you so much for that introduction. It's much appreciated. What I was going to do just with our remaining time is, first of all, I wanted to share a video with the group. So it's really frontline perspectives, particularly with some of the individuals who've been involved in the project that Lawrence mentioned, really sharing their experiences of why it's so important that health professionals can talk to their patients about air pollution. And then I'm just going to briefly cover some of the resources that we've created through the project and how you can get more involved. And then we'll have a little bit of chance for Q&A. So if it's all right to bring up our health sector video, please. Thank you.
I regularly see patients who are impacted by air pollution. I work within the hospital and also within GP practices looking after people with respiratory disease. Many of the patients, we can actually probably say that air pollution has contributed to their actual diagnosis of respiratory disease, such as asthma or COPD, as well as many of the patients I see, their control is exacerbated by air pollution. Many of the COPD patients may have symptoms of sputum,
increased shortness of breath, wheezing caused by air pollution, and also very similar for asthma patients as well.
I really commonly and regularly see patients who are impacted by air pollution. I regularly, on a weekly basis, diagnose patients with lung cancer who have never smoked. Much of their risk comes from air pollution.
It's very important for people with respiratory issues to receive information on air pollution so they can, for instance, understand that, for instance, when there's a spike in air pollution, what impact that may have on maybe their asthma or things like that.
So I'm really concerned that healthcare professionals, doctors, nurses, whatever, have never raised the issue of air pollution with me and with my small children. And in particular, we were living on a busy road in Brixton. My son at 10 weeks was hospitalised for 2 nights with bronchiolitis. And only much later did it occur to me that there could be a link to air pollution.
Unfortunately, I do not think that healthcare professionals have enough resources and certainly almost next to no training in discussing air pollution, both with their patients as well as their friends and colleagues and decision makers within their organisations. I got interested in this and really had to do my own research. In 6 years at medical school and now 17 years as a consultant physician, I've never once, unless I instigated the training or invited an expert speaker to come to us, have ever had any training on air pollution, despite it being something that kills 40,000 people a year across the UK.
Healthcare professionals do not have enough training and resources to support our patients with the impact of air pollution. During my training through my career as a consultant pharmacist, I have never received any training on air pollution, only what I've received through the media and from reading. I would like to see the health sector support the training and education of all healthcare professionals, but particularly with pharmacists. We should start to train our pharmacists right from undergraduate level all the way through their continuing professional development to be aware of the effects of air pollution so that all of us can support our patients in making sure they have the right facts and can avoid the effects of air pollution going forward with their disease.
Doctors are the right people now to be fronting this message. So that's what the health sector can actually do. And it will also be nice to go into a hospital where there are leaflets there about different things. And it would be nice to actually find one on air pollution and the damages it does to the public's health, because it's from the cradle to the grave.
We all believe and trust so strongly in our doctors, our nurses, our midwives, and we really need you to be telling us that we need to take care on big roads, walk on back roads, think about when to open our windows, to drive less.
When I used to take my late daughter to hospital, and I must admit, getting her to Great Ormond Street, there was lots and lots of pollution on the way there. And I think directly outside the hospital was very important, because one of the things she used to complain about was people who were smoking outside the hospital. So maybe if we look at air pollution in a similar light, if air pollution is impacting on your breathing, then you shouldn't have idling cars or ambulances right outside entrances of hospital. So maybe hospitals can show their patients they are taking air pollution seriously, and this will help in discussion with their patients.
I would very much like to see a health campaign for air pollution, very similar to what we see with stop smoking, with flu vaccination, with weight loss. All of these are very important public health messages where we need to increase the awareness to our population.
I would say in addition that as scientifically literate and caring healthcare professionals, we have a responsibility as educators and activists to get the message out there. And that has to form the basis of a public health campaign based on science and evidence.
Hello. Thank you for your patience with watching that video. We think it's really, really important to hear some of those kind of frontline voices of people describing why this is such an important issue. I'm conscious of time, so what I'm just going to briefly do is on our slides, I think if we could go to, if we can bring up the slides and I'll flick through them just to the ones I really want to make sure we cover before we close, if that's okay. While I'm just waiting for those to come up, so I guess I just wanted to first of all just to reiterate that brilliant, thank you very much. So on Clean Air Day, one of the kind of key messages that we've given throughout the day is that everybody has a role to play in terms of creating clean air, and certainly in terms of the bigger picture, we're looking to government to support, whether that's with things like the Environment Bill or ULEZ or clean air zones. We also do think there is a role for organisations, and that's why tools like the Clean Air Hospital Framework are really important, but also a role in terms of individuals and taking making sure that we're kind of making decisions linked to low pollution behaviours, whether that's trying to walk and cycle more for short journeys, whether you might be switching to an electric car. So we've certainly been looking at kind of different examples that we can be giving to patients. I just wanted to flag that the government has recognised the important role that health professionals can play in terms of supporting this movement. So this comes from the Clean Air Strategy, which was released last year, which highlighted the fact that we need to equip health professionals to play a stronger role by working with the medical and royal colleges and also the General Medical Council to embed air quality into health professionals, excuse the typo, education and training. So since that strategy came out, as kind of Lawrence introduced, we've been working on this mobilising health professionals project to try and really test messaging with different health professionals to share with their patients. There's also been the launch of the Clean Air Hub, so that's a go-to place where you can send patients to find out information about the sources of air pollution and also what patients can do to protect their health. We've also seen air pollution kind of as a priority in terms of Public Health England's new 5-year strategy. I also just wanted to flag that there was an event held yesterday which was called the Clean Air Day Health Summit, where GAP convened alongside with the UK Health Alliance key decision makers from across the health sector and environment sector to look at specifically the issue we're discussing today. And I just wanted to flag that kind of some of the kind of key report from that event hasn't been shared yet, but kind of some of the key discussion points that were coming out from those decision makers. So they were talking about the need for kind of the performance driver on sustainability, so looking at accountability linked to tackling air pollution, and the need to scale up good practice. So really, how can we look at making sure things like the Clean Air Hospital Framework and good practice across different hospitals is being shared and driving change. We also looked at the need to collaborate and learn with from the private sector on this. And also, I mean, there's certainly a very, very strong push in terms of the need for a public health campaign and looking at how we can mobilise that. I also just briefly, if it's okay, we scroll through the slides, there's just some examples of some of the resources that we've created. So with the Mobilising Health Professionals project, as flagged, it's a piloting project, but we're going to share a link in the chat bar. It may have already gone up, but we have now created a number of resources, particularly for respiratory health professionals and for child health. And that includes short leaflets and long leaflets and also posters that those health professionals can use to share in their health settings and start communicating with their patients on air pollution. And we're going to be developing an insights report from this project looking at how this could be rolled out nationally. If you would like to find out more about the project, feel free to get in touch. We'll include links, and we really want to encourage as many health professionals as possible to be involved. So please do link up and find out about what we're doing. And with a few minutes left, I just wanted to see if we have any questions from the floor. So I'll just have a little look through. Okay, so we had a question, I guess this is to Nick and Lawrence, on why do you think the health sector hasn't taken action quite in the way that we would like so far on air pollution? What's been the stumbling block? Nice big question for you there.
Yeah, I think it's certainly time to do it now. Why it hasn't been done so far, I think there's other priorities. Well, there have been perceived to be pressures, and for whatever reason, it hasn't risen to the top in terms of urgency. And maybe that's, I know public opinion is changing, but maybe that's taken a while as well, potentially. Maybe it's in some way in line with that. But I agree. Things certainly, there is a massive opportunity that needs to be taken, you know, now and quickly. And I think it probably hasn't. And that's really just needs to move on. I'm not entirely sure why.
Yeah, I don't think I've got a better answer for you, I'm afraid. I think that health professionals have been involved in lots and lots of different campaigns over the years, smoking, alcohol, all these sort of things. Perhaps air pollution is just a little bit, feels a little bit more passive. You know, it's so ingrained in everyone's life, and it's not quite such an active decision that we, you know, that just like right at the time you can tell that it's affecting your health. Maybe that's something to do with it.
It was interesting as well. I mean, I certainly have heard reflections sometimes on the projects that we've done that it just feels like too big an issue to start off with. And I think because it hasn't been included in kind of medical training to date, that health professionals kind of reflect and they didn't know where to start. So I am kind of very hopeful that some of the resources that are being created here can be a kind of real starting point, but also making sure that this is kind of integrated into training at the earliest possible moment. I'm being told that the next session is about to start, so I just want to say a massive thank you to Lawrence and Nick for your time on this session, and to all the health professionals and others who've joined today. Please do continue to engage, and as I said, we'll share all of the links. This work is ongoing, and we really want to make sure as many people from the health sector are as engaged as possible. So thank you. Bye-bye.
Thank you very much.
And I'm going to hand to Chris now for the Future of Cars session.
Thank you very much, Catherine, and right on time, perfect timing, thank you. We now have 45 minutes, which is all focused on the subject of cars, and an air quality session where we focus on cars and look at the positive role of cars, the implication of cars, the negative impacts of cars, is the subject of discussion and debate for the next 45 minutes. And I'm delighted to say that I have a fantastic panel joining me for this session to introduce the discussion we are about to have. I think we're at a turning point for cars in the UK. What does the future hold? The coronavirus and lockdown has made cycling and walking more popular than it has been for many years. But also a car is still a lifeline for a lot of people. And I personally grew up in rural Derbyshire, and now I live in the centre of London. And I've seen the varied roles that cars can play in people's lives. Recent changes that we've discovered through polling are that we know that 1 in 4 people say that they intend to use their car less after lockdown than they did before lockdown. We know that 87% of people would like cheaper and more easy access to electric cars. And we've also looked at the role of, the way that we can speed up the electrification of the family car, particularly where there are 2 car families. We think there's somewhere in the region of 5 to 6 million second cars in families that could easily be electric vehicles without any of the downsides, because those cars never do more than 50 miles a day. They have off-road parking for charging capability. And there's another car in the family that could do that holiday to Cornwall or Scotland that everyone seems to want to do now that we talk about electric vehicles. So there's a huge potential for that switch to electric vehicles. But also, do we actually need that second car? There are an increasing array of options to enable us to have a car when we need it, be that car clubs, be that ride sharing, ride hailing. There's a whole bunch of options, as well as, of course, many safer cycle routes that have been implemented in recent weeks. So we are going to explore the health and environmental imperative to shift away from internal combustion engine vehicles to zero emission transport. to talk about the role that cars will play as part of a sustainable mobility mix and what is needed to get us from where we are to a sustainable solution in terms of infrastructure, policy, and shifts in demand. So without further ado, let me introduce our panelists. I'm delighted I've got 4 panelists, so they will be doing the majority of the talking and I'll be doing far less from now on. We have with us, we'll do ladies first. We have Rosamund Kissy-Deborah, who's co-founder of the Ella Roberta Family Foundation. Also, not her first appearance of the day on Clean Air Day Live, so I hope you've been refueled, Rosamund.
I actually have, Chris, thank you.
Break, great. And also, you'll see I've got my specs on today, Rosamund, from the roundtable we had yesterday, just to keep my eye on you.
Sorry about that, I'm still apologising.
I know you always try and take me off the agenda. We also have Pippa Neal, who is one of the journalists at Air Quality News, who writes a lot for the public sector and will be able to inform us on the view of the public sector on the use of cars and the role of cars in a sustainable mobility mix. We then have James Taylor joining us, who is the General Manager at Zipcar UK, which is the UK's leading car sharing network. James is responsible for driving the growth of the UK business, raising awareness and promoting the benefits of car sharing for customers and cities alike. And finally, the 4th participant is Alex Bamberg, who is Managing Director for NG EV Solutions, and with transport today representing over 20% of all CO2 emissions worldwide. Investing in greener transport modes and developing alternative fuels are essential, and this is where NG is providing leading services on energy regeneration and electric vehicle services globally, and also is one of our partners in the Business Clean Air Task Force here in the UK. So welcome all of you, and I'm going to start with a grounding question first, and I'll also come to both Pippa and Rosamund first on this as well. What are the environmental and health impacts of cars in the UK? What part of the problem of air pollution do they cause? Are they to blame for all of our ills? Pippa, maybe you could kick us off first.
Yeah, so as probably has been, you already understand from today's events, but cars are responsible predominantly for particulate matter and nitrogen oxide pollution, which are some of the most harmful pollutants to public health through the vehicle exhaust. But also you have the air pollution from the tyre dust pollution, which is when the tyre comes into contact with the road and the friction causes tyre dust pollution. Which is also extremely harmful to human health. So that means that even electric vehicles are responsible for some level of pollution, but obviously diesel and petrol cars are the kind of main culprit in this conversation. And exposure to these pollutants leads to kind of a huge range of health issues, from stunted lung growth in children to, as we've seen today in the media, impacting memory in children, to heart disease, asthma, and yeah, in the midst of a respiratory pandemic, kind of it's never been more important to raise awareness of the impact that vehicles are having on these pollutants that are so damaging to our health.
Thank you. And Rosamund, you've experienced the harm that pollution can do firsthand. What are your thoughts on the role that cars play, and perhaps the shift in perception you would like to see at a national and an individual family level?
I think it's really difficult because to try and get one's head round that when you're in a car, which you feel safe, the air you are breathing in is actually worse. And I remember speaking to a group of young people. I went to do a talk in Scouts. And when I said that to them, they actually looked at me strange and thinking, really? So I then said to them, okay, just stay with me here. Imagine if I drove a car, the door is shut and I drive it into the sea, what would happen? And then they went, oh my God, the water would get in. So I think we see our car as a safety net. And the reason why I don't blame people, Chris, is every night, I have monitored this for ages, there are still car adverts making people want them. Seriously, everyone should look, whether it's on the radio, television, and advertising, we know, is very powerful. And then in the one breath, you will hear the government say a green economy, and yet they will say, we are building roads again. So which one is it? The reason why I don't blame the public is I feel as if we have been made to want cars, even if, you know, it is there, it is always there, watching football matches, there are adverts for it. So there will need to be a complete culture change. And what the British public do not react well to is if you're telling them to do something, as we all know, they will really, so we need to provide alternatives to them and make it easier. And whenever I talk about this, someone from a rural area will no doubt contact me and say, the bus is here, they come once an hour, or where I am, I need a car to drive. So I think we can only put the information out there of how carcinogenic they are, and people would need to, you know, make a choice. And governments also, they need to incentivize people. So electric cars, let's be honest, they are very expensive. They are not the answer, the only thing, but a lot of people cannot afford them at the prices they are. People do want to make a change, and I still see more people now walking and cycling still since the pandemic, definitely. And I think people generally want to breathe clean air, but how we get there is more problematic. And especially with COVID as well now, people are very nervous about going on public transport, especially the underground. So it's going to take, it is going to take time, but I do believe we will get there, and it is up to us to tell people about the impact of air pollution on health, because I still think people don't know. I think we are in our nice little bubble that we all know, and we think everybody out there knows. I don't think so. You know, not everyone reads The Guardian every day to see all the studies. And that is the honest truth. People are just trying to survive. And I've heard cab drivers saying we need to make a living and things like that. So people just don't look at it, Chris. But generally, do people want clean air? Yes, they do. And it's about how we get there. We need to take everybody with us.
I think you're right, Rosamond. The stats are very clear. People are agreed that a clean air future would be better, and they want to see action from business and from government, even more strongly after lockdown than before lockdown. But at the same time, you are right that we are bombarded by messages that it is vital that we have a car in our life that we own, that's ours, and perhaps we have one each. And so we will, in a second, get to looking at some of the solutions of how we could have shared mobility as good part of this mix. And just before I come to you, Alex and James, we're going to share a video which is bringing the youth perspective to this conversation. I think the statistics on the number of young people taking their driving test and the number of young people who aspire to own a car is very different to the way it was when I was 17 and when I started to learn to drive. So we're going to hear now from Sabrina Tucker, who is one of our Global Action Plan youth panel members, and she's going to share her thoughts and experiences on cars for the next generation.
Hi, I'm Sabrina and I am 21. I do actually own a car. However, it was when I used to live in the middle of a field in the countryside, quite literally, and there was no transport options around. I do think that if we want to move away from cars, that is a really important issue that we need to focus on, because transport links in the countryside are just really bad at the moment. You know, trains are good, but in terms of moving around within the countryside, it's just not so good. I really wanted an electric vehicle, but at the same time, we really, again, don't have, at the time, we didn't have any electric charging points near us. I do think that there's one or two that has popped up since I've got my car, but at the time there was absolutely nothing, and it just wouldn't have been viable for me to get an electric vehicle. I think if I ever were to buy a car again, it would definitely be electric. I would refuse to buy anything else. But now that I live in London, I just don't need my car. In fact, if anything, it's just sort of taking money out the bank. and it's something I would only bring into London if I were to use it on a car sharing app, which is something I have considered. But at the same time, you know, there's just no need for it to be here. I just don't need it in London, and I just don't see why young people who didn't live in the middle of nowhere would buy a car, and most of them aren't. So yeah.
Fantastic, thank you. And that leads us on nicely, as Sabrina mentioned, the issue of money and the possibility that we could have a mobility solution in the future where the main cost that we spend isn't the car that we own and that sits on the drive depreciating, that we insure, that we're worried about it getting stolen, etc. So I'm going to come to Alex now to look at what new models there are. What are the ways that we can still have that mobility with a car when we need it, to have it perhaps owned in a different way, and perhaps also fueled in a different way, which causes less pollution. Alex, what do you think the solutions are?
Well, the current climate has obviously brought a lot of the education into people's houses and onto the TV, and I think it's provided a lot of good educational awareness, which actually wasn't there before. So COVID, if there's a silver lining, this is one of them. I think the solutions, there's no single silver bullet. There are several solutions that can be brought to the party, and indeed are being brought to the party, but it's also about time. So 4 or 5 years ago, the electric vehicle was emerging into a sort of usable solution, but it's still, what came with it was a bunch of apologies around range, infrastructure to get these things charged up, etc. And against, frankly, about internal combustion engines, which have had a long life and they're at the end of their life, but at this point, they're a very refined solution from a user experience perspective. And so what we've got now is this new educational piece about climate and about air quality. These are two different problems driven by two different sets of emissions, if you like. And they are, if you improve one set of emissions that might help air quality, certainly in urban areas, it actually counteracts and makes it worse for the climate and environmental problems. So for that reason, diesel, petrol have a shorter life now than they ever did. And this is obviously determining on companies like Volkswagen that are spending literally 35 billion euros developing their range of vehicles to transition away from the diesel and petrol vehicles. The options for the emissions average in the UK is this mix of public transport. You've got car sharing, which is a key element and proving to be very popular. You've got the very disruptive side of sort of the Uber and the electric taxi scenarios coming forwards. And now you've got emerging over the last 18 months really is a no apologies electric vehicle solution in range and usability, and the infrastructure is being reinforced all the time. So the landscape is becoming much easier to transition to a lower carbon solution. The electric vehicle in itself has many advantages. I mean, essentially, even if you powered it by a dirty generating system, coal, for example, the vehicle per kilometre is essentially 80% more efficient simply because the electric motor is that more efficient per kilometre than an internal combustion engine with all its frictional losses and everything else. So when you then start to power it with renewables, you begin to approach the holy grail of getting from A to B. But nevertheless, as pointed out earlier by Rosamund, you've got this area of other pollution. So it never will become a totally zero solution with zero liabilities. But it's a very good start. And that, the EV and hydrogen will grow. Batteries are outstripping the developments in hydrogen by a long way. Density in the batteries has doubled nearly in the last 6 years. The cost is nearly halved. So then you're getting this price point of vehicles which become more reachable for the masses. And then you've got, by natural organic growth, you've got the used car market where beginning to see a huge growth in electric used vehicles. And those price points are becoming much easier for the young and indeed other low, middle, and even higher income families to be able to not only convert their second car if they had one into EV, but which I agreed with your first statement. I mean, there is absolutely no reason why second cars could not be electric at this time. But you know, if you are a two-car family, both cars now could be electric, and if they're powered by renewable energy, this is exactly where we want to be. And I think the government are trying to fund the capital cost and help people out there on that original purchase, and they are indeed supporting through lower tax, road tax and things like that to help that purchase element and encourage them away from an internal combustion engine. And a lot of this persuasion is about the culture. We have to explain to people to stop your existing habit and look at the other alternatives. It's a different way. You leave your house, if you've got an off-road parking solution, you leave your house fully fueled with green energy potentially, and then you could, for 80 or 90% of your journeys, you never have to divert to a fuel station or a charger. You can do this all from home. This is extremely convenient, so this is a very big plus. When you do take the vehicles on a longer trip, which is definitely where they begin to really show benefit en masse against the internal combustion engine, you know, the public infrastructure and the speed of charging vehicles is dropping dramatically. This is changing every quarter, every 3 or 4 months. You see definite technology steps in the performance of these vehicles, and therefore the convenience of charging a car, how you get the information to charge your car, whether it appears on your phone, through the car, sat nav, and all those linked interoperable solutions that are beginning to mature from a you could say a fairly bad start. It was very fragmented, lots of different networks, different pricing modules, quite difficult to understand. But this is all, the learning curve is coming through, and we're beginning to see a lot of benefits.
I really like that phrase, Alex, a no apologies EV solution, that we're getting to this point now where we don't have to say, oh, please give it a try, don't worry about this bit. They are now becoming a really desired item out there. And in fact, it's quite difficult to get your hands on them. And we're going to come on to a question about that shortly. But I'm going to turn to you, James. You have the goal of being fully electric by 2025 with your fleet. And so I'd like to hear about that a bit more, but I'd also just like to hear more about the other side of this conversation on just how many cars do we need? We've talked about converting the cars we have to being electric cars, but should it be one for one? Should we be trying to turn the 30 odd million cars we have on the road at the moment all into being electric cars, or should we try and have 25 million cars on the road? What's your view, and any numbers you could give us would be fantastic.
Yeah, sure. I actually got just a short video to start with, which actually is just a little testimonial from one of our members that actually gave up their private car and moved to shared car.
I am Philippa G, founder of Fatty's Organic Spirits. So I'm a multi-award-winning spirits brand, which is 100% organic. So when I started my business, I sold my car, which at the time was a no-brainer. Why wouldn't you sell your car to start a business? And then I realised how quickly I needed a car for my business. I'd always try and use the electric vehicles, especially because it aligns so well with my ethos as a company.
It's just sort of really useful to kind of give an example of how, you know, our members are making that shift from a private car to a shared car. Because I think, you know, like you said at the start, Chris, you know, it's not just about replacing all the vehicles we've got now with electric cars. And I think that's always been part of our ethos at Zipcar. You know, we've been around as an organisation for, I think, over almost 20 years now. And what we've shown over that time from our research is that, you know, we help to break that link with a private car. So moving people away from the private car to shared car. And when you break that link with a private car, you then start to see other behavioural changes and other benefits on the back of that. So we know that our members walk, cycle and use public transport more than the typical Londoner, for example. So it's always been at the heart of what we're doing at Zipcar, but we wanted to do more of that. And as you said, 2 years ago, we set out a vision to be fully electric by 2025. And the first step that we made towards that was introducing 325 e-Golfs into our fleet. I guess when we first did that, you don't know what the response to members is going to be like, and actually looking back now 2 years on, it's really encouraging to see that the response has been really impressive. We've had over 54,000 members that have driven electric with us. They've driven over 3 million zero-emission tailpipe miles with us and taken nearly 500,000 trips with us. If you consider within that, if you look at the registered battery electric vehicles in the UK, there's currently around 140,000 of them. So to bring 54,000 additional people driving EV on top of that, it's a real boost to people that we're introducing EVs to. So there's clearly an appetite there. There's clearly people want to drive EV. It's our most popular vehicle in our fleet. And what we're also doing is we're making access to that affordable for all. So a couple of people have said already that the cost of EVs can be prohibitive for some people. What we do is make it accessible, we make it affordable. So give more people a chance to drive EV. But this is just the first step in our journey towards that vision. We want to have more EVs in our fleet. And that's where we need to have that investment in the infrastructure, working with authorities across the UK, but also here in London, to continue to grow car share. And it's still, if you look kind of UK wide, it's still a relatively niche solution. We're really proud to have over 400,000 members now, but UK wide, we've still not hit 1 million car share members. And to consider that against the whole of the UK population, there's still a huge amount of growth that we can deliver and move people away from that private car, because that for me is the fundamental link we have to break. And we all said it's about, as Rosamund said, it's about changing that behaviour, and it's not something that happens overnight. But giving people an alternative for those times where they need to take a car, and we have to recognise that there will be times where we need a car. It's not that all cars are bad, it's just the inefficient use of cars and all those private vehicles on our road, clogging up our roadside. Let's kind of get rid of those and move towards car sharing and get people to change their behaviour.
Thanks, James. You gave us one fantastic number there of 400,000 members. How many cars do you have? How many cars are they sort of sharing between them, between the 400,000 members, instead of having one each?
Yeah, so we've got just over 3,000 vehicles in our fleet. So, if you think of all the studies that have been done, so for every car share vehicle in a fleet can take anything up to 13 private vehicles off the road. That's a significant number of vehicles that have been removed from our streets. And once you take those away, you then free up space for other use of that public realm, whether it's cycling or public space to kind of sit and engage with people. There's lots of different ways you can use that space that's currently used as a giant car park.
Thank you very much. Now we're going to have a second video contribution from another of members of our youth panel, from Megan Blythe, who's going to share her thoughts, particularly around the financial challenges of car access as a young person.
Hi, my name is Megan. I'm 26 and I actually do own a car. It got given to me about 5 years ago at uni by my mum, secondhand, and that's pretty much the only reason why I have it. I don't think I would have ever bought a car. I call it my poisoned chalice because it has drained me financially, and more recently I can't really justify having it financially and environmentally. So I have entered into a car share agreement with one of my friends as she needs it for work. I've always lived in cities, and I don't think, being my age and living in a city, I do need to have a car. It's just a really nice thing to have, to be able to kind of get around and get out of the city and go into the countryside. I would really like to see more and more car club options become affordable for young people. At the moment, it's still more affordable for me to have my car to be able to get away out of the city rather than use a car club. So I would like to see that become more affordable in the future. Eventually, when my car dies, I probably won't be getting another car. I don't really want to have it, and I hopefully one day will be able to afford an electric vehicle. I do think electric vehicles are the future of car transport, and as much as we need to reduce our car usage, there are some people that will still need to get around in their cars for family purposes, but also if they are living in a kind of a rural area and they need to travel to work and things like that. So I would like to see more EVs become affordable for people. and also hope that the transition to EVs is met with a cleaner, renewable energy generation as well, so that we can have a more sustainable future. Yeah, thank you very much.
Great, thank you, Megan. And it might have been my end. I had a few sound issues there with the video, but you might not have caught Megan calling it a poison chalice, the car ownership, and how she probably won't renew when her car dies, and is looking for her own spontaneous ways of car sharing with that car that she has, and sharing it with her friends who also want to access a car. Pippa, let me bring you in here. What have you picked up recently about what consumers want, and particularly young people, and how they could be helped to access vehicles for the times they need them?
I think, of course, electric vehicles is a huge solution to the air pollution problem, but I think we also need more emphasis on making active travel safer, not just in cities, but also in the countryside, with more cycle lanes and wider cycle lanes, and making it easier for parents and children to be able to walk to school, or cycle or scoot, or however, not in a car. And I think that's the view that I'm getting from the public, is that is what people want. People want to be able to just get up in the morning and walk, like this idea of 15-minute neighborhoods where everything you have is within a close proximity. So you don't really need a car except from, when you do want to leave the city or travel on the weekends, for which case you can hire a car or you be part of a car club. And I think really, this is so important, is that we need to create more space for active travel. Currently in London, on-street car parking takes up 1,400 hectares of land. So that's the same as 10 Hyde Parks. And when you think about that, it's crazy, and there should be this space needs to be redistributed and repurposed so that there is more space for active travel. And I think, as Rosamond was saying earlier this year with the Climate Citizens Assembly, they called for a ban on adverts on SUVs. And I think that is something that is really important, because the growth in SUVs threatens to kind of outweigh the benefits that we're getting from an increasing EV market. So I think it's really important that, either they're banned completely, or banning adverts to kind of disincentivize people from feeling like they need this bigger, more powerful car, and instead encourage people to encourage and make it easier and safer for people to get around with active travel. And then on the days that they do need a car, then they have access to a car club. I think that's the most important things, really.
Well, I'm entirely with you on the review of advertising of cars in the country, and maybe taking a leaf out of the book of how we think about advertising cigarettes. And the study that we've been a part of over the summer with some school children doing an audit of car company advertising is that they found that 3/4 of car company advertising is still internal combustion engine vehicles. And that's been fueling the rise in SUVs in particular, which have increased from about 20 to about 40% of market share in the UK over the last 10 years. So I'm all for a more honest conversation with members of the public about what we want to drive and how we want to get around. And Rosamond, that brings me back to you. You're very persuasive, and I know you do a lot of work with young people. So thinking about that conversation with young people, and not everyone can necessarily sort of walk or bike or cycle everywhere. How would you speak one-to-one with young people to convince them that that holy grail of a car, their very own car, is not necessarily the lovely ideal that it might seem?
You must have a secret microphone there, because I was just speaking to Hella's best friend, who is 16 now, and I was just having this conversation with him this very second. That's who walked past in the background. And that was one of the things I actually asked him. Is he going to have a car in future? And if so, why? and does he need it? So it's not me putting ideas into his head. Does he need it? He mentioned to me the safety aspect of things, which is really interesting. And I think it's because of where we live. See, if you live somewhere where you've got the underground, you've got trams, you've got all sorts of things, then you do have a choice. But where I am right now is en route to Bromley, and you don't have much of a choice. And I keep on saying this, and I must sound like a broken record. I am amazed at the amount of young people, teenagers, who don't cycle in this country at all. And until you get segregated cycle lanes, and I think there needs to be a culture shift. So in schools, I think from year 4, you have swimming lessons. I can't see why they can't split it in 2. You can have cycling lessons. And it's really interesting. I was just asking him, do you need a car? And I still think there's that thing whereby it's like a rite of passage. You do your driving theory test, you do your test, and then you just own a car. Whether you need it or not is debatable. And I also do say, Chris, as long as a car is cheaper than public transport, then you are always going to get people who go into cars, because public transport is incredibly expensive for a lot of people. And therefore, I think we need to base that in mind. And maybe we need to tell young people that you can get around another way and not just a car. But I do think that really does depend where you live. If you live somewhere where public transport is in abundance, then that's okay. And I am reminded when I come on these things, someone will email me from a rural place and say, we can't get about unless we do have a car. But we need to show young people there is an alternative. And I think one of that will be to be building cycle lanes for them, to show that we do care about you. This is about your health. And I think I do that in my daughter's memory, because she was absolutely passionate, despite how ill she was. She was a passionate cyclist, and she's passed that on to her younger siblings. And they cycle because they actually want to, they enjoy it. And yes, it is very dangerous where we are. So look, a lot of parents don't want to be in a situation that the moment their kids go out, then you have that awful feeling in your stomach. You are worried they are going to be hit by something. And I think in general also, drivers need to be a bit more patient with cyclists as well. Road rage and things like that doesn't help. But I think an education is to be had with young people to show them the alternatives. They are passionate about the planet anyway. So it's an easy win. I just told him right now he doesn't need a car, and he's accepted that from me. So he won't be getting one.
Great. Well, let's hope he takes that message out to all his friends as well. We've had a few questions come in, and a couple are particularly directed towards one towards James and one towards Alex. So Alex, I'll come to you first. We have actually 2 connected questions. One is from someone who is in a UK city and would like access to a car with a budget of approximately 15k, but is in a flat and can't install a charge point, really wants an EV though. What might be the solutions there, Alex? And the second part of the question for you is about what the public can do to increase availability of EVs. One thing we often find is that it's much easier to go and buy a diesel than it is to buy an EV, shorter waiting times, for example. What do members of the public need to do to switch that around? Do they need to be writing to the chief execs? Or do they need to, of the car companies, and saying we want more EVs, or walking into the dealerships and looking disappointed when they can't get an EV? What do they need to do to try and accelerate the availability of EVs?
Yeah, so on the first question, so charging if you don't have the ability to park off-road by your house, that is at the moment a disadvantage, but it's not an impossible disadvantage. I mean, first of all, the benefits of charging at home is there's a significant advantage of cost to start with. So, if you're paying 13 to 15 pence a kilowatt at home, you're virtually at a 10 or 15% cost against petrol or diesel, very broadly at home on fuel, which is very, very significant and hard to ignore. when you go to the public charging side, where somebody's had to invest, you know, upwards of 30, 40, 50,000 pounds to put a big charger in, to charge your car within 20 minutes, half an hour, that public charging, there is a burden of cost, clearly, because there is at the end of the day, there's an investment return to be made on that investment of putting those chargers in the ground. The government is helping with that, but in my view, it's not enough, because at the end of the day, the underground cost of grid connections and the grid reinforcement required comes at a high price, and that is ultimately passed on to the users. That said, you get to a point where the electric cost at a public charger is probably 50 to 60% of a diesel or petrol vehicle. So there's still very, very significant savings to be had. And the other balancing problem is that the capital cost of the car, a typically similar sized car, tends to be more on EV. So, but at the end of the day, some of the bottleneck for this is the manufacturers. They are trying to build and transition these cars to EVs as quickly as possible, but without doubt, the bottleneck is the amount of good EVs and their availability. There are significant waiting times for the more popular models, and the popular models tend to be higher range, lower cost, and those ones you're waiting quite a long time at the moment to receive your vehicle.
What do you think we should do about that, Alex? What should a member of the public do? Have we got any sway?
Well, don't buy diesel and petrol. I think that's clearly one answer, because the manufacturers at the end of the day have to respond to supply and demand, and they employ many people in the UK and around the world. So at the end of the day, there's an employment issue. There's a part supply chain issue, and all that historically has been very much loaded towards the internal combustion engine, and you can't just turn that off in 24 hours. So there's a transitional period required from the sort of commerce and commercial side of it, and while we transition to a bigger parts bin, a bigger supply chain, and the ability to ramp up production and volume, which with that comes a lower price of the product to the consumer. So the government can help by funding reinforcement of the grid for charging manufacturers and network operators, and indeed help those and heavily tax liquid fossil fuel vehicles, and be slightly more lenient towards an EV. And I think we need to get past the plug-in hybrid and the hybrid piece. That's definitely a stepping stone technology. Those compromises, although they have good drivability, they are very much, from an environmental impact, they don't actually tick many boxes at all. So, no. And that is a problem, and that's where we talk about the advertising and stuff. There's definitely some inaccuracies, genuine inaccuracies on the hybrid advertising, which can be very misleading to people that aren't in the know. And so I think it's a minefield of, miles per gallon versus, miles per kilowatt, what's a kilowatt? So there's a lot of education going on. I think I answered some of the questions anyway.
Thank you, Alex. You did, and I think one very concrete thing we could all do is ask our local members of parliament, ask those who represent us in government to do just that, to set the market so that car companies will fare better if they sell more electric vehicles and fewer diesel vehicles. And James, I'm going to come, we've actually only got 3 minutes left already. How time has flown by, but James, I'm going to come to you with the final question that we're going to have time to squeeze in, which is about normalizing this car sharing. We've heard on the video young people saying, yes, access to a car, but not really wanting all the ramifications of owning it. And I'm not sure you shared with us last time in your first contribution about the costs of the cost variance between owning one or having one when you need it. How do we normalize this seemingly very sensible way of having the use of a car?
Yeah, I mean, it's a really good question. We need to increase the visibility of car sharing, and we all have a role to play in that. Zipcar has a key role to play in that. We know from our members that one of the key reasons that got them to join is that they see one of our vehicles on the road. So having more car sharing around will naturally grow the sector more. And so that's for cities and authorities to look at how they can encourage more operators to come into their towns and cities, whether that's through incentives. So, cheaper parking permit rates, preferential, so there's actually incentives for operators to come to a location, but also incentives for users to make that switch to car sharing as well. On the cost point, we did some analysis earlier this year, and what we found was that for a similar car and a kind of similar use, car sharing members save over £2,000 a year compared to private car ownership. Because I guess one of the key things in car sharing is you don't have all that hassle and cost that you have with ownership. So the insurance, the fuel, the parking costs, all those are covered by car sharing providers. So there's a cost saving that people can make by moving to car sharing, but also generally as a sector we need to be stepping up even more to kind of grow car sharing, to make it more visible, make it more accessible, to make more people aware of car sharing and the benefits of it.
One very final last point, James, a question about operating these in villages. Are you able to make that work yet? Does the financial model work for you?
So currently for Zipcar, we're an urban solution, and there's still a long way to go to grow the benefits and car sharing within our cities. So I think that's where our primary, certainly from Zipcars, that's where our primary focus is. But there's lots of different types of car sharing. So we are just one type. We've got peer-to-peer, community car sharing. There's lots of different models that will be right for different locations. And I think that's where the operators and the authorities can come together to find a solution that works for the local needs.
Thank you very much, James, and thank you everyone who's contributed today, both on the panel and those submitting questions. Thank you, Pippa, thank you, Alex, thank you, Rosamond, thank you, James. And as I hand over to our final webinar session of the day, I just wanted to share the words of our current Transport Minister, Grant Shapps, which were written in the foreword to the Decarbonisation of Transport strategy. And I think this is a watershed moment. Minister Shapps wrote, "Public transport and active travel will be the natural first choice for our daily activities. We will use our cars less and be able to rely on a convenient, cost-effective and coherent public transport network. And from motorcycles to HGVs, all road vehicles will be zero emission." So that's the published vision of the government. And now is the time for all of us to lean in to that vision and play our own part in bringing it about. So thank you everyone for that fantastic conversation. And now I'm going to hand over to our final session of the day.
Thank you very much, Chris. And welcome everybody to this Clean Air Workplaces for Healthier Employees panel discussion. I am Larissa Lockwood, Director of Clean Air at Global Action Plan, and I'll be chairing this afternoon's session. And I'm delighted to welcome our panel. We've got Mark Grayston, the Head of Product Marketing for Mitsubishi Electric. Maybe you just want to give a wave when I say your name. Alexander Provins, Director EMEA at Blue Air, a Unilever company. William Burrows, Area Manager at Zenda Clean Air Solutions. Graham Peterson, founder of Greener Jobs Alliance, and Andy Haig, the Senior Sustainability Manager at Canary Wharf Group. So welcome all, and thank you very much for joining us at Clean Air Day Live. I'd like to imagine that we're all sitting on sofas at this point in the day to have a relaxed but informed discussion about workplace air quality, but COVID isn't going to let us do that. And in this COVID era, the workplace is also changing, and we're all becoming much more conscious of the air that we're breathing. And it's good to think about the air we're breathing indoors, not just because of infection control, but because we spend 90% of our time indoors, and because we know that air pollution outside gets inside our buildings, and there it can more easily build up than outside where air pollution dissipates. And indoors, we also use a variety of products and materials that contribute additional pollutants to the indoor air with the potential to create quite a toxic mix. So as employees, we need to ask questions, and as employers, we need to take responsibility and improve the air that staff are breathing. Because not only is it bad for people's health, as you well know, air pollution causes heart and lung diseases, but it's also bad for business. For if people are ill, they're going to be off work or working below their potential, which ultimately affects the bottom line. And the CBI put some figures on this recently and calculated that if the UK met World Health Organization standards for air pollution, we could gain 3 million working days a year, and that would benefit the UK economy to the tune of 1.6 billion each year. So that is the size of the prize. And with that, let's start the discussion by understanding the problem in more detail before we go into some solutions. So William, let's start with you. Tell us what the issue is in the manufacturing sector that Zehnder Clean Air Solutions are trying to address. What are the causes of poor air quality and the impacts in the industrial workplace?
Thank you, Larissa. That's a good question. So, I mean, from our perspective at Zehnder, I mean, we work with a diverse range of businesses in the manufacturing and the logistics industry. I mean, looking at it, all of these businesses differ in processes, but they all have one commonality. And what that is at a certain point in the process, they produce dust and fumes, okay? Now, these dust and fumes can become excessive and impact health, as we all know. Now, what they tend to do is they lead, I mean, if we look at the exposure, the repeated exposure, the number of hours people are working, the number of days, and the number of years they're in that environment, that leads to a range of health implications that, I mean, it ranges from a spectrum. So if we take the bottom end of that spectrum, and I'll give you a term called black nose syndrome, right? I don't know if you've heard of that, but it's just a coating of dust that's inside the nose. And at the end of the day, if you sneeze or use a tissue, you can see the evidence that's right in front of your face. So following on from that, that's the bottom end of the spectrum. Following on from that, you have some of the more serious health implications, which would be workplace asthma, COPD, silicosis, and obviously the big one, which would be lung cancer. Now, in these businesses, everybody is aware of the health risks, right? But what we tend to find is the business don't recognize the impact the poor air quality actually has on the business itself. So, I mean, we can all look at the human cost and tick that box and know what the health reasons are, but there's an economic cost to that business. And these companies actually tell us. So when we go and see them, they actually tell us what's going on. And whether that be, I mean, sickness, absenteeism, whether it be the difficulty in actually retaining staff, just because of the working environment. And even if their wells and their exposure levels are all within the limits, staff will still say it's sometimes a poor place to work. So, I mean, as a cost to the business and the health side, you can see both ends of the spectrum, but both of them will have an impact going forward as a country and how we are in business.
Fascinating. Thank you all.
Thank you.
And another work environment that many of us are familiar with is the office environment, which might not strike us immediately as being particularly polluted, especially in comparison to some of those factories and industrial settings you're talking about, William. But Mark, tell us what the air pollution issue is in the office. What is the problem that Mitsubishi Electric are concerned about?
So in the office, it's about choice. So a normal adult human being breathes around 7 to 8 litres of air every minute. And compared to everything else that we sort of consume by volume, air is considerably higher than, for example, food and air. And we tend to have a choice about what we put in our mouths with food and drink. And admittedly, we don't absorb all of the air that we breathe in, but the figures are still worth thinking about. So when it comes to breathing in air in an office space, the awareness and choice tends to be less prominent, where in an office, the sort of one of the main considerations is about lots of people being together for a prolonged period of time, attempting to be as productive as possible whilst being in that space. And air quality can often be 2 to 5 times worse than it is outside. And the pollutants sort of within have a detrimental effect on productivity, health and well-being in those spaces. And in a sort of office environment, the kind of the main detrimental causes of poor air quality are sort of particulate matter, VOCs, volatile organic compounds, ozone and carbon dioxide. So particulate matter, very small particles that become suspended in the air, such as things generated from combustion or from brakes on cars. VOCs from different products being used in offices, such as paint, cleaning supplies, office furniture, photocopiers. Ozone, again, is created as part of commercial photocopiers. And as well, CO2, another key pollutant within these spaces, is generated by ourselves. And we naturally use this. And you know, that potted plant that we tend to have on the windowsill might not be quite cutting it in terms of cutting that down. And to sort of, I suppose, just summarize that is the kind of effects from an office worker point of view is nicely summarized by a study that Harvard did. And they took knowledge workers, managers, architects, and designers, and they spent 6 days working 9 till 5 where the air quality was controlled. And the participants were blind to the conditions. And at the end of each day, the workers' decision-making performance was tested using a standard cognitive function test. And it was found that breathing better air led to significantly better decision-making performance. And they saw higher test scores across 9 cognitive function domains when they're exposed to increased ventilation rates, lower level of chemicals, and lower CO2. With the biggest improvements on workers being around when they're making strategic decisions and how they plan, stay prepared, and strategize during crisis situations. So in an office environment, indoor air quality really does have a huge impact on the effect of the people within.
Fascinating. And yeah, if people knew more about that, I think they'd be paying a lot more attention. So thank you for sharing that, Mark. Now, those of us who were familiar with the office environment are finding we're spending quite a bit more time in a different and unusual work environment, that of the home office, and yeah, not the government department. And while we will no doubt go back to the office at some point in the future, it does seem that the trend is towards increased home working, at least for part of the week. So at the height of lockdown, about 40% of the UK population was at least attempting to work from home. And of that 40%, the vast majority would like to keep doing so to some extent. So Alexander, tell us what we need to think about with regards to air pollution in our home offices. Is it a problem, and where is the pollution coming from?
Yes, hello and thank you. So, I mean, the indoor air at home is made up of concentration of particles from the outdoor air, like, for example, exhaust fumes, road particles, pollen, to mention a few. And these comes in through ventilation and windows, and they get mixed with pollutants from within the home and also get trapped within the home. So you have others like dust, mold, smoke from, example, wood burning or candlelights, bacteria, viruses, pet danger. And breathing in these fine dust particles like the PM, the smallest one like the PM1 and the PM 2.5 can penetrate deep into lungs. And you, of course, have talked about this a lot throughout the day. But it causes a lot of, you know, direct and indirect types of conditions. And it's the same with the home and work environment and the air quality at home. And of course, you also, like the study at Harvard just mentioned, you feel unfocused and you get tired when you don't have good air quality, and you get less productive. But also, bad air quality also increases the likeliness of catching diseases that is spread airborne, like a seasonal flu, but also like the COVID-19 is recognized to be spread by the air. For example, in the US, the CDC, they also recommend some weeks ago air purifier as a protective measure to take at home and indoors. And we can come back to that a little bit later if you want, on how that can be effective at home.
Yes, I would like to come back to that later on, because we've had some COVID related questions as well, because I know it's quite a hot topic at the moment. So thank you, Alexander. And the home is, I'd expect, quite an unregulated work environment. But Graham, as founder of the Greener Jobs Alliance, you know a lot more about this than I do. So what's your perspective on the situation regarding indoor air pollution regulations in all these settings? In the home, in the office, and in the industrial workplace? What are the trade unions concerned about right now in terms of conditions and standards when it comes to air quality?
Thanks, Larissa. And yeah, if you can hear me okay, thanks for the invitation to this panel, and interesting to hear the views of the other panelists, because it certainly underlines what the Greener Jobs Alliance has been saying for some time now, and that is that this is an occupational health issue. The reason why we set up with the Hazards Campaign an organisation called the Trade Union Clean Air Network was because we felt that if you looked at government policy and even local authority policies, there was actually a complete lack of recognition of this issue. And given that most air pollution is related in some way to work activities, it just seemed a huge gap in terms of the policy framework on this. So one of the main things that we've been looking at is what the current state of play is as far as regulations, legislation, as it affects the workplace, applies to this hazard. And our view is that certainly improvements need to be made both in the content of the law at work, but also the enforcement side as well, because it's no good simply just having decent laws protecting workers from air pollution risks if they're not enforced at the workplace. And I suppose the final point I'd make on that in this contribution is that we'd hope also that companies would recognise that there is a resource inside the workplace to help deal with that, and that is the trade union where it's recognised, because many of these trade unions will have safety representatives, and obviously safety reps will be concerned about the occupational health of their members, and we'd like to think that companies and unions will be able to work together around this issue to try and ensure that effective control measures are put in place.
Super, and great to hear that this is something that the unions are looking at. So tell me, as we move into the more solutions part of the discussion, what is it that the unions are calling for on this?
Well, we're calling for something in the Environment Bill that's been kind of like put on hold for the moment. It's over 200 days since it was first introduced, but when we eventually see it again, we're looking for improved standards around air quality, and ideally even something that also references the workplace, because obviously outdoor workers do have a degree of protection as a result of European directives. But the standards that actually exist still aren't good enough. So we would certainly argue that we would want World Health Organization standards on particulate matter in as a minimum. But we'd also want a review of some of the legislations that affects the workplace, like the control of substances hazardous health regulations, the workplace exposure limits, and workplace regulations, just to actually, they need reviewing, because although they do provide some protection, given that this has now moved forward as such an important issue, we feel that they do need to be looked at again to ensure that that protection does exist. Because, for example, an obvious hazard would be diesel exposure to diesel fumes in the workplace, which is a very prevalent problem. We don't feel that currently the legal standards around that are sufficient. And so, that's an area where we'd certainly want to be campaigning nationally as a union to be trying to make sure that those improvements were put in place.
I'm going to unmute myself. That's really helpful insight. Thank you, Graham. And I'm going to come back to William now, because this is resonating with some of the work that we've been doing with Zehnder Clean Air Solutions. So, William, I'd be interested to hear your thoughts following the work that we've been doing to shine a light on industrial workplace standards. You could tell us a little bit more about some of those findings and what you think needs to change in the industrial sector to address air pollution.
I mean, to answer your question, does it resonate? Absolutely, absolutely. It rings true from what we hear from customers and from their staff in that environment. I mean, hence our white paper. We're doing a white paper with Global Action Plan at the moment, and we're chapping at the door of government with a big stick and to businesses to understand where they're actually at with this at the moment. So, I mean, we launched this at the end of October, and we'll be holding a webinar on the 5th of November on this white paper. And to give you a little sneak peek or insight into that, we all know workplace exposure limits, but we tend to find that some of the businesses lack the knowledge, and this is to pick up on Graham's point, they lack the knowledge to manage the air quality within the limits, or the enforcement is not always adequate. So to give you that example, right, the World Health Organization, they have a limit of no one should be exposed to more than 50 micrograms, an average of 50 micrograms of airborne PM10 particulate over an 8-hour period. Now, the UK standard is 200 times that level, right? Now, that's not been reviewed since 1984. Okay, now we want government to review this on the wells and the particulate level, but we're saying to businesses, don't wait for government. This is a good thing to do just now, and we're actually encouraging them to look at it as an opportunity, not just from a compliance point of view. It doesn't have to be always from a compliance point of view. Businesses, I mean, they're spending money, they're spending time, they're spending money, and they're spending energy and resources on managing dust and fumes in the workplace. I mean, if people breathe it in, if the dust falls on the floor, they have to manage it. If it falls in a machine, they have to fix it. If it falls in a product, they have to remake it. So, I mean, these businesses are looking at the effects rather than the causality. So if we take the airborne dust and contaminants or airborne dust and fumes and remove them before they affect the health, which is always number one, I think, and also it can be economical for that business, then, I mean, it's going to be beneficial in the long term. Now, as we move forward into a post-COVID world, I don't know what that looks like yet, but there's an opportunity here to rebuild businesses efficiently in a more sustainable way. So to answer the question, does it resonate? Yes. I mean, my personal experiences, I've worked in this business for the last 5 years with some of the blue chip companies, and when they understand what poor air quality is, they make positive change when they understand the impacts it's affecting their business. And what you tend to find is they become passionate and they talk about it, just as I am, and that filters from top down. So to answer your question again, does it resonate? Wholeheartedly.
Great, thank you. And I can tell you're very passionate about it. And yeah, I can't believe the standards haven't been updated since 1984. That's food for thought. Yeah. Andy, I'd like to bring you in here. At Canary Wharf Group, you're working across a range of workplaces, residential, offices and retail. So what are your thoughts on the build side of the workplace? How can the design of the buildings and the materials used help to optimize pollution reduction and mitigation?
Yes, thank you. Yeah, a lot of people have talked about the impact of poor air quality and a lot of the causes, but there are, when you're inside, there are a lot of sources of indoor air pollution, from the CO2 that we breathe out, but also from the kind of the paints, the carpets, the soft furnishings, the furniture that you install within a building will all off gas and be causes of pollution. But then also things like the cleaning supplies or the print room, etc. So good design can help mitigate those sources of contaminants and either remove them or reduce them from the occupied zones. So it's about kind of thinking right from the outset about how you can design the floor plate or the areas to remove those sources of contaminants. So examples as the print rooms or garages, or for, you know, in car parks, etc., try to separate out the office areas to, you know, the sources of fumes and car exhausts. But it's also about having good design specifications and good design briefs for the material choices. So ensuring for paints, it's low VOC paints. And, you know, a lot of these material choices don't have a cost or a color or an aesthetic or a performance variation, because there are now so many low VOC or low impact material choices out there now. but you still have the poor performing options out there which people fall back on because they don't necessarily know the difference. So it's about spending the time. If you strip it down from Canary Wharf to doing a home renovation, it's just taking the time to turn around and look at the paint tin or the sealant or the adhesive or whatever you're going to use, and look at the VOC quantities. But yeah, so at Canary Wharf for us, it's about having a healthy materials brief, and in which we go out to all of our trades, making sure that they take that on board. And so from literally the ground up, making sure that we're not using harmful materials, or, you know, and it's not just what you see, it's not the paints, it is the underlays, it's the adhesives that stick your carpet tiles down. So you have to think about it right from the beginning, rather than just when you get your painter and decorator in to do the finishing touches. I would add to that though, that you then need to spend time airing the building out afterwards. So similar to when you paint your home, you leave the windows open, there is still a portion of that when you're designing, you know, 50-story towers like the ones that we have at Canary Wharf as well.
Great, thank you. And interesting that you're asking suppliers to consider the sort of emissions content of their materials. How easy is it to source lower emission products?
Very. There are a very small number of instances, so like intumescent paints, which is a type of paint that when your structural steel is in a fire, the paint expands and provides a protective, supportive barrier to it. So things like that tend to be quite nasty stuff, but they're there for a purpose. But they are usually installed kind of 6, 9, 12 months before you actually get to the fit out. So by that point, they would have off-gassed. But when you start to look at the internal kind of core areas, cost negligible, and it's just a question of kind of working with them and engaging with them to make sure you're making the right choices. It might mean you have to use a different plasterboard supplier, so you can get a different mastic or sealant to go with it. But there's not a cost impact, it's just a, you know, upfront engagement impact. But there are so many solutions out there now, a lot more so than 5, 6, 7 years ago, when, you know, this wasn't as big an issue at design stage.
Excellent. So it's just about asking the right questions at that design stage. Super. Mark, I'd be interested on your thoughts on this in an office workplace context. Obviously, choosing the right materials at build stage is important, but what do businesses then need to do in terms of sort of managing that office environment? What do you think businesses need to do to address air pollution in the office?
Yeah, so I mean, quite simply, ventilate it and understand the benefits of sort of doing so. If you look at the building regulations, they tend to be pushing an increase in energy efficiency, which result in new buildings to be very airtight and stop that sort of heated, cooled air from leaking from the building and wasting energy. And this needs to happen, of course, to reduce the amount of carbon our buildings generate. But the byproduct of that being is we're keeping all of those indoor pollutants trapped in the building itself. And then you've kind of got the flip side to the building regulations that are more focused on the new build, that are looking at older building, when we're looking at older buildings. And that's a huge percentage of the building stock for offices in the UK. And quite often the sort of the ventilation strategies that are used within these properties will not probably be effective compared to what they were designed for originally. So one strategy that's sort of been required to change over the past 6 months is to kind of open up windows where available. And that's been kind of great when it's been warm outside, but what about now when it's getting a bit colder? And another example is, you know, I often see an old office with no air conditioning that gets overheated in the summer, and then it gets the air conditioning installed and all the windows that they used to open now close. Other things sort of happen in offices, you know, you see a rise in density in office in density of people, but obviously not at the moment, but previous to where we are now, that was happening. Photocopiers being installed next to people, cleaning schedules changes, that's obviously relevant now. Adding in partitions, changing layouts. So facilities managers need to stay alert of these changes and make their buildings to ensure that they can meet the ventilation demand. And furthermore as well, we're kind of living in this point of a growing urbanization. So when we're looking at all of these different things and we're kind of thinking about designing the buildings today, they could be quite different in quite a short period of time. And a new building as well, you know, a new building going up next to another one could potentially block the air pressures around it, therefore not being able to naturally ventilate the building as it was first designed. So I suppose moving on to the kind of solutions, generally there's kind of two ways that you can ventilate, naturally or mechanically. So naturally you're using no energy to move the air, but you're relying on air currents and differences in pressure from inside and outside. It's quite hard to control, but if designed, it proved really effective. Mechanical is using more like a low-powered fan to move the air, extracting and supplying simultaneously, and usually in a steady continuous rate, which can also be boosted. And also on these type of solutions, you can also add in heat recovery, and this reduces the impact of how much energy you waste to outside. You're trapping that. So I suppose as a final sort of summary, I think mechanical ventilation can ensure effective air changes at all times, and considering sort of 3 steps. So sort of step 1 being extract that indoor air, with that sort of inside air being between 2 to 5 times more polluted than outdoors. Logically, extracting it out should be the first port of call. Step 2, introduce some fresh air. Replace that stale air with new air from outside and create a balanced system. Introduce some better filtration for the air as it enters into the building itself, and potentially adding a localized air purification system, which I think Alexander's going to talk about a bit later. And then thirdly, recover the heat. So try and reuse much heat as you put into that building to keep it comfortable as possible out of that outgoing air. So they're kind of the 3 steps, and it doesn't mean that we shouldn't prioritize the cleaning up of air pollution and air outside. Absolutely not. The need for clean air does not change whether we're inside or outside.
Absolutely, great. Thank you, Mark. And yes, source reduction first, and then exposure reduction and getting rid of the stuff through all the methods you suggest second. Great. I am going to move on to you in a moment, Alexander, to come back to our home office situation. But just while we're talking about ventilation and so on, we have had a question on the Slido, which I think I'm going to ask now to you, Mark, because it links. With the current situation with COVID-19, if I have air conditioning in my office, should it be turned off if I do not have any ventilation equipment?
Okay, so with regards to air conditioning, I suppose there's been various bits of guidance that have been published. Health and Safety Executive, as an example, recently stated that the risk of spreading coronavirus via air conditioning is extremely low, given that there's an adequate supply of fresh air and ventilation. So the need for fresh air and ventilation in any space, whether it has air conditioning or not, where multiple people are occupying, should be the consideration that you're making. There's lots and lots of guidance around this from the likes of BISA, CIBSE, ASHRAE, REVA, and you know, if you're thinking about the sort of steps that they're looking at, of generally it's understood that the risk of transmission outside is a lot better than inside. So if you can make your inside as good as outside in terms of the ventilation and the fresh air, then that's all the better.
Can I quickly add to that? So
yes, please do.
From a Canary Wharf perspective, we're encouraging our tenants to ask us what our maintenance and management regimes are for our air quality systems. So we're increasing fresh air rates to near 100%, and we're ensuring that all the filtration is changed regularly and communicating that, because there is, like you say, or like this person has asked, that the perception that air conditioning is just recirculating all the bad stuff, but actually what it's doing is filtering and pushing good quality air into the space. So yes, you need to be aware what's your freehold or your managing agent's doing, and we should be asking those questions of them to make sure they are following the advice that Mark's recommended.
Lovely, thank you. And it's yeah, it's interesting, isn't it? HVAC has sort of been it just goes on in the background and no one's paid any attention to it, but suddenly it's the question that everybody wants to know about. Right, let's move back to the home environment, and well, the home office, where so many of us are working these days. And as the nights draw in and the weather gets colder, fewer of us are opening those windows. So Alexander, coming to you again, for those of us working at home with little opportunity to do things like change the build, What are your top tips to help home workers improve indoor air pollution, to help protect our health and productivity in this environment too?
Yeah, first I would like to frame that a little bit, because I think people's home are mostly where we don't have so much data as company or studies is mostly carried out on public spaces and offices and these kind of things. So, and we talked about this, it's normally 5 times more polluted. And how bad can it be at home? So I think this can differ, and I will draw a little bit of a parallel to what we do know. After having donated hundreds of air purifiers to schools in need in the UK as a part of our Clean Up for Children program, Blue Air have measured air quality in several classrooms before and after installation of air purifiers. And we found out that some of these schools had up to 40 times more polluted air in the classroom than on the street outside. And of course, this is really terrible. Not all the classrooms were this bad, but in general, it was really surprisingly bad. And this condition is often related to the building standard and especially poor ventilation, as we heard former speaker talk about as well. And therefore, I mean, this you can also link into people's apartment and also houses. With substandard ventilation, like for example, old Victorian building, you need to make sure to look into your ventilation system as a first step. And I will come back a little bit on that. But what we did in the schools, after installing the purifiers, we reduced 98% of the pollutants in just 1 hour in the classroom, and also keeping the pollutant level at very low levels and safe levels. So I think that investing in an air purifier is definitely a good investment to improve the indoor air quality at home or in other places, preferred destinations. And I mentioned the ventilation earlier, and I think that is the foundation to good air quality also at home. It's super important. And if you don't have a good ventilation system, and sometimes you maybe rent and the landlord don't want to do anything, or you have a house so you don't want to rebuild the whole house, I think to open the windows and do short natural ventilation breaks throughout the day if you're working at home, that is a good thing. And you don't need to have it open for half an hour now when winter comes. You can open it a couple of minutes, a couple of days, a couple of times during the day, and that will do a good job. Of course, you should not open it in rush hour if you live next to a busy road, but I think that says itself, right? And then, of course, you should clean your home regularly, vacuum frequent, wet wipe floors, surfaces, regularly wash beddings and other textiles, super important also to keep pollutants away. You can also avoid unnecessary chemicals and the use of use also natural cleaning products when that is suitable. So in order to give yourself the best condition when working from home, you should follow the recommendation, and I think also, you know, invest and put out the air purifier in the room there where you spend the most of your time. So, you know, you don't need to buy for the whole house if you have a big house. You can buy for a couple of rooms where you actually spend most of the time. So that's a good starting point. Also want to make a short recommendation when looking into buying an air purification system. You should look out for a high-performing system. There are several good ones on the market, but also a lot of brands that overpromise and under-deliver. So important to look for the CADR value on the unit. And I think CADR is a global leading third-party standard on performance for air purifiers, and it takes in consideration how much clean airflow a unit can give you in a given time. And I think that basically that's the thing that's important for you.
Lovely, great, thank you so much. So we've had a range of questions come in while you've all been talking. So I think I'm going to group them together, and then you can choose which one you want to address when I come to you. So there's a few here. So firstly, what do the panel think about the influence of outdoor air pollution when cleaning indoor air pollution, for example, more mechanical ventilation? Are we just moving the problem? So you may choose to pick that one. There's a very specific one for Mark, but anyone else could answer it. Would a purifier work? And another one I'll take, I work for a law firm in the corporate responsibility team. Are there any resources or advice I can use? And I will save my plug till last. So I think we will start, I'm going to do this in the order of William, Mark, Graham, Andy, Alexander. So William, to you first.
So yeah, I mean, to answer the question, yeah, air purifiers would work, but I mean, indoor environments, ideally you're looking, our background is based on manufacturing and the logistics sector. So primarily we are tending to find that indoor air pollution as opposed to outdoor. There's specific, which Mark would probably touch on a bit better in terms of my knowledge in that spectrum. But yeah, air purifiers would work. I mean, if you take the subway or anywhere outside that they're looking at and you had air purifiers in these environments, yeah, you can certainly make a difference. It just means that there's not a one size fits all solution, I suppose, but there's guidelines that you probably have to look at in order to actually get the right balance of what you're trying to achieve.
Yeah. Thank you. Graham, coming to you. Do you want to pick one of them? If there's any advice or resources available on purifiers or the question about moving the problem?
Yeah, I think it's a very good question, because of course it isn't one or the other, is it? That you know, when we're talking about outdoor pollution, that can have an impact indoors and vice versa as well. So I think, you know, it brings us back to the issue of monitoring and how important that is. A problem for me, I think, is that this monitoring isn't taking place at the scale that we need it to in order to get a full understanding of the problem, because, you know, you can apply a risk assessment process to this, but unless you're aware of the exact nature of the hazard, then it's going to be a bit limited in terms of your response. That brings me on, I mean, one point that I think, you know, certainly Toucan have been arguing for some time now is that, you know, if you're looking at capacity on monitoring, then you could argue that you could look at some job creation around this as well. And we've been calling for air quality apprenticeships for some time. And I think it might start to get some traction. There's a lot more work needs to be done about what you put in place for that. But if you had certainly at local authority level, as well as large companies employing someone with that kind of specialism that could make themselves available to workplaces to do the kind of measurements and monitoring that we're talking about, that would be, you know, a massive improvement and also a job creation issue as well. On the subject of monitoring, I could add that Toucan have purchased an air monitor in conjunction with Global Action Plan, and we're, you know, at a very small level starting to look at how we can support safety reps in workplaces to actually do their own monitoring as part of a, if you like, worker or citizen science activity, to then be able to present the results to the employer in the absence of the kind of thing that we'd like to see at full scale capacity.
Great, thank you, Graham. And clean air apprenticeships, what a great idea, and something to build into the promised green recovery. Mark, coming to you, which question would you like to pick up?
Yeah, sure. So I'll touch on a little bit on both, but I suppose from our point of view, there's probably a hierarchy of air purification, ventilation, obviously getting it right outside first. So air purifier work, yes, it does work. It's not going to reduce the CO2 levels, which are an important thing, obviously, internally in the space, and that's what you get from the ventilation. But I'm sure Alexander might have more detail on that. But I suppose the influence of outdoor air and indoor air, I can talk a bit more about. But typically, outdoor air, if you are considered, there's many options to add filtration onto your incoming air systems. Whether that be some sort of a simple filtration that's just taking out particulates, small, relatively large particulates, through to kind of HEPA filtration that takes out lots and lots of different things, active filtration, carbon filtration that takes out NOx. But again, picking up on one of Graham's point there, the monitoring. So you can get active monitoring systems that kind of monitor indoor and outdoor air and choose, depending on which one's the best, as to how modulate systems between the two, looking at elements such as CO2, such as particulate matter, etc. So there are options that can be included on systems.
Lovely, thank you very much. Then I've forgotten what order I said I do this in. Andy, I think we'll come to you.
Perfect, because I want to once again add to what Mark was saying. I think filtration is key. I think going back to design of a building can really help as well in terms of where the air intakes are. So if it's next to the polluted road, then your filters can have to work a lot harder than if your air intakes for a building at the top of the building. But then once again, going back to kind of challenging your building managers, it's not just having a filter in there that's got bunged up and hasn't been touched for 6 months. It's about making sure they're going and checking and replacing it regularly. It's both how coarse or how fine the filter is, but then it's also about how often it's replaced. So, you know, you could have a HEPA filter that filled up 3 years ago and then has just become useless and making your systems work harder, or you could have a really good management system in place to make sure it's running efficiently. And then the measuring and monitoring thing, I completely agree. At the moment, it's either far too expensive, or you can buy £100 monitor online on Amazon to get it delivered next day, which is basically just like a children's toy. So there needs to be a better balance and more regulation in terms of what you should be using to like prove good indoor air quality. And I use both of those. I use the £5,000 and I use the £50 versions in the office. But yes, I think that is the next step in getting more measurement and monitoring out there for the masses and transparency around it.
Thank you. And then Alexander, I will give the last word to you. So pick a question and round us off.
Yeah, and I think I can answer a little bit on the air purifier. It do work. I mean, we have a lot of data to provide that it do work very effectively in the indoor air. I mean, an air purifier outdoor, that is also something that is tried out in different locations in Europe and also Asia, where I've seen, but it's highly inefficient outdoors. It's more of a gimmick then, because it can not really. So you need outdoor. You need to go to the source and come to right with that. But indoor buildings, air purifiers do work fantastically, and also in combination with ventilation system, it's of course key to protect yourself. Also, I can recommend, if you some years ago we developed a pretty cool service called AirView. You can have a look at it, airview.blueair.com. It's a free service there where you can type in your address and you can see, visualize what kind of pollutants is in real time at your doorstep, outdoor of your home or office, or at wherever you want to see.
Thank you, Alexander. We will have a look at that. I'm just conscious the next session is going to start, so I'm going to have to round us up. So the words I've written: standards, monitoring, ventilation, filtration, purification. And why are we doing it? For health benefits, productivity, and job creation. I should say a couple of the things that we mentioned in terms of resources. We do have the Business for Clean Air initiative. It's just Google that, you'll find it, Business for Clean Air. It's a movement, growing movement of leading companies who are pledging and acting to become clean air businesses. So join that. And we are going to be putting out a white paper with Zender Clean Air Solutions, looking at industrial air quality in the workplace. So please do follow Global Action Plan on LinkedIn to find out when that is launched and come along to the webinar. So thank you to the panel today, William, Mark, Alexander, Graham and Andy, and thank you all very much for listening. I'm therefore going to end our Clean Air Workplaces for Healthier Employees session. It's been great, but we are now nearly at the end of the Clean Air Day Live bonanza, and really what a day it's been. So I'm now going to join Chris Large, the co-CEO of Global Action Plan, to reflect on Clean Air Day 2020 in our online celebration event. It's time to find out what's been going on outside of our virtual platform across the country for Clean Air Day. So this next session is described as feel good about being part of the action, toast your own success and share your Clean Air Day stories. So in order to do that, I need to just go and quickly grab a drink to toast with. So Chris, over to you to start proceedings. And
hi, Larissa. You can have a quick break to just fill up your glass. Welcome everyone to the celebration session. I have my lovely Clean Air Day face mask stroke snood, which I'll take off because you won't possibly be able to hear me with that on. Well, what a day it's been today. And now is just a half hour of fun reflection on what we've seen today. And it's been incredible. I'm blown away with the activity, the amount of activity that people have made happen, especially given that this year's Clean Air Day is a slightly different Clean Air Day to normal. We are obviously in social distancing situations. We can't have as many gatherings as we normally have. And it's the first wet Clean Air Day. They've all been glorious weather until this one. So I'm delighted that everyone still got on their bikes and got the kids to school by walking today, even though we had a wetter and windier day today. So we're going to look at what's been taking place around the country for the next half hour, and what's been happening on social media, and which figures have got behind the campaign this year and what they've had to say about the importance of clean air and the solutions that are coming down the line for this air pollution challenge. And I first wanted to just reflect on why we do this. Why do we at Global Action Plan? Why do our funders want us to do this? And why did you, most importantly, make the Clean Air Day campaign everything that it is? And I think there's really two main reasons why we do this. As campaigners and activists, as businesses and members of the civil service and the health service who get behind this campaign, we spend so much of our time analysing the problems, figuring out what's causing the air pollution problem that we've got, and trying to find ways of making it better. And we spend so much time dwelling on and rightfully figuring out what is it that we can do that's going to make this change happen faster and most comprehensively. And today is just one day where we focus more on what progress has been made, and we celebrate that we make progress and that we can see the difference to the quality of the air when we make progress, not necessarily visibly, but through the air quality monitoring data that we can get hold of, and by seeing in practice that more people are cycling, walking, there's more electric vehicles on the road, etc. So I think it's really important for all of us who are working on the campaign, all of us in the Clean Air movement, that we have this day where we recognise progress is making. And then I think the day is for one other purpose as well. It's for us in reaching those people that we would like to adopt clean air solutions, the public, drivers, parents, politicians, anyone that we still need to convince to do that one extra thing about air pollution. Today's the day where they get to see that others are doing it, that this change is possible, and they can see the benefits of that change. And so it's vital for everyone that we're trying to convince to not just be told how much change needs to happen, but to actually see it is happening, and it improves our lives in many ways when we do. So we're celebrating progress, and we're celebrating the bringing to life of the clean air world that we're all aiming for. And it does only happen with you, everyone who has been a part of Clean Air Day, everyone who advocates for clean air throughout the year. And I know you come from all walks of life and all ages, and from around the country. And so I'm very grateful that you are all part of this, and that we can do something to help at Global Action Plan. So without further ado, I'm going to jump into our first set of achievements, which is our big numbers, because I would like to raise a toast to this shortly. So I know the team is going to help me with all sorts of wizardry behind the scenes with a very, very rapidly put together presentation of the entire day's achievements. So I'm just going to run through the big numbers now. So we have, as far as we've been able to keep track of, we know at least 200 events have taken place across the country today. We've had 310 news and broadcast features and media articles. And we know that that's reached well over 300 million people. And it's our last check. And we have been trending on Twitter as well. Well done, everyone. All your tweeting, your relentless tweeting has paid off. We were trending top, certainly during part of the day. I'm absolutely sure we were top for a good few hours. We've been competing with some other major events today, including the retirement of the Boeing 747, International Lesbian Day today. There's been a whole host of campaigns also hitting Twitter, and you've got us to be top for a good amount of time. But it's really important that we get air pollution top of the agenda for at least one day of the year. So it's 5 o'clock, not just 5 o'clock somewhere, it's 5 o'clock everywhere. So Larissa, I hope you have your beverage of choice to hand.
I've been waiting for you to do this. I keep wanting a sip.
Been holding you on. So here's a toast to everybody who's performed the wonders of communications on Clean Air Day, and congratulations. And I hope you can all raise a quick toast to the progress that we're making as a movement. Congratulations.
Yes.
I've been waiting for that too. Right. So what I'm going to take us all through, and Larissa is going to reflect on, and because Larissa hasn't seen this highlights reel yet, so this is all a surprise for Larissa too. I'm going to share the highlights of the day, again aided by our tech wizards in the background. So I'm going to start with the serious stuff, and we have had a great piece in the Times Red Box today from a joint ministerial piece from Minister Shapps and Minister Sharma at DFT and Bayes Department for Business, Energy and Industrial Strategy. And this is a fantastic celebration, exactly what we want to do with Clean Air Day, a fantastic celebration of the progress we're making. Okay, I know we're all eager for more, and we know everything's not perfect in how we're making change happen, but I think it's important that we pause and celebrate the progress that we make. So Larissa, I'll read you the list of highlights that the ministers picked out, and perhaps you can reflect on perhaps why this is important and where next. So the highlights that the ministers picked out were that we have had a huge increase, up to 300% increase in active travel during the recent coronavirus lockdown on some days. And that has led to a reduction in nitrogen dioxide levels, almost half in some roadside monitoring stations. We have got now more charging points on the roads than there are petrol stations. We have an ever-increasing sales market for electric vehicles, and EVs being a higher percentage of the vehicle sales market. We have more children getting cycling lessons. We have 2 billion invested in cycling infrastructure. Certainly, I've noticed around London, the amount of now protected space for cyclists and pedestrians is fantastic. We have the consultation underway at the moment on the phase out, bringing forward the phase out of ICE vehicles, petrol and diesel and hybrid vehicles to 2035 or earlier. 2030, please, would be our plea. We also have the first ever hydrogen powered train on the rail network, and we have the first hydrogen fueled dustbin lorries on the roads in Scotland as well. So I think a celebration of some of the technology solutions that are coming down the pipeline. Larissa, what are your reflections on hearing that list?
Yeah, it resonates very well with the sort of conversations I was having with the local radio stations today, actually, because I think everybody's realised this year during lockdown that, you know, clean air doesn't have to be a fact of life, and actually people much prefer it when the air is cleaner. That's been a real theme coming through. So people do want action, and I do feel there is a greater sense of urgency at the moment to make this change, and you know, we are making progress, but there's obviously so much more that needs to be done. But at this sort of, and I know I keep saying it, but it's true, this is a real sort of moment of societal change. We can play a real part in defining what the future looks like, you know, our new normal, as we come out of this sort of coronavirus crisis, as and when that is. But we can sort of define, I think, what our future looks like, and, you know, build back cleaner air. We don't have to go back to some of these filthy ways. So it's great to see that coming through as a theme and some of the action that's happening. And across the country, it's a change that people want to see happen. So that's a vital point. Really,
I think, Larissa, that people do want this to happen. That's what all the polls say. They want clean air, they want lower traffic and lower congestion. And it's an important issue for them. It's not number 20 on a list of things. It's quite often in the top 5, sometimes in the top 3 issues, depending on the community and the air pollution problem it faces. So I think really important that we are seeing serious action on this topic, and policymakers are understanding the importance of action. As I said earlier, we're all impatient for more. We all want more investment, and we would like ever closer collaboration amongst the government departments to really have one mind and one vision of a clean air future. But it's good for one day to see everything that has happened over the last year in terms of those technology solutions coming forward. Now, we're going to move on to the media that we've seen today. The media have focused on one major story, which is research from the University of Manchester, funded by the Phillips Foundation, which is modelling that shows that the air pollution levels that we see at the moment are inhibiting the development of children's working memory, which inhibits the ability to learn. And if we could reduce air pollution levels by 20%, that improves the working memory of a child by the development of the working memory of a child by up to 3 or 4 weeks in a year. So it's absolutely vital. Another reason why we should be acting on this topic of air pollution. It's not just about children's lungs, it's also about their ability to learn. And what, obviously we've been working on this research at the University of Manchester. And what we've put together as a result is the Clean Air Schools framework, which is the one-stop shop where any school teacher, head teacher, governors, the local authority can answer the question, what is it we should do to protect our school? That is not always clear. And so there is now a tool available for free online, the Clean Air for Schools framework, where schools can go through and answer that question of what they can do to protect their students that makes the most difference. And I'm gonna whiz through this all really quickly because we've got so much to get through in this half hour. So I'm gonna move on to what the young people themselves have been doing. Oh, you can see all the media here. It's been covered from the Times, Telegraph, the Daily Mail. This story has really caught the imagination today. And I think it's, I'd say, another reason why we should be acting. The kids have been showing us today how it should all be done. Starting this morning with education, the kids have been getting themselves educated on the subject. We've had the Westbury-on-Trim Academy in Bristol, who ran the virtual assembly at the start of Clean Air Day live today, led by the irrepressible Mr. Patterson, still wearing his shorts. I can't believe in this weather, must have been warm in Bristol. And we've had activity in other schools on the education front, the Chapel Hall Primary in North Lanarkshire, making their comic strips and banners. We have Class 3M in a name that I'm going to get wrong, Ustrad Minak Primary School in Carefully. Where's Martin when you need him with the Welsh pronunciations? The theme of education is always popular on Clean Air Day. Well done to the schools getting involved. We then also have been seeing the schools take action and trying to reduce emissions. We've had the so many schools taking action on getting out of the car and getting to school on a bike or by walking. So here we have the Bannister Primary in Southampton, who had their Bling Your Bike competition. We've had pupils in Levenshulme and Gloucester making their way to school through the rain today. It hasn't deterred them, and they've been getting there without the car. We've also had them taking a step further and actually closing the roads. Some schools working with our friends Environmental Protection Scotland with the nice branded face masks, who have had school streets taking place. We've heard about school streets today during our Clean Air Day Live, and it's so great to have such safe places for parents to be able to walk the kids to school, not worry about the cars whizzing past in the road, and be able to have that bit more space as well, as we're all thinking about social distancing. And finally, what the young people have been up to is also raising their voices and calling for adults to do more. We think this is an absolutely vital part of the equation for schools, because perhaps schools could reduce pollution by 20, 30% of the emissions that they're faced with by reducing the school run, by tackling things like the way that the boilers work in the schools. But there's that background pollution from the local busy roads, from industry, that will only come by action by others. And I'm so overjoyed when I see young people who decide to take matters into their own hands, which we have been doing throughout this year as well, including with schools working with the FIA Foundation to take the message to car companies and to be asking car companies for the clean mobility options that will mean their family car is not causing pollution while they're driving around in it. That's an exercise also that any school can do by downloading the toolkit. You can get that from our website or the FIA Foundation's website. It's called the School Run Scandal toolkit. And as I mentioned earlier, the Clean Air Schools Framework, you can also download that from our website. Just Google Clean Air Schools Framework, Global Action Plan, look at all our website. You'll find this very easily to hand. So Larissa, another enormous amount of effort going in from young people this year. As a mum of kids in an inner city location, what do you think is most important for the school community to come together to do?
Gosh, it makes me feel quite emotional seeing all this and all the activities that all the children are up to. And my God, I think today is really the wake-up call to really take air pollution around schools seriously. I mean, if the health evidence wasn't strong enough, the fact that we can now show the impact that it's having on educational attainment, that we need a concerted effort to really focus efforts to cut air pollution around schools. I mean, these are our future generations. These are, our future. It's our future workforce. We need them to be healthy. We need people to be educated. It's no good if we're poisoning children. So, I'm delighted that the case is strengthening and that schools are taking this action upon themselves to do it. But there's only so far that a school can go. So I look forward to seeing more concerted effort across the board to really focus effort around schools to cut air pollution and improve children's health and educational outcomes.
And segueing back to adults and what we should all be doing about this, I think there's a really interesting phenomenon going on at the moment with the change in where and how we all work. And I just wonder what the possibilities are for that change in working from home more regularly, or perhaps working from a local location, a local remote office, rather than traveling a long distance to get to work. I wonder what that can do for the school run as well. I believe that the Sustrans last survey was that 30% of people who are driven to school are driven by someone who's driving to work. And so there is that connection. Perhaps if we see people more regularly working from home, they have time to do the school run without driving, if they're not then rushing off, whizzing off to get to work. And I know we've had people doing that today, making that their pledge for Clean Air Day to continue to do that in the future, parents making that pledge. Now, we are going to move on to our UK tour to see what's been happening around the country today. And we have had activity absolutely everywhere. So again, I need to whiz through this rapidly and let everyone, oh, here is our working from home examples. Andy Watt, you were the inspiration for me thinking about that connection between working from home and being able to do the school run without the car. So the UK tour, we have had a whole host of activity taking place today. We've had, in Manchester, we've had something that you can tell me if I get this wrong, anyone online who can remember their biology training better than I can. There is the story of the peppered moth, which I did learn in my biology, possibly A-levels, I think. And I think it is called a bioindicator. You can tell me if that's the wrong term, that the peppered moth was seen to become darker and lighter when the air pollution cleared up during the Industrial Revolution and when we moved away from huge quantities of coal. And so a good lesson from the past from Manchester Museum, and up in Aberdeen, we've had artists raising awareness of Clean Air Day on the beach. I hope there were people on the beach in Aberdeen today, some hardy souls, I'm sure. We've had York City Council with the suggesting to people they can kick the habit. I like this analogy to kicking the smoking habit, kicking the habit of leaving that car idling or using that car at all. We over to Wales, we have had Leslie Griffiths, the Minister of the Welsh Government for Environment, Energy and Rural Affairs, raising awareness about what can be done in Wales to reduce that pollution and increase those cycling rates. We have had Leicestershire County Council showcasing their solutions, be that bikeability schemes or solar panels. We have had in Aberdeen, the world's first double-decker hydrogen bus has been on the streets today. Then over the water in Belfast, we have got the City Hall lit up tonight in Clean Air Day colours. And back and in your homeland, Larissa, in Gloucestershire, we have got pollution monitoring at the school gates today to see the difference that the school run makes. And we were seeing here a 10 to 20 times increase in pollution during that drop-off time when cars were in use. So it just does show how important tackling that school run can be. Then in Newport, we also have the fully electric buses on the streets today. And I should also give a shout out to everybody who's been running webinars across the country. I know there've been lots going on that I couldn't take part in or even view that we would love to see as we can relax over the coming days. So do everyone else who's been running webinars, please send us the links to any recordings you have of those. We would love to promote those as well for everyone's viewing after this. So Larissa, I'm going to ask you later on for your highlight of that highlights reel. But before I do, I've just got a couple of other things to rattle through, and then we will close up. So one other thing that I think is vital for all of us as advocates to do, and it's vital for us all to encourage the members of the public that we work with, our community members to do, is to give our views when they are asked for. And we have a number of schemes that have been asking us for our opinions today. So in Greater Manchester, we've had the launch of the consultation on the Clean Air Zone plans. In Southampton, we have Councillor Steve Leggett, who's been asking for ideas from residents as to how to reduce emissions in Southampton. West of Scotland Housing Association has asked for tenants' views on their first green strategy. And Nottingham Council has launched its 2020 to 2030 clean air strategy. And it is so important that when we are asked that we do give our views. on these matters, because if we don't, we maybe won't be asked in the future. And also, how can we say we wanted something different if we never asked for it when we were given the chance? So I think it's so important that we put forward our views. And you can also bet your bottom dollar that anybody who wants to see the proliferation of fossil fuel use and the continuation of diesel vehicles, there's a very active lobby group. They will certainly be writing in their views. So I wholeheartedly endorse us all mobilizing as many people as possible to get our views out there to all of these consultations. Okay, final couple of things. I'm trying to start a new trend of Nordic cycling. I don't know if it's a term yet. I'm trying to get it off the ground. I think this is such an important topic as we look to get into winter time. And in Copenhagen, there are swarms of people cycling in all weathers through the snow and the rain and the wind all winter long. We've been doing it today. I've seen so many tweets of people who have been cycling and walking today in the rain. And I think it's so vital that this happens. The power of one person or a couple of people getting on the road in your bike when it's raining, and other people see that, drivers see it, pedestrians see it, and it just becomes a bit more real and possible for people. So I am eternally thankful for everybody who decided to go out and get wet this morning in the rain. And if you want to call it Nordic cycling, please feel free. We'll see if we can get that trending next year. And then we also have a few freebies. There are still some hours that you can grab hold of these freebies if you're in the right place in the country. We have some free electric vehicle charging sessions that I know are certainly taking place at least in Lambeth and Waltham Forest and Hounslow and Doncaster. So if you need your EV charging, you can get it done for free in the rest of Clean Air Day. I know there's also been some offers to have free cycling with Next Bike Hire and in Malden with e-bike trials. So great ways there you can trial new ways of getting around at a lower level of pollution. And finally, what we have to have every Clean Air Day is animals getting in on the action. And this is my favorite use of a Clean Air Day snood, and also some porcine activity for the first time, I think, on Clean Air Day, with pigs getting in on the act, helping with biodiversity as well as clean air in the forest. Now, Larissa, before I wrap up, what is your highlight from everything that you've seen today?
Yes, that's such an unfair question, and I really actually can't pick one, but my highlight of the whole campaign, I mean, we at HQ do our best to provide useful resources, provide that stimulus and hook for a national campaign, but we never really know what's going to happen. And just my favorite bit of Clean Air Day is just that when that stream of images from across the country, when we start seeing what all the supporter organizations or the participants are doing, just what everybody is up to, I just find that so so exciting. So really, that for me, that's the highlight. It's just all those, knowing that so much activity is going on around the country and that so many people want this change. So I find that really exciting, and I think that just adds to the urgency and my impatience for making this change happen faster.
Thank you, Larissa. I totally agree. And I've two notices before we before I do a quick wrap up at the end. The first notice is, of course, an enormous thank you to all of the partners and sponsors that enable Clean Air Day to happen. It's a growing number of organisations who are behind this and enable GAP and the team to do all the hard work and help things like the University of Manchester research to happen. So thank you to the Environment Agency, to the Scottish Government, to the Welsh Government, to Environmental Protection Scotland, who are our Scottish partners in running Clean Air Day entirely in Scotland. Thank you to the FIA Foundation and the Clean Breathing Institute, and to Opinion, who help us with a lot of pro bono opinion polling. Thank you to the Philips Foundation and Zenda. Thank you NG and Zipcar and Mitsubishi Electric. Thank you, of course, to DEFRA and also to Air Quality News, who've been a great media partner joining us this year. I really mean it. I'm so grateful that you enable us to run this today and to enable the amplification of everything that goes on across the country. And it is only one day where we can get air pollution trending, because all of this comes out on one day, all of this takes place on one day, and then we get top on Twitter. So that's how it works. So thank you everyone for supporting us to do it, to do this campaign. We then would also like to share one final event which is coming this evening. And I can guarantee you it is much better than logging onto Netflix. Tonight you will have a much more educational, informative experience if you can log on to our final evening session, which has been curated by the team at the University of Birmingham. And if we had all been able to meet up, this would have been our Midlands celebration event taking place tonight. But we've gone virtual as befits the times. There's an absolutely stellar lineup tonight. We have Professor William Bloss, Councillor Wasim Zafar. We have Claire Maltby, the England Director for Sustrans. We have Ali Bell of National Express, Shivaji Shiva, who is a partner at the law firm VWV and also co-founder of Cycling Works for Birmingham. And Professor Hisham Mehenna is introducing the session, which will be chaired by Professor Rob McKenzie. An absolutely stellar lineup, and I do hope as many of you sign in as possible for that this evening. It's a slightly different channel, so if you go to Clean Air Day Live, you will find the link to it, and the link is on your screen right now as well. And I'll be tuning in when I get home back from Global Action Plan HQ. Now, there is a lot we can do year round, and I do just want to do one plug for continued engagement with Global Action Plan. We are so concentrated on solving this air pollution problem. There is an enormous amount of work that my team do throughout the entire year, and you can find a huge amount of resources to help you, whether you're a council, a business, whether you're a school, a campaigner or an advocate, whether you're a local NHS trust. There are a whole heap of resources. The best place to find everything is either at the Clean Air Day website, which is cleanairday.org.uk, the Clean Air Hub, which is a one-stop shop for everything the public needs to understand about air pollution, and that's at cleanairhub.org. And also, if you just go to Global Action Plan's website, you will find great links, globalactionplan.org.uk. So I just want to give you my final thoughts as we close. And I think today has made me feel really hopeful. Possibly more hopeful than I've been for a while. Really hopeful that we can overcome this problem. We see that there's an ever-increasing array of evidence telling us that the impacts of these pollutants are vile and disastrous for people's lives. But we also see more agreement of the need to change and far less objection that we have to tackle this problem. We might have some disagreements on exactly how we do it, how we should best remodel our streets to improve cycling and walking facilities and to minimize traffic. But what I do know is that we all do want to minimize that traffic. The public opinion is with us, and I know us all as campaigners want to see those changes. So whilst we might have different thoughts on how we get there, I know we're all committed to getting to the same place. So from central government down to school children, we do have one common aim. And we've also seen increasing evidence that the technology solutions are appearing, they're available, and we're putting them into practice. And when policy changes like the ultra-low emission zone in London are put in place, they lead to improvements. And we've seen fantastic evidence coming out over the last week on the number of people who've been protected from living in illegal levels of air pollution due to the policy measures that have taken place in London. So we've got almost universal agreement on that common goal. We can see that the solutions are increasingly available and that when we put them into place, they work, they really work. So I'm extremely hopeful that if we all continue with this push, our efforts will be rewarded with clean and healthy air for all. So I encourage us all to keep this effort going year round. And so my final word is just thank you for the team at Global Action Plan. I can't name everybody because there's far too many to name who are all behind this, but I'm extremely grateful to you all. Thank you very much. And thank you, Larissa, for everything that you do. Thank you. And do go and check out that evening session tonight. It's better than Netflix. And join us all throughout the year as we keep taking action on air pollution. Thank you everyone for joining us today, and good evening. Cheers, Larissa.